Welcome to Mental Health America's 2020 Annual Conference. I'm Peter Carson, Board Chair of Mental Health America. Each year, the Mental Health America Annual Conference brings together our MHA affiliates, community stakeholders, peers, caregivers, providers, government officials, media, and more from across the country to discuss important and emerging mental health issues. When this year began, who could have imagined the events that have challenged the global community and governments, businesses and nonprofits, and each of us as individuals? And we certainly could not have imagined that our annual conference would be taking place virtually and in September. But here we are, and we're ready. As the pandemic has spread to every region of our country and every corner of the globe, we have seen an increase in anxiety, depression, and suicidal ideation. The mental health effects of COVID-19 are as important to address as the physical health effects, but we also know that not everyone has equal access to care. And for the 1 in 5 who already have mental health conditions, or the 1 in 2 who are at risk of developing them, we need to take personal, professional, and policy measures now to address them. And we need to do it in an equitable way. COVID-19 brought to light what many in the healthcare and social justice communities already knew, that Black, Indigenous, people of color are disproportionately impacted negatively and are dying at much higher rates. Adding to that, the systemic racism that so many people of color bear every day, the trauma and mental health implications are significant. The last few months have indeed forced all of us to change how we behave, and the world is contemplating what a return to normalcy really means. From increases in depression and anxiety rates, to adjusting workplaces and employee mental health, to addressing disproportionate inequities due to systemic barriers and historical adversity, MHA is talking about it. And we are grateful for all of you who have joined us today for these very important conversations. MHA and the tireless work of our president, Paul Gianfrido, and the dedicated staff are reasons why I maintain hope and optimism about the road forward. For all of the challenges we face, MHA and countless other organizations and individuals, all of us in our daily life, strive to find solutions. We will get through this pandemic, but only by asking hard questions and doing the hard work necessary to come out of this more resilient and stronger. We have a rich content-packed agenda for you over the next 2 days with some incredibly rich discussions, important program content, and dynamic speakers who have much to contribute to our dialogue. So with that, let's get started. I'm pleased to now introduce a leader in so many of the issues we'll be covering at this conference, MHA's President and CEO, and my friend, Paul Gianfrido.
Thank you, Peter. And let me add my thank you to everyone joining us today and tomorrow. Thank you especially to those who are helping to get the message out about the challenges to our mental health during this unimaginable pandemic, and to those who have joined actively in all range of peaceful engagement and activity against the bigotry and racism that have undermined our mental health during these horribly troubling times. As Peter said, I'm Paul Gianfrido, President and CEO of Mental Health America. Let's start by being clear. The pandemic isn't just about the challenges to our physical health and well-being, because hundreds of thousands of people have been experiencing serious mental health symptoms since the start of the pandemic too. Since February, MHA has been using its online mental health screening program, www.mhascreening.org, to track the real-time impact of the pandemic on mental health conditions. More than 1 million people have come to MHA to take a mental health screening since the start of the pandemic. The largest numbers have come this summer. Our program has now reached nearly 6 million people with tools and resources to learn more about their mental health conditions and improve or maintain their mental health, and more than 1 million since the start of the pandemic. And it has given us some amazing real-time insights into the population that we have gotten to share nationally and internationally through media outlets including CNN, MSNBC, ABC, NBC, BBC, Al Jazeera, NPR, and the Washington Post, just to name a few. But here's one bottom line. Collectively, between the end of February and the end of July, more than 263,000 people, over and above what we would have expected, screened moderate to severe for depression or anxiety. Screening respondents cite loneliness and isolation, relationship problems, current events, and increasingly financial problems as reasons for their mental health conditions at the present time. And as we approach 200,000 deaths from COVID-19, a quarter of our screeners are also experiencing grief. Young people continue to be disproportionately affected by both anxiety and depression, but different populations are all affected and cite some differing reasons for their concerns. And in something that we believe has been underreported, other severe mental health conditions, in addition to anxiety and depression, also appear to be on the rise. For example, more than 42,000 people have also now experienced symptoms related to emerging psychosis. And most worrisome to us are the more than 100,000 people as of today who have reported regularly thinking of suicide or self-harm. There is no doubt that we are in a mental health crisis, and we can't ignore it lest this become a mental health catastrophe. So we're starting this conference off by talking about COVID-19, isolation, depression, anxiety, all of it. And our first guest knows the realities of these numbers more than most. Dr. Joshua Gordon is the director of the National Institute of Mental Health. NIMH is the lead federal agency for research on mental disorders. NIMH is one of the 27 institutes and centers that make up the National Institutes of Health, the largest biomedical research agency in the world. NIH is part of the U.S. Department of Health and Human Services. Josh became the director of the National Institute of Mental Health in 2016, and he oversees an extensive research portfolio of basic and clinical research that seeks to transform the understanding and treatment of mental illnesses, paving the way for prevention, recovery, and cure. He is also leading, with my friend Patrick Kennedy, a public-private partnership in which MHA and others are participating, for the National Alliance for Suicide Prevention, aimed at building a mental health recovery plan for the present pandemic and future health and environmental challenges. Welcome, Josh.
Thanks for having me, Paul, and it's a real pleasure to address the members of the MHA and others through this virtual conference.
We're so glad to have you here. You know, the work that you're doing is so important, and really during your tenure at NIMH, you have really reached out, I think, in partnership and collaboration with so many organizations like ours. It's making a huge difference. It's helping us all come together as well.
We recognize we can't do this alone from a research perspective or from any other perspective. We need the help of everyone we can get to achieve the goals that we share.
So you've heard my kind of 3 minutes of what I've been seeing, what we've been seeing over the course of the last 6 months. Care to share some of your impressions about what you've been seeing and whether this is different or the same as what you were seeing before?
It's clearly different from what we were seeing 6 months ago. That said, it is consistent with what we've seen in the context of other disasters and epidemics in the past. We're finding that somewhere between 2 and 3 times as many people are reporting symptoms of depression, anxiety, grief, stress, and worry than would be under quote unquote normal circumstances. So as we might expect, we're seeing a great increase in mental health related symptoms. We're also hearing from our mental health care providers that we're seeing increased demand and utilization of those services. And what's really interesting about this particular pandemic is that there's been an explosion in the use of telehealth and other technologies to deliver mental health care, which of course has been really important given the necessity for social distancing that's been occurring to mitigate the effects of the pandemic itself.
Yeah, that is an interesting thing, and I know we're going to have an opportunity over the course of the next couple days to talk more about the changes in telehealth opportunity that's been there. I mean, if there's one good thing coming out of this, it's the increased and improved access to a variety of behavioral health services because we have telehealth available to us now.
Yeah, that's 100% correct. The increase in availability, the increased awareness, the increased degree to which both providers and clients are becoming comfortable with these approaches is a silver lining. There's another silver lining, if we can even call it that, to the pandemic, and that is the kind of conversation that we're having right now is actually happening throughout many different areas of our society. There is a recognition that the mental health impacts of this pandemic are going to be significant. There's the recognition that we don't have adequate access to mental health care in many parts of our society. And we can hope that we can use this increased recognition and build momentum towards an improved mental health care system in the United States.
Yeah, it's really different from the way it was when I just think back to March. Initially, it was all, physical health impact all the time. And I remember we were first asked the question about anxiety by a news media person back in the first week in March. And so we started looking because, as you know, we can look real time at our data from help seeking people and began to see that increase right then. But it really seemed to take off, both attention to this and the mental health aspects on about a 6 to 10 week lag after people began to experience the effects of the pandemic. Would that typically be the case, that we're just a little behind where people are in terms of their acknowledgement and recognition of the physical side of this?
I think it's, well, first of all, the delay is consistent with what we've seen with other emergencies. Whether it's to do with the recognition or rather the other aspects of what's going on is unclear. What do I mean by other aspects? I mean that in the case of threats to one's immediate safety, one's health, one's safety, the ability to get food and shelter, these are the first primary needs that we all have as individuals. Once we've secured those basic elements of safety, then we are concerned for more chronic issues, and mental health is absolutely one of them. So in the early days of the pandemic, I think most of us were concerned with making sure that we weren't going to become ill from the virus, or making sure that our loved ones had what they needed to be able to live day to day. And once those needs were at least attempted to be taken care of or mostly resolved, that's when we started recognizing that, wait a second, now I recognize I'm incredibly depressed, or I'm feeling really anxious for the future, and those needs come to the fore.
Yeah, that seems to be sort of a common experience, and I know that we've seen so many more people who are screening with moderate to severe anxiety that what happens is they initially experience, and in the case of trauma too, you initially experience the event, and it's once the event seems to abate, or the immediate physical impact of the event seems to abate, that's when the feelings of the anxiety or the post-traumatic stress or even the depression really begin to take root and emerge. And I know you've built the case, and as we have, for trying to recognize that early on so that you can intervene early on, because it does make a difference, doesn't it? I mean, waiting too long is going to lead to more catastrophic effects.
That's correct. What we want people to do is be able to recognize the early stages of anxiety, depression, post-traumatic stress, and get help in one way, shape, or form. The earliest symptoms are often best dealt with through typical coping mechanisms: getting enough sleep, enough exercise, enough food, and healthy foods, avoiding drinking and avoiding drugs. The other coping mechanisms that have been particularly important with this pandemic is ensuring that you maintain active social contacts. I still like to say, but I said it a lot in the early days, that social distancing shouldn't be called social distance. It should be called physical distancing, and we should remain socially connected. And there's lots of tools for doing that. And I think, fortunately, people have really taken advantage of that. If those coping mechanisms fail and people start to become overwhelmed by their symptoms, that's when it's important to reach out. And the earlier one reaches out to friends, family, pastors, religious leaders, counselors, therapists, psychiatrists, the earlier one reaches out for help, the more effective that help can be at preventing the worst consequences of mental illness.
Threaded throughout the next couple of days, we'll be talking about some of those coping tools and mechanisms and strategies that people can use for themselves, and also some of the supports that are out there for people to make use of. I was wondering, though, in addition to that, one of the things that I was asked about early on, and I'm a non-clinician, so when they said to me, well, what else should people do, if they're to deal with these worries that they were having, and I would say, don't guess, take a mental health screen, and you can use the basis or the results of the mental health screen to go talk with somebody, talk with a professional, clinician, a family member, and others. Would that be your advice too? You're the clinician here in the room, so I don't want to go against what clinical advice would be, but if those coping strategies aren't working, is it a good idea to just go, take a pressure check on stress, just like we take a blood pressure check and work from there? Or should people guess?
I don't think people should guess. I would myself err on the side of reaching out for help. But most people need some help in sort of trying to figure out if the level of distress that they're experiencing is truly problematic and worthy of more attention. And screeners like what you have on the MHA website can be really, really helpful for people to see, well, I'm experiencing something that's maybe beyond what I might expect at this point in time, and may be causing me enough dysfunction, enough harm that it's worth reaching out. There are lots of other ways to do it, but I think when you use a screener that has evidence behind it, when you can use these things to sort of quantify the level of distress that you're experiencing, it can have two effects. One, it can raise your alarm in case enough to seek out the professional help that you need. And two, it can provide some reassurance that what you're experiencing is not, you're not alone. There's lots of other people who've experienced it enough that it can be described and written down, and that can be reassuring to people as well.
Yeah, and of course that's what our data have shown us. The millions of people, 6 million in the course of 6 years, but 1 million since the pandemic, who have screened are certainly not alone. There's millions of others who are feeling what they're feeling, and I agree. I think that we've seen that the ability to learn about this and just surface it and then be able to talk about it often encourages other people to learn about these signs and to surface them, and also to seek and to give help. And I just want to mention on the side, because many people may not know who are seeing this, and us for the first time, Mental Health America, because we have many thousands of people who are participating here, more than we would typically have at an annual conference. The screening tools we use are not screening tools that we made up or we invented. They are for depression, anxiety, and other conditions, among the most common tools used in clinical settings to screen for depression and anxiety. And as you said, they are all evidence-based. So I did want people to know that, we're not telling people to do something that's proprietary to MHA or, taking a screen. We're trying to make available to people the same kinds of tools that clinicians might use, so that if they do get results and they do want to follow up and get help, they've got a language and a vocabulary to talk to either their primary care doc or a specialist or somebody about what they're going through.
That's a good point, Paul. And I've certainly used some of those same screeners in my own practice when I was seeing patients myself. One of the other benefits of using these tools is that people may not recognize that some of the things that they're experiencing are even due to their mental, to their emotional symptoms. People may not recognize that decreased appetite or decreased sleep are actually symptoms that are related to their anxiety or their depression. They may not realize that the reason why they've been avoiding people or having trouble doing the crossword, which they used to love, might be related to these emotional symptoms. So these screeners can be helpful in that way as well.
Yeah, and that's really important because, again, over the course of this pandemic, we've certainly gotten a lot of anecdotal responses back from people about sleep being disrupted and certainly eating habits being disrupted. And so it is important, I think, for people to draw the connection and to know that there is potentially a connection and then an answer. One of the questions in the depression screening tool that we use is what we'll call the suicidal ideation, suicidal or self-harm thinking question. And it's one of the 9 in the depression screening tool. And one of the things that we have seen, as I mentioned in the opening, is just an astonishing number of people, and it skews young, who are reporting thoughts of suicide or self-harm on nearly every day, either every day of the week or on more than half the days. And in July, for example, just as one month that comes off the top of my head, 17,000 screeners said nearly every day, and 30,000 said at least on more than half the days. I mentioned in the opening in introducing you that the Action Alliance on Suicide Prevention has put together a group that you and Patrick Kennedy are co-chairing, that I've been participating in, that really is aimed at not just broad scale preventive work in the light of the pandemic and as a result of it, but also with a particular eye toward suicide prevention. Could you talk a little about that work and what you're bringing to it and how you see us getting a handle on these numbers of people, particularly young people, who are thinking about suicide or self-harm on a daily basis, and what it is we can offer to them for hope?
Yeah, so thanks for the opportunity to talk about that. The National Action Alliance for Suicide Prevention is a public-private partnership and involves multiple federal agencies as well as all different individuals from the private sector, including some companies, big industrial companies, insurance companies, hospitals, as well as self-advocacy organizations and other nonprofits that are in the mental health space. And its primary overarching goal is to try to stem the rising tide of suicide. As you know, and as I'm sure most of your members know, suicide was an epidemic before the pandemic came along, and it remains a huge concern. And of course, it's probably the worst outcome of mental illness that we can imagine. And unfortunately, as I said, it's on the rise. The recognition that the coronavirus pandemic might add to the many causes of this increase in suicides in the United States led to the desire to form a subgroup of the Action Alliance that's focused on a national response to the mental health needs of the pandemic. And this national response group, co-chaired by myself and former Representative Patrick Kennedy, a huge advocate for mental health services and mental health equity, has been formulating a number of principles that we want to advocate for that are focused on suicide prevention and on the mental health consequences of the pandemic. Some of the things that we're working towards is ensuring that all our partners know evidence-based practices moving forward with which the burdens of these dual pandemics, the suicide epidemic and the COVID pandemic, what resources we can bring to bear that already have an evidence base. Making sure that the expansion that we mentioned earlier in telemental health is able to be continued as the pandemic drags on as an important tool for increasing access to mental health care, and ensuring that providers who are responding to the pandemic appropriately by delivering mental health care are using evidence-based practices. So these are some of the things that we are active in. What's nice about the group is that NIMH can bring the expertise in terms of the research results, what findings we know that are important to think of as we formulate these recommendations, and the healthcare organizations can bring that information and back to their constituents. The companies can bring it back to their HR divisions to demand appropriate mental health care from their health insurers, and the advocacy organizations can work with members of Congress and with other important influencers to push this agenda forward. So it's really a wonderful public-private partnership.
Yeah, and one of the things that I've really appreciated is the breadth of activity and thinking that's on there, but in fact the consistency of approach in moving us. I think for a lot of people, moving us further upstream. I have a special interest in kids and kids' mental health and in prevention and early identification and intervention. And I think that everybody, even those who are primarily late stage interveners, have figured out here, and maybe again another one of those silver linings of the pandemic is people have been figuring out that we're facing the earlier stages of mental health conditions. We're kind of seeing them emerge in ourselves and our neighbors. As we said, even in psychosis, we're seeing this remarkable increase in the number of people experiencing symptoms of psychosis. And so everybody, I think, is kind of giving fairly weighted attention now to the earlier stages. And I know that's been a big push from NIMH, for the last several years. So are you happy about that?
As much as one can be happy about any developments that are happening in the context of the COVID pandemic, the recognition that mental illnesses begin, for the most part, in childhood or at the latest, early adulthood. And that understanding what's going on in those early stages is really crucial, not just to develop new treatments, but also to think about how we might prevent the onset of the worst aspects of mental illnesses. We've been expanding our research programs in that area. It's an area of great interest, but we can only succeed if people are aware that, when things are going a little bit awry, then maybe it's the time to get some help, because then we can, again, try to intervene earlier and have greater success. The research that we've been conducting so far does suggest for many illnesses, including schizophrenia and autism, but also depression and bipolar disorder, that the earlier one intervenes, the more effective and the better that we can be at preventing loss of function in life, and ensuring that people maximize their potential throughout the rest of their lives.
So, I subscribe to the notion, of never asking a question where you don't have an idea about what the answer is going to be. But in this instance, I genuinely don't know what your reaction is going to be to this. And I'm really curious because I do want to ask you about the psychosis numbers that we're seeing. And what do you make of that? Do you think this is maybe just an anomaly of some kind, or just that there's greater attention? Or do you think it's possible that it's not just anxiety, depression, post-traumatic stress, or the likely things that we would see in response to a pandemic and the social unrest that we've seen subsequent to that? Do you think, that again, these environmental factors could be contributing to earlier onset or additional onset of conditions like psychosis?
So there's a few aspects to the answer to that question, and I'm really glad you posed, Paul, because it gets into some of the misconceptions around psychosis per se. So schizophrenia, which is a fairly debilitating disease, and it is what we normally think of when we think of psychosis. This is a disease that strikes typically in late adolescence or early adulthood. It results in a number of symptoms, including psychotic symptoms like hallucinations and delusions, but also cognitive disruption and social dysfunction. Schizophrenia is, we think of as less environmental. That's not really true. There are environmental components to schizophrenia, and maybe are surprised if the rates of psychosis go up in that context. But one has to remember that psychosis is a feature of bipolar disorder. It's a feature of depression, and it's a feature of actually even normal life when people get stressed. So that could be one thing that you're seeing, is that people are noting psychosis symptoms because they have these other disorders, which we tend to think of, right or wrong, as more related to the environment. The second thing that I would say is that even individuals with a pre-existing psychosis or predisposition to psychosis are more likely to experience psychotic symptoms in the context of stresses. And we have numerous stresses going on right now. We have the pandemic, we have isolation, we have the economic implications, we have the racial the strife around racial discrimination that is going on in this country. We have a lot of different reasons for people to be stressed right now. And so that's going to increase the rate of psychotic symptoms, whether those symptoms are occurring in individuals with schizophrenia, with depression, or with more milder forms of mental illness. So I think all those would suggest that it's possible that actually the rates of psychotic symptoms are increasing in society right now. It's also possible that what you're seeing is just an increase in the reporting. We were just talking about how people are more attuned to or becoming more accepting of mental illnesses as a consequence of this pandemic, and we might be seeing an increase in reporting. I think, though, that it's likely that stress is increasing the rates of psychotic symptoms in the population, at least modestly, and that is probably contributing to it. What will be interesting to see, and what I'm a little bit more hopeful about than the numbers might suggest, is whether this abates and reduces as the pandemic is resolved. And that might take a while, but we do hope there'll be a vaccine. We do hope that people will be able to get back to work and school without worry, sometime in the not so distant future. And what we've learned from prior pandemics, and well, not so much pandemics, there's not really a prior one for a while, but previous epidemics and natural disasters, is that only a small minority of the people who experience mental illness in the context of the disaster will continue to experience that a year later. So there is actually an increase in the rate of mental illnesses in the wake of disasters, but the increase is more modest than the numbers might suggest when you're in the heart of the disaster. So we can hope that this increase in psychotic symptoms that we may be seeing right now will at least partially resolve as the pandemic abates.
Our time is drawing to a close here, but I wanted to get in just one additional question again. And over the course of the next couple of days, we'll be weaving in both the themes of the pandemic specifically, and then the social unrest, frankly, that we've been experiencing too, and all the effects that that's had on us. And certainly one of the things that we're seeing in this context is that different populations, different groups, racial and ethnic groups, seem to be experiencing the pandemic differently, and obviously experiencing the world and the country differently right now. Any guidance or advice from the perspective of a behavioral health professional, probably the lead professional in the country, about ways we should be thinking even today about working through these things and understanding and addressing the differences that different population groups may be experiencing these days?
Well, I think first is recognizing that what is happening, both in terms of the unrest and racial discrimination, and in terms of the pandemic, is adversely affecting minority communities even much more so than the rest of society. The rates of infection with COVID are much higher in African American communities, in Hispanic communities, and Native American communities, and it's these same communities that have faced the other pandemic of discrimination, of police brutality, and in unequal access to all kinds of resources, including healthcare and mental health care resources for decades, for hundreds of years. That means that the impact of the pandemic is not only going to be more strongly felt in those communities from a physical health perspective, but also from a mental health perspective. That also means that we need to devote resources. From my own perspective, I'm talking about research resources, but from the general societal perspective, we should also be thinking about resources for physical and mental health, economic resources, et cetera, into these communities to help buffer against what's going on. So that's what we need to do. We need to think importantly about how our own organizations can work towards more equity in this space. From my perspective at the NIMH, it means that we are investing in research programs in these communities, both related to COVID and related to mental health disparities that exist. I'd imagine from organizations like yours that you are listening to your members in those communities and trying to make sure that the resources that you put in place are reaching members of minority communities. There is lots of reason to be hopeful. Minority communities have especially strong social networks, particularly in relation to churches and community centers, but in lots of other ways. And harnessing those social connections to help shore up the mental health of individuals in these communities is something that we're working hard at, and that could have some real benefit as we work our way through these many different forms of stress and strife.
Well, thank you for this, Josh. Thank you for the important conversation, for all the work that you're doing at NIMH. I know we're going to continue to work together to tackle these tough issues, and that we will bend the curve of these numbers. And, we'll do it today, before emerging conditions become, as I say, stage 4 crises. So before stage 4. So again, thank you for joining us, and thank you for all you're doing. People don't know, you're the Anthony Fauci of the mental health side of NIH. So wanted to share that with everybody.
There's no Tony but Tony, but I appreciate it. Appreciate the invitation to talk here. Appreciate the opportunity to think about these things with you. And I really appreciate all of your members who are striving every day to make things better for the community of individuals who suffer from mental illnesses, and who really advocate on the behalf of everyone, but also on the behalf of NIMH and the research that we do. We really do appreciate your work.
Thank you very much. We'll take a quick break now and be back with former South Carolina legislator and now CNN contributor Bakari Sellers. Stay tuned.
Good morning, I'm John Boyd, CEO of Mental Health and Addiction Care Services at Sutter Health, and we've been proud to partner with Mental Health America over these last several years, and we're especially proud to be the 2020 presenting partner for Mental Health America's virtual conference. I want to start by thanking the team at Mental Health America for your hard work, for your innovation, and for your passion that brought this 2020 virtual conference to life during a very challenging time. We know that the challenges of 2020 had brought more attention to mental health, addiction, and suicide prevention services. We must now match that with sound policy and reform that leads to sustainable reimbursement and the spread of evidence-based practices, all focused on increasing access to mental health and addiction care for all of us. We know that mental health must be integrated with physical health, and at Sutter Health, we are committed to that. We refer to it as human health, a common ground that we all share, a common need that we must address, support within ourselves, within our communities, within our schools, and you all are essential to that. And you've been working on the front line now for years, providing those services. So for all of you on the front line, especially now, we at Sutter Health want to thank you.
The pandemic has put the people of our country under enormous stress as we live in fear and uncertainty that is surrounding us. And for many of our people, the stress had brought us to a boiling point. We see it on our screening data, but more importantly, we're seeing it on our TV screens, on social media, in the words of our public officials, in the stories that are coming to light in ways we haven't seen and with intensity we haven't witnessed, at least since the civil rights movement in the 1960s. Growing up Black in the United States of America can be an incredibly traumatic experience. The inexcusable and violent death of George Floyd, as he begged for help, has evoked both our rage and frustration. And like other similar incidents in the past, this has brought out into the open the stress and trauma faced on a daily basis by so many people of color who live in our country. People of color and all those whose lives have been marginalized by those in power experience life differently from those whose lives have not been devalued. They experience overt racism and bigotry far too often, and they shoulder a mental health burden that is deeper than what others face. When you have to live in fear for your life just for being accused of passing a bogus $20 bill, you can't be mentally healthy at the same time. As the son of civil rights leader, Dr. Cleveland Sellers, our next guest had a front row seat to this reality growing up. And as an adult, he has followed in the footsteps of his father in his tireless commitment to public service, while championing policies to address issues ranging from education and poverty, preventing domestic violence and childhood obesity. Bakari Sellers made history in 2006 when at just 22 years old, he defeated a 26-year incumbent state representative to become the youngest member of the South Carolina State Legislature and the youngest African-American elected official in the nation. In 2014, Sellers won the Democratic nomination for lieutenant governor, and he is still widely considered to be a rising star within the Democratic Party and a leading voice for his generation. Sellers earned his undergraduate degree from Morehouse College, where he served as student body president, and his law degree from the University of South Carolina. Bakari has been a much sought after public speaker and has provided political and social commentary and analysis on many major national news outlets. He practices law in Columbia, South Carolina, is a CNN contributor, and now a best-selling author with the 2020 release of My Vanishing Country, a memoir. Please welcome to MHA's annual conference, Bakari Sellers.
Thank you so much. That's a great introduction. I feel like my mom wrote that. Thank you for having me.
As a matter of fact, she did. Yeah. Anyway, thank you. We really appreciate you being here. And I think we're going to have a rich conversation now. But let me start with times before you were born and ask you a little bit about an event in 1968 that I think you've talked about as helping frame your life and your belief. So in 1968, 3 people died in the Orangeburg Massacre when law enforcement personnel fired on a peaceful protest aimed at desegregating a bowling alley. Most of us never heard about this at the time. Well, one was one of your father's closest friends. So could you open just by telling us about your father, about the Orangeburg Massacre, and how that event, even though you weren't even going to be born for almost 2 decades, has shaped so much of your life?
Sure. So first, let me just say that my mom and dad always tell me the 2 most important words in the English language are the words thank you, and they're not nearly said enough. So I want to start by simply saying thank you for having me at this conference. This is an awesome experience and an awesome opportunity for me. You're talking about February 8th, 1968, a date in history that the history books now record as being called the Orangeburg Massacre. But let's go back to 1968 and understand the context, the full historical context. Tom Brokaw refers to 1968 as boom because he said it was the year that the country was on fire. We not only had the Orangeburg Massacre in February of 68, but you had the assassination of Martin Luther King in April, and you had the assassination of RFK the early part of that summer, and you also had many soldiers coming home from Vietnam. And so there was a great deal of tension, particularly throughout the South. My father was a member of SNCC, served as the National Field Director, National Program Secretary, served with or under both John Lewis and Stokely Carmichael. He was there right after SNCC's founding and had done things like go to Philadelphia, Mississippi to lead search missions for the bodies of Goodman, Schwerner, and Cheney. February 8th in 1968, however, is the most deadly civil rights demonstration this country's ever seen. And it's not so much the tragedy that 3 young men were shot that night and killed: Henry Smith, Samuel Hammond, and Delano Middleton. It's not so much the tragedy that 28 others were wounded, including my father, when state troopers fired deadly buckshots into the group of protesting students. It's not so much that my father was actually arrested and charged with 5 felony counts, looking at a maximum of 75 years in prison. And it's not so much the tragedy that my father was actually housed on death row while his bond was denied. And it's not so much the tragedy that his indictment was backdated from February 8th to February 6th. All the officers who fired shots into the group of students were charged. They were all found not guilty. My father was subsequently recharged with rioting, and he became the first and only one-man riot in the history of this country and ended up serving a year in prison. And it's not so much the tragedy that my sister, her middle name is Abadame, which is Swahili. It means born while father is away, because my sister was born while my father was in prison. But I think the greatest tragedy, as you stated kind of in your question, is that people don't know this history. I try to live so that those lives that were lost that evening were not in vain. And just as my father lived for Emmett Till and Medgar Evers and Jimmy Lee Jackson, and the list goes on and on and on, and Henry Smith and Samuel Hammond and Delano Middleton, I find myself ensuring that I give not only those individuals some voice in life, but also, the George Floyd, Breonna Taylors, Ahmaud Arbery's, Walter Scott's, Keith Lamont Scott's, Alton Sterling, Eric Gardner, Tamir Rice. And so, that's my frame. And I'm a child of the civil rights movement. And so everything I look at politically, culturally, and socially, I look at through the prism of that very rich civil rights history.
You've crossed paths with so many of the icons of the civil rights movement. You mentioned Stokely Carmichael, John Lewis, Julian Bond, Andrew Young, and others. And it seems like most of the people whose paths you crossed chose to be inside players, working to reform the system from within, while others were arguing that the whole racist system needed to be torn down from the outside. You've written that you chose the inside path. Even though the community you grew up in, which was Denmark, South Carolina, has suffered so much under the current system. Could you tell us why?
So, yeah, that's a good question. And not everybody. Stokely would, if Stokely was here, he would look at you with the clear side eye when you said that he was working within the system, because he did anything but. But yeah, Julian Bond ran for office. Julian Bond, actually, and I write in my book, Julian had one of the more legendary races in 1986 for the 5th congressional seat of Atlanta. And, I actually assert that if there was a cleaner campaign run, then Julian Bond would have been the United States congressman, not John Lewis. And you talk about Marion Barry, who, with whatever faults individuals want to attribute to him, created an entire new black middle class in Washington, D.C., and is one of the greatest mayors this country's ever seen. So, yeah, I learned from those individuals, and understanding the lessons of Ella Baker and Fannie Lou Hamer, I decided that I wanted to run for office and be a change agent from within, deconstructing these systems of oppression that we live under. There are people who want to tear the systems down and apply pressure from the outside. Both of these things are necessary, and one is not more important than the other. The work that I do is just as important and equal to the work that Black Lives Matter does. My friends like DeRay and Brittany Packnett, who apply pressure on these systems from the outside, and vice versa. And so I fell in love with politics, as many do when they actually get involved and engaged in the process. It's something you can't really get off of you. And so I decided that was where I wanted to be a part of the change in South Carolina. It was an uphill battle, to say the least, and one that I'm still fighting even today.
Well, it's one that I sure hope you'll win one of these days soon. Thinking back on this, I want to tell you my first recollection of Julian Bond was when I was 15 years old at the 1968 Democratic National Convention. We've just had the 2 conventions in the last couple of weeks now, so it's on everybody's mind. when there was a move that started to nominate him for vice president from the floor. And I remember, his floor speech. He was in among all the delegates at that point, saying he was going to have to decline the nomination because he had not yet reached the age at which he could accept a nomination like that. And he was 28, I think, or 29 at the time. So these people who were changing society and really were young and kind of made these decisions to work as best they could, like you, when you were quite young.
So let me just chime in quickly. I mean, people ask me often, and I say this without any hesitation. I tell people that I'd much rather be a Julian Bond than a Barack Obama, and I want to be clear because you won't find any greater fan of the 44th president than myself. But what I've realized, though, is that coming forward and being a part of a system, running for office in a Southern legislature with that civil rights experience and the things that Uncle Julian, as I call him, was able to accomplish and able to do, even through his chairmanship of the NAACP, and subsequently being one of the best teachers to ever walk through Charlottesville, Virginia, at the University of Virginia. I just admire him so much. And we can't say the name Stokely too much during this interview because my son is actually named after Stokely Carmichael, and he will randomly appear in this presentation. So we have to be quiet when we say that name out loud.
Well, that's fine. We'll be prepared for that. And now, and when you mentioned SNCC before, I was thinking, I hope everybody knows that was the Student Nonviolent Coordinating Committee, and not, many people, I think, again, aren't as familiar with these organizations and how much they influenced and affected the 1960s and much of what happened in a positive way subsequent to that, including, Stokely Carmichael, who, yes, I agree, was not one who was most inclined to work inside the system. But again, you were, and you and I have a few things in common. So we were both elected to our state houses when we were very young, although I was much older than you, 25, not 22. We both initially ran against popular entrenched incumbents. We both leaned heavily on our natural constituencies when they were told that they only had a certain place that they could have, and these were not the places that we were necessarily allowed into. And in our political careers, we both took risks. I am pretty sure, the only white elected official in my state in 1988 who actively supported Jesse Jackson for president. And we have also both been diagnosed with anxiety. So do you think it's something about politicians in general, or just young ones who get into things we wouldn't wish on our worst enemy, that anxiety is part of our lives?
Well, I don't know. I do speak to a lot of my young colleagues around the country, whether or not it's Mandela Barnes in Wisconsin, Malcolm Kenyatta in Pennsylvania, Ted James in Baton Rouge, Louisiana. Just have this kind of nexus of young elected officials. And we talk about things like anxiety. We talk about the importance of having people to lean on. When I got elected in 2006, there weren't that many young elected officials at the time. In fact, I was a part of a young elected official network that included two superstars, Andrew Gillum and my senator from Arizona, Senator Sinema. I was like, my names are escaping me this morning. But yeah, we lean on each other. We learn how to talk to each other. I think that my anxiety, I'm pretty certain, comes from a lot of the pain and trauma associated with the experiences of my father and mother, and that being passed down. I think a lot of it has to deal with the onus I put on myself to kind of live for others. I highlight in my book, I write about two occurrences. The first, probably the one that helped me identify the anxiety at a very early age, was my good friend dying. He was slightly older than I. He was the summer of his going into ninth grade. He died on the football field. I was going into eighth grade. And when you're that young and you realize that you lose that sense of invincibility, you begin to worry and become anxious. And that coupled with the experiences of my mom and her mental health issues stemming from, the trauma of not just being a Black woman in America, but also being the wife of a civil rights hero and incarcerated, and those struggles kind of coalesced into, I always call it me getting caught in my head. Ayanna Banzant, who I speak to often, she says that's not quite the best way to put it, Bakari. It's when you're in your head with no adult supervision. And I said, yes, ma'am, that's probably a better way to describe anxiety. And so it's something that I live with, something that it was cathartic in my book to write and share with the world that I do have anxiety. But it's something that I found great comfort in my wife and being able to be a partner and deal with the angst of life, and just makes me a better person. I think it also makes us better elected officials too, because we focus on ensuring a better future for all, and we work damn hard to push in that direction. And we, in the words of the great American poet Christopher Wallace, also known as Biggie Smalls, had no idea I would be quoting Biggie Smalls this morning at Mental Health America, but we sleep when we die. And so we put everything and we put our all in that passion, and it drives us to try to make sure that we realize those not so tangible ideals that you and I both ascribe to, not just life, liberty, and the pursuit of happiness, but words like love, truth, justice, peace, hope, and give those words real meaning and make them, those not so tangible words, feel real to us all.
I think it means so much that you root your anxiety in childhood, the death of a friend, and then that fear of death that you've written about, and also the fear of failure that I think also does motivate a lot of us.
That's motivating, man. It's people like, so in the chapter, and you know this, but for those who haven't read the book, in the chapter, it's called Anxiety, a Black Man's Superpower, because we talk about the fear of death and the fear of failure and how those things just push you and push you. And, they're so intertwined. I don't want to die before I complete my life's work. And there's just still so much out there to do. And so that builds on your anxiety. And it just, you just try to, I know so many Black men who deal with mental health issues. And for far too long, we've only believed that we could talk to our barber, right? That's most Black men's therapists. But we have to do a better job of communicating with others and building a network around us. Charlamagne the God, who just got inducted into the Radio Hall of Fame, who is one of the largest urban, I guess is the term they use, radio DJs in the country. He's in over 100 markets, wrote a book where he talked about that. And we both talk about it in our respective books and our friendship. And we go out and we talk to other Black men about the issues that they may be dealing with and say, there's no shame in being able to talk about these things. In fact, if you're not mentally healthy, then you can't do anything in this movement, and we need all hands on deck.
Yeah, and it's become such a common experience in the pandemic as well. A little while ago, I was talking to Dr. Josh Gordon at NIMH and talking about the data that we're seeing from our MHA screening program. It's an online screening program at mhascreening.org. And since the beginning of the pandemic, anxiety is off the charts. And anxiety and depression, we've seen 250,000 new cases. So many people are experiencing anxiety now and dealing with it for the first time. And so I think it's really helpful, for people to hear that they're not alone, right? Even though they've been lonely these last few months, and that it is a common experience, and it is something that we can talk about. And it is something that by talking about it, we can actually, help ourselves and help others to let them know that, these are extraordinary and unusual times. And, we can accept that.
Yeah. And I think that it's important for us to understand why individuals may have some level of anxiety during this time frame. And I think we have to unpack that. We just can't say that people are suffering from anxiety during this time, because people will just take it, all right, people going through stuff. We all going through stuff, but we have to unpack that. And I think that when you are, particularly in Black and brown communities, where you're disproportionately affected by this virus, where you are a small percent of the population, but you find yourself dying at obscene rates. But not only that, Black females are usually and have been over the past decade plus the fastest growing small business owners in the country. But what we're seeing is that this virus is sucking the wealth, the little bit of wealth that we've been able to attain in this country, sucking it out of our communities. You overlay that with the systemic injustices that we face day in and day out. And I'm not just talking about criminal justice. That's things that we are now seeing with our eyes. America's awakening to that fact. But I'm talking about educational injustice where children are punished because of the zip code that they're born into. I'm talking about just this week, they announced a $600 million settlement in Flint, Michigan. But if I told you that there were 100 cities in the United States that had a higher lead concentration in their water than Flint, Michigan, you probably wouldn't believe me. I'm talking about food deserts where you can't go 1 to 2 miles and get fresh fruits and vegetables. I'm literally describing my home, right? And so when you have this virus and you have the two-pronged devastation, not just the health aspect, but also the economic aspect, and you overlay that with the societal ills around the issues of race that we haven't dealt with, then it's no wonder that people have anxiety. And so I think it's necessary that we take that extra step and we talk about the foundation from where this comes from. And I think once we do that, we can better understand how to unravel and help people deal with the issues that they're facing.
One of the things I liked about the composition of your book is that the chapter on anxiety really comes later on in the book. So you tell your story and you tell the genesis of this story. You talk about your hometown, you talk about your family, you talk about all these things, and then you bring in anxiety and reframe it a little bit later on about the anxiety. And I'm wondering, I picked up a little in your last answer about why I think it might have been important to you to do it in that order. But could you talk a little bit more about just why putting the frame that way instead of having the first chapter being I live with anxiety, and then also just talk about why it was important for you to speak publicly about it.
So it was twofold. One, I wanted to kind of show and lay the foundation of where I'm from, my background, my history, the highs and lows, because I wanted people to be able to see that as a child of the movement, understanding that that trauma, right, the perpetual trauma of being Black in this country. And I wanted people to be able to see me through some successes and some failures, being the youngest Black elected official in the country, being the youngest person to ever win a statewide party nomination for lieutenant governor here, losing that race. I wanted people to be able to kind of understand the inner workings of not just my mind, but my heart. And then I wanted people to be able to see that, yes, this is my whole truth. And you need to know that this is an issue that I deal with on a very, very much daily basis, right? But for me in particular, I wanted white folk, when they read this book, to get a sense of understanding of the Black experience and the totality thereof. And I wanted Black folk, when they read this book, to get a sense of pride and to feel a part of my story in them, letting them know that we may not all get there at the same time, but we will get there together. And so I just, it was dual purpose, but it all ended up coming out in the same fashion, if that makes sense.
Yeah, I think it actually makes a lot of sense. And for me, actually reading it, I think I had both of those experiences, some greater understanding and the ability, frankly, to link it to, certain, things that are in my past or my family's past, or issues that people face that, in past generations, that it's been easier for them perhaps to overcome because of their race, but also the pride. I mean, that you're right. I mean, when my kids read this book, my kids are all mixed race, I would think that that's how they would feel. And you're just about the same age as all of my kids. And so it's important to me that they hear voices, from their own generation who are able to talk openly about challenges and openly about what's happening in terms of their health and mental health, and also who are just forward looking and thinking, in ways and in talking in ways be so helpful to people. So I think the book worked for me, and if that's an advertisement for others to buy the book and read the book, it's a real easy read. I hope they will.
Thank you.
So let me turn to something else, and I want to talk broadly to healthcare for a little bit. We have a little bit of time left, and again, I don't want to take all of your stories away from you, but you've had a lot of direct contact in your family with the healthcare delivery system.
Yeah.
And as do I, that it's been a lot of policy decisions that have been made over generations that have undermined access to healthcare in general, including for people in the community in which you grew up. So how do we fix this? How do we convince people who may still be persuadable that they need to be voting, their self-interest, and particularly around issues of health and mental health from my perspective, and not necessarily be fooled by all the snake oil salespeople who are out there?
Yeah, I don't have the answer. One of the things I learned about being a lawyer is you got to let people know when you don't have the answer. I wish if I could figure out how to convince people to vote their interest, their self-interest, then I would have the golden key. But you hit on something in the healthcare delivery system. I am not someone who focuses on the complicated intricacies of our healthcare system. I believe in universal healthcare. I believe that we have to get there. I believe in building on the Affordable Care Act, et cetera, politically. But I'm very much focused on access. Even if we have Medicare for all, that's cool and all, but we still don't have a hospital in a lot of poor rural towns or counties, especially throughout the South. So you talked about my interaction with the healthcare delivery system. There are three. The first is in 2010, while we were having this expansion of Medicaid debate, et cetera, but in 2010, my county lost its hospital. It completely shut down. And what does that mean? It's not only the fact that we now have to travel 30 to 45 minutes to the nearest hospital, not just that. So if you have a heart attack, you're just dead, right? I mean, that is what it is. To quote the 45th president of the United States, it is what it is, right? But it's also our number one or two largest employer. And not only that, but all the small businesses, the flower shops, the small restaurants, the pharmacies that are around that hospital may also close too. So it just created a huge economic hole, a huge void in access to care. And it's happening throughout the South. It's happening that these rural hospitals are just shutting down. They're not able to sustain themselves, and no one's doing anything about it. That's first. The second thing was we had an amazing pregnancy with my twins, Sadie and Stokely. They're 19 months old now. An amazing pregnancy. We had the worst birth it was, my wife, after Sadie was born at 5:33, Stokely was born at 5:28. By 10:30, she had lost 7 units of blood. She hemorrhaged. The nurses were moving so damn slow. I had to become her number one advocate and yell and scream. I FaceTime her doctors, 3 Black women. They were able to run in. They came from their home. One had an 8-year-old. She left the garage up for the babysitter and she zoomed out. It was just it was a god awful experience. She almost died, and she spent the first 36 hours of my children's life in ICU. And that greater issue is the fact that Black women are 3 to 4 times more likely to die during childbirth than white women. And we just saw a study that CNN ran. They talked about the fact that Black women giving birth are more likely to survive if they have Black doctors. And no one is doing much about the implicit biases we have in our healthcare delivery system. And so that's number 2. And number 3, a few months later, we found out that my little girl had biliary atresia. And so she ended up on the liver transplant waiting list for 93 days, which is, you're literally watching your daughter die every single day and there's nothing you can do. But September 1st, We're almost, we're right at that year marker where she was able to get the gift of life. But I saw in that system that if you don't have means or access, that it's very difficult to get to get that gift. And so I've seen three broken points in our healthcare delivery system, and I'm dedicating, my life to trying to fix those.
Well, I want you to succeed. I'm there with you. I'm so glad that your daughter's doing better now. That your wife's doing well. That your family is whole and healthy. And I do think that we need to understand that we cannot take these things for granted because most people don't. And, most people don't have this kind of access. Most people, certainly people with mental health conditions, have suffered under segregation for some period of time without access to good quality mental health services from the earliest times they need them. And I think we do have to do better, and I hope we will. And so my final question for you today, if you've got one more minute to answer it, would be, just in general, what gives you hope?
Oh, my children, they deserve to be free. They deserve to live in a better country than the one that we have today. And so I'm very hopeful. And, I think about the history. I think about my history and my relationship to the civil rights movement, and understand that many times all they had was hope and faith. And I refuse to let anybody take that away from me. And so one day my kids will be free. And one day we will have a country that lives up to its promises for us all. And I'm excited about that day, but work like hell to get there.
Well, thank you, Bakari, for joining us today. I think you've convinced a lot of us that if you ever decide to move beyond the borders of South Carolina in your political career, that we're going to be signed up right behind you to do all we can to elevate that profile of yours and put you back into elective office. We need you. We need you doing what you're doing now. We needed you doing what you were doing then. And you've got plenty of time yet ahead of you. So don't give up on us. I think we'll realize that hope for you before we're done.
Thank you so much. And thank you for having me. And I hope everyone enjoys the conference.
Thank you. So we're going to take a quick break, and we're going to be joined on the other side by Dr. Melissa Merrick, the president and CEO of the national nonprofit Prevent Child Abuse America, where we will discuss COVID-19 and childhood trauma.
My body was moving on its own. It turns out I have tardive dyskinesia, a condition that may be related to important medications I take for my bipolar disorder. Tardive dyskinesia can affect different parts of the body. It may also affect people who take medication for depression and schizophrenia.
In today's trying times, we're here to help you manage TD. Visit talkabouttd.com for a doctor discussion guide to prep for your next appointment in person, over the phone, or online.
It's a relief to know there are treatments for TD.
In these challenging times, mental health remains a high priority for ourselves and our loved ones.
Though we're not able to gather in person this year, we remain committed to supporting the mental health community.
At Synovian, we work each and every day to develop innovative therapies to improve the lives of those living with mental health conditions and their families.
We are here with you in your efforts to fight stigma and advocate for the community.
Welcome back. Our next conversation is an incredibly important one because of the overarching need to ensure that our children every day are okay. Well before the pandemic and the last few months of social uprising, many of our children were suffering. And as we've already discussed this morning, things are worse now than they've ever been during most of our lives. We know that when children are exposed to traumatic events in highly stressed circumstances, their mental health suffers. So we want to ask, are the kids really all right? And what can we do about it if they aren't? Joining us for this critical conversation is Dr. Melissa Merrick. Melissa is president and CEO of Prevent Child Abuse America, the nation's oldest nonprofit organization dedicated to the primary prevention of child abuse and neglect. She has nearly 20 years of clinical, research, and leadership experience related to the etiology, course, and prevention of child abuse and neglect. Previously, Melissa was a senior epidemiologist at the National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention in Atlanta, and served on a detail in the Office of the Commissioner at the Children's Bureau in the Administration for Children and Families. In partnership with the U.S. Department of Health and Human Services Office of Child Abuse and Neglect, she served as the lead scientist for the Adverse Childhood Experiences, or ACEs, study at CDC for 8 years. Dr. Merrick successfully leverages her clinical and research experiences to communicate and disseminate the critical public health importance of preventing early adversity to key stakeholders with diverse priorities, backgrounds, and knowledge, including legislators, business and civic leaders, and members of the academic and medical communities. Please join me in welcoming Dr. Melissa Merrick to our conference.
Oh, thank you, Paul. It's just so tremendous to be with you all today. Thanks for inviting me.
I'm just so glad you could be here, and we've got so much to dive into with you. But let's start. The name of your organization speaks for itself. So we started off today talking to Dr. Josh Gordon from NIMH about how MHA and NIMH are seeing spikes in depression, anxiety, and suicidal thoughts since this pandemic began. And as you know, children are feeling these effects most deeply. So it's so hard for everybody who is dealing with this. But when I think about being a child and doing it in an unsafe or neglectful home, over the last few months with all that's going on, what are you seeing?
Well, Paul, it's a tremendous question, but I think what we're seeing more than anything else is that prevention is more important now than ever. I mean, we know that parenting is challenging even in the best of times. So enter global pandemics, civil and racial unrest. Pair that with job loss or losses of wages, food insecurity, housing insecurity, childcare unavailability, or no access to health care. It is tremendously stressful time for parents. Myself, I have 2 young kids learning from home virtually. It has just been a whirlwind. But we know in this time of physical distancing and that we're seeing public health in action. It's like, just like we all collectively have to wear a mask, right? If I wear a mask and my neighbor doesn't, it's not as effective. That is what we mean in child abuse prevention. Taking a public health approach means what we all do collectively to assure the health and well-being of all people, right? So that's the intentional integration of health equity into this work too, but it's really what we all can do together. So we can prevent child abuse and neglect if we stay in this time of physical distancing, if we stay emotionally and socially connected. We know that emotional and social support is such a protective factor to make sure that our kids have safe, stable, nurturing relationships and environments that can help them withstand this potentially very stressful and very trying time.
That's such a hopeful way to begin and the way to look at this. And don't let me take that measure of hope away when I jump to this next question. And because you've had decades, you're the expert in the work of ACEs, the Adverse Childhood Experiences. And we may have a number of people who are tuned into this live stream who may not be familiar with ACEs. So can you back us up a little bit and explain what that means and how adverse childhood experiences impact both health and mental health?
Absolutely. So the CDC defines adverse childhood experiences as potentially traumatic events that happen in the home under the age of 18. So these are things like physical, sexual, emotional abuse, physical and emotional neglect, and then various forms of household challenges like growing up in a home with untreated mental illness or an incarcerated parent, or substance use in the home, right? And no matter what study out there and how they particularly operationalize ACEs or adverse childhood experiences, the bottom line is that they're super prevalent. So in any population, there's about 60% of folks that have at least an ACE score of 1, so at least one of those experiences. We know that if you have one of these experiences, you're likely to have more because we know these risks tend to co-occur in families. But we also know that as you add up ACEs, and so as you have more, it impacts your health and well-being more. So let me give you some examples. As your ACEs increase, so too does your risk of cardiovascular disease, the leading cause of death in America. So too does your risk for mental health problems like depression, anxiety, suicidal ideation, and suicidal attempts. So too does your risk for a whole host of negative health outcomes. In fact, a CDC vital signs that was released late last year found that we could potentially prevent 44% of adult depression if we did not have ACEs. So this is, we know that things that happen in childhood stay with us, both positive and negative. So really for prevention to take hold, we want really to tip the scales with more of those safe, stable, nurturing relationships and environments that can really offset the impact conferred by ACEs. And obviously the ACE study and the collection of ACE studies in the literature are not the entire universe of ACEs that we know that our kids are experiencing right now in this country and abroad. And so I've even seen people use the name ACEs, that acronym, to say adverse community environments, right? The context, the disproportionality, oppression, discrimination, all of those environments that can exacerbate the impact of the individual experiences. I've also seen people use ACEs to say adverse colonial experiences, to really kind of invoke that historical trauma that we know get passed on to across generations. So really, at Prevent Child Abuse America, we are in the business of trying to stop early adversity like child abuse and neglect before it occurs so that we can really set our children off on a trajectory toward health, well-being, and prosperity.
So are people talking about adverse COVID experiences as part of what kids are going through now?
Well, you just coined that new acronym, but they are talking about how COVID can be really, if not an ACE in and of itself, it's certainly an adverse experience for many families, right? We know that this time is super stressful for all families. Let's just start there. But we know, and your last speaker really got into it, I think, perfectly well, in terms of we know that not all people or communities are experiencing or able to weather this pandemic in the same way. So we know our Black, Brown, and Indigenous communities, our under-resourced communities, they're really feeling the heavy, heavy impact of COVID even more than others, right? So I think, we've seen models like the pair of ACEs model, which basically has sort of a tree graphic, if you will, and the leaves of the tree are what we typically measure about ACEs, but at the roots of the tree, those are the things that are really the contextual factors. So there, COVID very much can exacerbate the impact of early adversity.
I'm glad you've brought this up because, in the chat, I think a number of people have really been going back and forth and really, talking about a number of the experiences related to the experience of race and racism in America. And certainly it's a very real thing that we need to be understanding about in terms of our kids. And we're going to talk more about the impacts of racism over the next day and a half, but I'm wondering if maybe you can start us off a little bit here too. I want to tell you a story and kind of get your reaction to it. I recall that when I was a young legislator many years ago, I was called in to mediate a situation in which a Black African professional was accused of physically abusing his 15-year-old daughter, which is right around the time that he and his family were planning to return to Africa after spending about a year here. Ultimately, they determined the accusation was unfounded, and his daughter surfaced it because she wanted to stay behind in the United States with her friends. So they let him return home with his family, including his daughter. But the local minister who called me in just couldn't believe how aggressive they were with him and how little the Child Protective Services folks at that time understood the differences between what they experienced and how he experiences life and the confusion that contributed to. I think many people still feel that Child Protective Services is still decades later more likely to intervene and intervene aggressively in families of color, and perhaps less likely to come down as hard on white families. Would you consider these to be fair assessments?
Absolutely, and they're repeatedly seen in every community in this country. I mean, this speaks to the implicit biases that exist in all of our systems. You're highlighting here maybe a healthcare sector system for, child abuse stocks, or even the child welfare system that we know can substantiate cases in Black and brown families at a higher rate than in white families for the same presentation and clinical presentation. I think this, when you combine these implicit biases with systemic and historical racism and other systems of oppression, yes, we must have a narrative shift in this country. We still believe that, it's that bad mom or that bad parent or that poor parent who maltreats their kids, as opposed to we all have a role to play in assuring health and well-being of all children. And in fact, my children will do better and will thrive if all children and all families are doing better. So we really need to get to these root causes. This is our work. And I mean, the definition of public health from the Institute of Medicine in the early 90s is what we as a society do collectively to assure that everyone can be healthy. Okay, so it's not like trying to do something that's not in our purview, that's not in our discipline. It's what we must do. We must have a narrative shift. And, adding to your example too, it's the cultural competence too. It's the really, still othering people for their experiences. Oh, that's those people over there, versus all of our children, all of our families. How do we help support each other so that we can really achieve the highest level of health and life potential? It's really, we must get to the root causes of these problems.
Yeah, and when I was learning public health, literally on the job as a public official decades ago, we were very good, I think, about getting an education about prevention, that a lot of people tend to focus in on those personal risk factors, they used to call them. So, and even now we see a lot of this. What can people do to help themselves? But at the root of these were these community risk factors that the public health people were trying to talk about and saying, we've got to fix the communities that people are living in before we blame people for the personal things that they do in reaction to what they've experienced in their communities. And I love it that you've got people focusing this way on, as I would say, the community risk factors as much as the personal risk factors here.
Absolutely. We must take a comprehensive public health approach. That means looking at individual risk and protection, of course, but also the community level ones, also the societal level ones, right? We're talking about a child living within a family, within a community, nested within a socio-political context, okay? So then our solutions then must be at each of these levels. We know that there have to be policy level solutions, okay? There have to be norms change solutions. Again, getting away from this kind of dominant narrative that it's a bad mom or a bad, single parent, a poor parent. No, it's all of us together. And then what are the assets in communities? Every community has assets. How do we lift up those strengths? How do we partner across sector to really promote child and family well-being? I mean, this is something that we must do. We must do better. I've heard so much in this time of, we can't wait to return to normal. I'm sorry, but we must do better than normal for our children and families.
Yeah, I think you're right about that. We've got to do better than normal. And I think this is one area where, those of us who are parents of kids with serious mental health conditions have also known personally what it's like to experience the "you're a bad parent" syndrome. That's really part of the normal, part of the norm. We often say is to, blame the parents. We blame the parents first, and then, kind of make the parents, prove that they're not bad parents before we go and look to some of these environmental factors that may be more present, and also biological and other factors that, the parents in many instances may have had nothing to do with. So, in your mind, what's the right balance to strike here? You've sort of been suggesting this and hinting at it as we're going along, but do you want another crack at just, exposing that a little more? In your mind, what's the right balance, and how do we get there?
I think the right balance has to start with us making a commitment to strengthen families, to keep kids safe, that kids are safer in families than from their families. This is something that if families have more access to economic and social supports, they have paid family leave, they have child support subsidies, right, to help kind of take the edge off, to help them really commit to doing best by their children. If we have evidence-based home visitation, so support for new families upon the birth or adoption of a child, right, helping them cope with trauma, helping them practice these social skills, they're going to be better equipped to parent and engage in positive parenting strategies, right? But they have to learn what those are. We know the research that so much of child maltreatment, if your mom experienced child maltreatment, she or her children are more likely to experience child maltreatment in the next generation. So it's this dual or multi-generational approach to how do we strengthen families, keep them strong. That means keep them strongly connected to the community supports, right? To have a dominant narrative and norm in this country to support each other. I mean, this is what we mean by prevention, and certainly this is what we mean by primary prevention. Primary prevention is trying to stop child abuse and neglect before it occurs, not waiting for early identification of symptoms or of the presentation of child abuse and neglect. No, we want to help families before they find themselves in crisis. But this is really going to take a narrative shift. This is going to take all of us working together across sector to not just tack on the word prevention when we really mean treatment. Okay, and in full disclosure, I'm trained as a clinical psychologist, and I, like you, learned public health on the job, on the fly. But once you kind of learn about primary prevention, about, how do we stop this from occurring? And then, of course, yes, mitigate the negative outcomes for those who have experienced early adversity. But how about we invest in upstream prevention strategies more than we do, right? Why don't we tip the balance? Right now, we have billions of dollars that go into child protection and foster care, and only about $30 million that goes into prevention. What would happen if we took one of those $10 billion and moved them over to prevention, right? I mean, show me your budget. I know what your values are. So I think it's really about us all across sector recognizing that we all have a role to play, that prevention is possible. These kinds of experiences are not inevitable. It's not like, oh yeah, that's, violence is always going to happen in a home. Absolutely not. It's just so little support for families, so little support for keeping all families together and strong.
Yeah, and that's the key. I mean, supporting people, and I agree with you. I was just sitting here thinking, when you're talking about primary prevention, okay, there's some people who are into secondary and tertiary prevention, and none of this meant anything to me when I was, in the legislature, knew nothing about any of this stuff. I mean, for me, all prevention made sense as primary prevention, and we have this, framing. The one thing I did frame was before stage 4. That we need to act before crises occur in the mental health space. I don't think it would ever have occurred to anybody to say we're going to prevent stage 4 cancer by beginning our intervention at stage 3. The idea was we were going to prevent it by preventing it, by preventing stage 1 from happening. And I think that's what you're talking about here, and that's what I talk about all the time too. And I hope it's resonating more with people. I think it is, don't you? That people are beginning to get more upstream perspectives. We've said, with Josh, maybe this is even a silver lining of the pandemic, that people are seeing what the really initial stages of stress and trauma and these adverse experiences mean to us, and how they tear at us.
Yeah, I hope so. I think that, we still have a long way to go in really operationalizing what we mean by primary prevention. And please don't anyone hear me say that secondary and tertiary prevention is not also important. It's a both and. We need all kinds of prevention along the continuum for really a comprehensive approach. But I do think that one of the silver linings of this pandemic is we're seeing public health in action, right? Many of us, public health is very abstract. How do we measure prevention, right? It's much easier to measure lives saved from downstream approaches than people that never got the ailment to begin with, right? So that's always a struggle in this field, or in, the concept of prevention. But I do think that there's more and more champions for prevention, people that finally learn about it and say, oh, of course that makes sense, that we want to help people before they find themselves in crisis. And we find that we're able to do that more at a community level, family resource centers, other things that are just available in the community without stigma, without, having to be mandated to attend it, to be voluntary, that you don't, as we lift up more of these community-based solutions for prevention, I think we're going to see more people take part in those prevention solutions too. So I think I'm so thankful for this opportunity to kind of continue to raise awareness for primary prevention of child abuse and neglect, certainly. But really what I think we're doing is trying to assure the best possible physical and mental health of our children and families for generations to come.
This is such a great conversation that I want to make sure we actually have a few minutes to get other people into it. And there are a number of questions coming in already through the chat that people are saying, could you please ask about this? Could you please ask about that? So let me throw in kind of two at once here and give you a chance to react to these. One is the undeniable importance of teachers in the fight against child abuse and neglect. And the other piece of this is, what about therapists? How can therapists work to prevent child abuse, considering often where they come into an individual situation? So teachers and therapists, take it away.
Yeah. Thank you, Paul, and thanks everyone for those great questions. First of all, I believe, and I think I've said it multiple times in this conversation, that we all have a role to play. So it doesn't matter what discipline, what your job is. Many of us wear multiple hats. You may wear a parent hat, a community member hat, a church person hat, a therapist, a teacher, a businessman, and we all have some part of this prevention comprehensive approach, right? But teachers, of course, are undeniable, their impact in the lives of our children and families every day. And, I think what I've seen, and I want to address directly, what I've seen in the last 6 months or so is a lot of popular media stories really saying, oh, we're scared for kids because they're not in school, so their teachers can't see if they're being harmed. Okay. Yes, teachers and many other professionals are mandated reporters, and they do identify risk early and often in children's lives. But they have a more proactive prevention role too, and they, in that way, Prevent Child Abuse Executive Director in Arizona for our Arizona chapter. Her name is Claire Luge, and she talks about, what about if we've reframed that to mandated supporters instead of mandated reporters, right? Recognizing already the role teachers play in that emotional connectedness piece, being able to realize the needs in a family, in a student's home, and can connect, to services and such. Of course, I think that we rely on teachers to do a whole host of jobs, and we are just so thankful for teachers in this moment. But teachers can have a role in primary prevention too, and I think we sometimes don't see them as primary prevention agents. Therapists too. Again, trained as a clinical psychologist myself. I will say during my time at CDC, we developed, in partnership with the American Psychological Association, an online ACE training for what is the role of behavioral health practitioners and psychologists in primary prevention, because we do sometimes default and see our role as understanding trauma after the fact. But really, as we know from a robust intake, we can understand all the risk factors, but we also need to really understand what protective factors exist in a family, in a community, in a child's life, and help to boost those. So really, we are seeing families for a whole host of reasons, but we can also be good assessors of risk and protection and help, again, tip that balance. It's about starting our young people on a trajectory towards health and well-being. And, we just tagged a new tagline for Prevent Child Abuse America that says, Prevent Child Abuse America, because childhood lasts a lifetime. And that is so, to me, powerful, because it's aligned with the science on brain development and epigenetics and development. But it also says that childhood, positive or negative, it will stay with us. So how do we make it the most strong and protective childhood with safe, stable, nurturing relationships and environments? And absolutely, teachers and therapists and all of us have a role to play in that.
So what about all of us then? So another questions come in about the average citizen, somebody who's not trained as a teacher, not trained as a therapist, and they'd love to hear a specific example or two. So on the one side, how do they help prevent child abuse? And on the other side, what are a couple of the things that if somebody had to do them or could do them every single day to be able to be supportive for their kids or kids in the neighborhood, that you would say, do these two things? So both sides of that. What about the prevention side, and what about the promotion side?
Supporting each other. I mean, again, in this moment of physical distancing, it is more important than ever that we remain socially and emotionally connected to our communities, to our neighbors, to our families. Obviously, it takes on a different tone these days that we're not able to physically be in person oftentimes, but on walks around your neighborhood, really, these are simple things that we all can do, but waving, smiling, saying, hey, good to see you. Isn't it a beautiful day? Striking up conversation. If you're able to give food to your food banks locally. I mean, we know that diapers, data, and devices are so important for families right now in terms of accessing home visitation services and such. So there are small things that we can all do to promote this, well-being culture, if you will. And so I think that parents too, I think we need to recognize the real value in self-care, that our kids are learning and they experience their world through the relationships they have with parents. And so if we're doing better, our children will also be doing better. It's also, I think important to highlight that kids are resilient. So, as much as parents are struggling right now, and we all are struggling, but as much as we can take time, whether it's a minute outside to take a deep breath, whether it's, reading a book or exercising if you're into that, whatever makes you self-regulated and helps you take a moment, take a pause, your kids will learn. They will learn their own coping skills from parents, of course. And so I just think that there's so much, just these small things, they add up. Just like ACEs can add up. I'm going to lift up in Tennessee, they use their ACE acronym to say all children excel, to really be that strengths-based focus instead of just risk reduction. So there's so much that we can all be doing to promote the protective factors, protective relationships, environments, contexts. We all have a role to play.
Well, and I love that approach of, somebody asking the question, what can we do for our kids? And you come back to, it's also what we should do for ourselves. If we take care of ourselves, it's such a simple concept. We take care of our kids, and we actually help our kids carry taking care of themselves from childhood to adulthood. So we also build a generation that will become more resilient. I think a lot of people might be enlightened by that because it is so simple and so easy to do and so easy to forget when we're stressed and our kids are stressed and we're just trying to fix it.
we don't always give ourselves permission, to take that moment, to take that time. We think it's, taking away time from our kids or such. We have lots of, I know I experience a lot of mommy guilt, right? Or working mom guilt. We have all these things piling up, and sometimes it can feel like, oh, yet another thing. But it's so important that we stay self-regulated, that we, put our own mental and physical health at the forefront so that our children can also regulate.
You've had a lot of background in policy-related work, and we've got a question that somebody's raised saying, prevention still isn't the go-to in our health system. So how do we change it? What do you think are some of the most persuasive things that we can do in order to change this? And what are the opportunities we have today?
Yeah, well, I think it's really important that we continue putting out studies on return on investment and those dollar figures that policymakers really, they resonate with policymakers. So things like the vital signs that CDC released, that really say, again, if you prevent ACEs, you could prevent 44% of adult depression, and then put a cost estimate on that. How much does that cost our system, our society, and how much, if we invested in prevention, could we realize in downstream savings, right? So I think it's cost studies are super important and still kind of a gap in the field. I think it's also norms change approaches, right? Again, we still have this dominant narrative that we have to change. We have to change to say we all have a role to play. We all benefit if everyone is doing better. Again, healthier kids lead to healthier adults, lead to healthier parents, more prosperity, more productivity. I mean, it's as simple as that. We want our kids to be as healthy and strong and mentally well as possible so that they could go on and realize their maximum health and life potential. I think, these policy solutions like providing economic supports for families, earned income tax credit has a lot of evidence for preventing child abuse and neglect perpetration. So too does livable wage. Dollar increases in livable wage result in 10% reductions in child neglect. I mean, these studies are happening. We know that there are policy solutions, but again, it's around us all understanding that prevention is possible. It is not that this is the inevitable outcome for our kids and families. We want better for our kids and families than we experienced, right? So every generation wants improvement in health and prosperity and well-being. So how do we have our true values and norms reflected in our policies? Vote, vote, vote. That's for sure. Stay active in your communities. Recognize that you all have multiple hats that you're wearing. And so how can you really help change the dialogue, change the narrative in this country that we all do better if we're all doing better?
Yeah, and one of the things that I think, we end up getting stuck with in some ways is the need to explain costs as investments. I often think that the prison system never had to talk about what a great investment it was to build out the prison system that we've built out, because it wasn't. It was a cost that was associated with bad policy decisions that were made, 30 years ago when we closed state hospitals and when we put determinate sentencing in and did a whole lot of other things that were inappropriate. And, even a lot of the, road improvement people, aren't really talking about the great investments that we're making when we, change an entrance ramp or change an exit ramp to accommodate a new highway. And yet we've got to talk investments all the time. Does it ever bother you that we can't just say to people, this is just worth it because it's improving your life? Like eating food is worth it. Having health is worth it. Being able to get from place to place is worth it. And, that's my pet peeve. How about you?
Yeah, does it bother me? Absolutely. But I also think that if you're a champion in this area, you don't care how you have to say it, who you have to get to listen, right? You change your message depending on the values of the people that you're talking to, right? So if I'm talking to chambers of commerce on why they should invest in primary prevention in their communities, I am talking about dollars, right? If I'm talking with someone who's a mental health advocate, then I don't have to sell it in that way, right? And so yes, it's troubling that we have to go there. But the truth is, no matter what data you look at, you see that there's great benefit in investing in children and families and keeping families strong and together and thriving. We can measure it however you want. It's better than what we currently have. So we can't do what we've always done, because then we'll have what we have, right? Which is a tremendous still public health crisis in early adversity. But prevention is just as urgent and is just as possible. And together we can prevent child abuse.
Well, that is a great message of hope, which was going to be my last question. And we have literally about 60 seconds to go. So we've got a chance to answer something perhaps from the audience again. And that was, people are looking for book recommendations or article recommendations just to learn more about, I think, ACEs and more about some of the positive things you've been saying. If you could focus on one or two or three, where would you tell people to go to get some more reading material about this?
Sure. Well, certainly you can come to the Prevent Child Abuse America website. That's Prevent Child Abuse America, or PCAamerica.org. I should know our own website. CDC has a wonderful ACEs repository of key articles, seminal articles. I think if you can only read one article, the vital signs that came out late last year. If you Google ACEs, vital signs, CDC, it'll come up. I'm the first author on that paper, but I think it's really nice because it goes across leading causes of death and morbidity and the associations with ACEs. I also just think there are terrific books. I have a book on my shelf here, The Color of Law. This is a book not about psychology or about child maltreatment. It's really just about our history of policies and structural and social determinants of health, and how many of our policies were designed to get the outcomes that we get, right? And so then if we make our work about redesigning our policies, our systems, we can get different outcomes. So I think those are ones that come top of mind, but certainly CDC has a wealth of information. There's so many pioneers in this area. Certainly, if you're interested in the neurodevelopment aspects, I would Harvard Center for the Developing Child has a wonderful platform. Also, Dr. Bruce Perry's work is tremendous. He's one of our board members at PCA America. But there's a lot of reading to do. But I will say that it's clear across all literatures, all anything that I know about, that we can prevent child abuse if we work together across sector, across discipline, across silos. If we break those silos and truly put the health and well-being of our children and families at the forefront, we can achieve multiple public health goals.
Thank you. Thank you, Melissa. On that note, we're going to have to end this and move on. We really appreciate you taking this time. And to everybody else who is applauding virtually right now for you, we'll be right back.
Thank you.
Welcome back. Our next guest is pretty much a household name. Kenneth Cole is an American designer, social activist, and visionary who believes that business and philanthropy are interdependent. His global company, Kenneth Cole Productions, creates modern, versatile, functional footwear, clothing, and accessories. And for more than 35 years, Kenneth Cole has leveraged his passion and unique brand platform seeking to make a meaningful impact on communities in need. In 1985, with the help of many of the top fashion models in the world, Kenneth launched the first HIV/AIDS public service campaign, years before our then president even acknowledged the disease. He then joined AMFAR's board of directors in 1987, and on World AIDS Day in 2004 assumed the chair, leading the organization for 14 years. Family doing.
So this has been, a defining moment in our lives, as I am sure it is of everybody everywhere. And we've done a lot of reflecting. I've done that, I think, which in some ways is a gift. I've gotten to spend time with my family, which maybe I would not have been able to do otherwise. But truthfully, I find I've been in a perpetual fog for months now. I mean, as much as I try to focus, and one day tends to lead into another. My daughter asked me if today was Wednesday, and I asked her, well, is it this week or last week? So, and I think we're just all trying to process what all this means, and this notion of self-isolating and is something we're just, as individually, none of us are accustomed to it. And what impact will it have? Can it have? I read a study recently, Paul, of that was done after SARS, and where certain individuals were quarantined, and it wasn't to the extent they are now, and certainly for as long as they are now. And a third of those came through with symptoms of depression, and a third with symptoms of PTSD. So this is a very concerning moment, and I think that this conference is, I think, at an opportune time, and I think anything that any of us can do right now to lend a hand or an ear, or put ourselves out there, I think is vital.
Yeah, I was talking earlier with Josh Gordon, who, as you know, heads NIMH, about loneliness and isolation and what we're seeing at Mental Health America too. It's not just in the stories, but the data, and as you said, the extraordinary number of people whose lives are not just disrupted by this, but who are in that fog. I mean, that fog of isolation and the anxiety that's developed for a lot of people from that. It's a big deal. Not going to be easy to overcome this, is it?
It's not. I think it's the uncertainty that's the hardest part. And I think uncertainty just fosters anxiety, because you don't know what's around the corner, and you don't know what's at the other end, what the other end of this will be. And we don't even know when it will be, and then what will it be for people that we love and people in our lives, and what it will be for me personally, what it will be for me professionally. There's a lot everybody's balancing right now and digesting.
Yeah, and when we think about that uncertainty, there's uncertainty about, am I going to get sick? Is a family member going to get sick? Are they going to recover well if they do? I mean, all those kinds of questions. And there, as you've mentioned, also these questions that people are asking of themselves professionally. I mean, what does it mean for my work? What does it mean for my employer? What does it mean for my business? What about your business? I mean, how have you adjusted to this environment? This can't be easy.
Look, I've always believed that, I built my business on a platform of change. The fashion industry inherently is that. We have to be relevant at the moment of the moment. And relevant is a relative expression, and what's relevant and or what's fashionable to you today may not be to me, and what may be to you today may not be tomorrow. So it's a little easier in that regard, because we're used to adjusting and adapting, we're right now, we're encouraging people to work wherever they are and be as productive as they can be in ways that they can. under the circumstances that they are within which they are existing, and we're trying to be supportive and understanding. And I do believe at the end, what will come will be better somehow. We'll be more efficient. We'll find and create efficiencies and economies and processes that maybe didn't exist before. But it's going to be, an extraordinary journey. And, and it's not, the businesses are closing, schools, the uncertainty with our schools, and everybody's impacted by that because we have kids, and it's not our kids, it's our associates' kids, or it's our grandchildren, and the uncertainty with that and the impact to kids, not just academically, but socially and emotionally, is also dramatic. And that doesn't just affect them, it affects the whole family. So we're processing this and we're trying to figure it out. There's no clarity. Nobody has clarity. Nobody knows what this looks like. This isn't the road anybody's been down.
Yeah, or maybe it's a road that one group of people went down in the mid-1980s with the uncertainty. And I'm suggesting here that people who are at risk of developing AIDS and HIV positivity at the time faced similar kinds of uncertainties. It was hard to know who was going to get infected. It was hard to know what would come next. Was initially a death sentence for people. It just created for a smaller population that I think many people didn't relate to at the time. This same kind of stress, anxiety, uncertainty, you actually took it on right at the beginning. What motivated you to do that?
I believe that here's the opportunity to talk about something there was this dark looming cloud that existed over all of us, and few would address it. And I felt here was an opportunity to talk about something that was on everybody's mind, but not on their lips. And it was an opportune moment to say something that was important. And ultimately, the fact that people were reluctant to talk about it was the issue, because that's what fosters stigma, and so all those people who were presumed to be at risk were petrified, and they were afraid that they'd be judged, and they were afraid if people understood their circumstances that they would be diminished as a result. And so we did a campaign then that spoke about the fact that nobody was speaking about HIV. And but the difference also, though, is we didn't know how to, very early on in this cycle of that pandemic, we didn't know how to cure it, but we knew how to contain it. And we knew who was at risk specifically. We had a pretty good sense of that, which we don't have here. And that's a big part of the difference. And we did a campaign. I did one campaign early on, which spoke about the fact that we're all at risk. And then I did an ad in about 1990 with a picture, because we knew it was about safe sex and clean needles. So because it was intravenous drug users, and it was transmitted through sex, gay sex, more often initially. So we did an ad with a picture of a condom, and we said, shoes are not the only thing we encourage you to wear. But it was illegal to advertise condoms in those days, so we airbrushed off the words, and there was a concern that maybe it would be challenged, but it wasn't. And then at AMFAR, we started the first needle exchange program. So, but there was steps that were constructive steps that were able to be taken with a clear sense of facts and knowledge and data/science that would take us in a direction that would make hopefully a meaningful impact.
Well, it feels like there's more science around the pandemic than public officials acknowledge. And in some respects, I do think there are some parallels. Maybe you disagree with this, between kind of what we saw, at the policy, the highest levels of public officials in the 1980s. I was in the state legislature in Connecticut at that time, trying to advocate. I was the public health chair, so trying to advocate for people who are at risk of HIV infection and developing AIDS, and was dealing with, public officials at that level, who thought mosquitoes would transmit it, who thought that, they shouldn't go into restaurants and eat because it's going to be in the silverware and the spoons. And yet it took a while. I mean, I have to say, it actually took a couple of years, maybe even more, before we kind of cut through that kind of weird noise about that. And it feels sort of like the same thing's happening here. We know that masks, will do a lot. We know that physical distancing will help us a lot, but we still got that not so much background. We've got that foreground noise going on from public officials and leaders who are simply denying reality and denying facts.
We went through a cycle with HIV early on, where everybody was fearful of everything and each other. And then when it was clear how it was transmitted, then they almost became oblivious to it if they were not in an at-risk population. And we did a campaign in 2004, the same time I assumed the chairmanship of AMFAR, which was that we all have AIDS. The goal was to try to create a sense of urgency for everybody, not just those who were specifically affected, because the notion was if anyone is infected, we're all affected. And if it exists anywhere, essentially it exists everywhere, which is no more true, by the way, than it is in mental health. But and that also is a parallel here, because it has such extraordinary impacts on the whole community. When I started learning about mental health, mental illness, and then a year and a half or so ago, maybe 2 years ago initially, from my daughter, who was kind of driving the discussion, it was clear that 1 in 5 people, domestically 1 in 4 people, globally, apparently we're going to live with mental health conditions. You know this poll better than I do. And then, but I, in my heart, knew 1 in 200 people living with HIV. And HIV affects everyone everywhere. I mean, so we then, and I believe that it's not 1 in 4. I think it's 4 in 4. I think everybody, if it's not you, it's somebody you love or somebody in your family, in your community, or in the workplace, but we're all living with mental health conditions. And 2/3 of those are doing so in the shadows because they don't know how to address that and how to do it in a way that's not going to diminish them further, and that will move them and enable them and help hopefully heal them. So, in some ways, there's similarity, but it's magnified, I feel, quantifiably today. And I do think this is a pandemic of massive proportions and I think it's so much bigger than this virus that we're living through, than the physical virus. And there is so many more people that are going to feel the trauma for this for so many years.
Yeah, I agree. Again, we've seen it in our data, and I know that the CDC and the U.S. Census Bureau have done their surveys over the course of the last few months and have confirmed what we were seeing from the first week of the pandemic, which was this rapid increase in the number of people who are affected with anxiety, with depression, even the numbers of people who are experiencing symptoms of psychosis who never had before, that we're seeing certainly in our own populations who are coming to us for help and services is really astonishing. And you're right. I think this one has, far from the 1 in 200 or the 1 in 5 or the 1 in 4. I mean, this is about the 5 in 5. I mean, this is one of those times when I think everybody is feeling at risk. And as a result, everybody, is worried. Everybody is experiencing this uncertainty. And so everybody is at risk of having those worries transform to anxiety, depression, psychosis, or more post-traumatic stress and others. So I think you've nailed it.
The other thing too, I was reading recently that the impacts of COVID, I think 32% of the population were admitted feeling symptoms or were suffering from mental health and or substance abuse issues in June or March, and that statistic now in July was up to 53%. So it is so even if it's not a mental health issue as you know it, it is a very defining consequences. And then also they're saying that if it's not, it's affecting everybody, not just mentally, but also physically. So these are moments that we just have to kind of reflect and try to get our arms around and understand what this all entails and where it's taking us.
Yeah, and you mentioned that some of the push for you toward taking this on as an issue and building that coalition came from your daughter. I'm going to assume your daughter is significantly younger than you are and that I am. And just make a comment that one of the things that we're seeing, and we've seen historically, we've seen before the pandemic, was the effect on young people of anxiety, depression, worry. I mean, we've absolutely seen a deeper impact in the pandemic on younger people, but we've all used the statistic, and others will use it. We'll use it throughout this conference that half of mental illnesses emerged by the age of 14 and 3/4 by the age of 25. Was it in part because what your daughter saw and or experienced that kind of gave her the energy to say to you, maybe this is the next big issue to take on?
Well, I think it was one that she was taking on and she believed in, and another daughter did as well. It's something that's also I also observed, and whereas HIV spoke to a very specific demographic of the at-risk community was very defined early on in the process. What's so unique here is, to your point, it's not just old and young, it's Black and white, it's Jewish and Christian and Muslim, and it's tall and short, and maybe most important by here is Democrat and Republican. So it is a nonpartisan issue that affects everybody. So it's a very important moment, and I'm anxious to see if this is something that everybody can come together on, because there's not much that they do today, and because they need to. And the impacts of this, although a lot of it is rooted in some science, but not as much as in the physical virus. If we don't, I don't think we'll even have the capacity conceivably to deal with it eventually.
Yeah, I would agree. I think to those points, the ability to come together around this certainly is there, and it always has been in some ways. But the truth of the matter is that in the states, and the states have been responsible for a lot of the support and the funding of behavioral health services in the past, just the way the states and the federal government divided up the roles around healthcare. We were generally, last ones in, first ones out. So the last economic collapse or catastrophe that we had in between 2008 and 2013, states actually cut more than $4 billion from mental health budgets at the time, and had not fully restored that money when this hit. And so the natural response of public officials has often been to think of us last, but to take away our money first. And I'm hopeful that this time it is going to be a little different, because I think people do recognize it's affecting everybody and in very real ways. And it used to be that they could say, well, we have to focus on serious mental illness. Well, we have to take all mental illnesses, all mental health conditions seriously. And that opens the doors and opens our eyes to just how big an issue this is, which, as you say, isn't going to go away if we don't do something about it.
Yeah, and as we say, we think everybody has mental health, and we all have a deal with it and need to address it individually, and most of whom are very highly functioning individuals. So and it's not as recognizable to some people as of absent of engaging and making that at some level of effort to do so.
Yeah, and I think that the fact that it isn't as visible as some other, health conditions, I think has allowed people to neglect it and to not think about it. I think, again, from a policy perspective, but I just have to believe, from what I can tell, when I share my story, about my son and his mental health issues, and, my own story about, sort of different kinds of mental health issues, people tend to share their stories too. And one of the things that I really like about the Mental Health Coalition that you've created is that a lot of the energy is built around stories. And so would you talk a little bit about that, about the importance of the narratives, the importance of the stories in normalizing this, and why that in particular has become a focus of the Mental Health Coalition?
Well, we launched it with a storytelling platform that was created by my other daughter, Katie Cole, actually. And there's the and it's called, and what it does is it sets out to answer the single most asked question everywhere in the world, every day of the week, in almost every language, and the one most rarely answered, which is, how are you really? And so the goal was to engage people, encourage people to be vulnerable and express themselves in ways they might not ordinarily, in a platform that's safe, but amongst others that have made that leap of faith. And what happens is that, and there's so much anecdotal evidence and science that supports this, is that it helps people. It truly helps people, and it helps not just that individual who's telling a story, but it also helps those who can relate to that story and engage with the story. So the goal of the platform, anyway, is you log on, and it's howareyourreally.org. And then we have available, you can exchange, you can engage with other people's content, or you can set up your own platform, and you can be anywhere from vulnerable to empathetic, or anywhere between. And then you'll hopefully update your story, as your circumstances and time goes on. But it's a helpful tool, we find, and we're working on other mechanisms. The goal, you should know, is to destigmatize mental health, to rebrand it. And I'll take you back just a little bit to give you kind of from inception. So I was talking to people at NAMI, and they had asked if I would take on the project of to destigmatize mental health, and only because it's so overwhelming, and there isn't a safe narrative that one can access. I asked 5 therapists for definition of depression, and I got 5 different answers. So you can imagine how it is for an individual to talk about themselves and their circumstances. So we said, all right, so if we say we're going to work to ultimately change culture, is what it is, but if we're going to come up with a new narrative and to rebrand mental health, make it non-threatening, make people, enable a place where people be comfortable discussing their circumstances, would you support it? And they said, we're all in. And then I went to, initially a dozen other providers, some of the biggest in the country, and including your organization. And we basically asked the same question, including, by the way, Crisis Text Line and Child Mind Institute and the JET Foundation and National Alliance for Mental Health. That's NAMI and National Council of Behavioral Health. So every one of them said, we're all in, which was wonderfully flattering. But it was, everybody recognized the need to address this stigma, because it was just in and of itself so debilitating. And also recognizing, as I said, that 2/3 of those suffering are do it in the shadows. So we set out to and we engaged also some creative groups, people at Pentagram, who are great branding agency, agreed to do this pro bono. And so we set out now to rebrand and to destigmatize mental health. So the first effort was this storytelling platform. And we're working on a few other initiatives, which we're going to be launching shortly, that will be other resources that people can access. But the biggest opportunity here is the ability is aggregation, because you've got all this these extraordinary organizations that do great work, and often they're the best kept secrets because they don't have an ability to get that out there, to marry needs to resources in effect. So our hope is that we create one platform, and you go to mentalhealthcoalition.org, and we aggregate the best of what's there throughout all of our partners now. And there's 25 partners, and plus there's all these other organizations we're affiliated with, and we're affiliating with. So, and then the ability to, to access and to digest and avail oneself of some of the best minds, the best thinking in the space, is extraordinary. So, and 1 + 1 is unquestionably more than 2, especially in this space. And coming at it from a business mind, from business space, there are redundant resources that ultimately become made efficient by nature of the visibility and transparency. And then there's a void, and there's opportunities that become equally more transparent, or equally transparent. So the goal is to shine a light on all this great work out there, and that's what we try to do, and to magnify it and amplify it to the best of our ability, and that's what. And we're all very excited about a storytelling platform to engage people, and we launched that on May 15th with Kendall Jenner and her sister Kim Kardashian. It's a very high-profile, well-networked individuals who were anxious to tell their story, and we had 200 million views the first 48 hours, I think.
Yeah, I think that's worth underscoring. 200 million views in the first.
But but today, when I did my campaign about We All Have AIDS, We All Have AIDS, is I flew with Mark Seligman out to South Africa, and we photographed Nelson Mandela, and then we flew to LA and photographed Elizabeth Taylor and Elton John, and we also in South Africa we photographed Desmond Tutu and Zaki Ahmed. And we had all these individuals who were such heroes and such articulate voices in the struggle, HIV struggle, but they were all doing it in silos. So the goal was to bring everybody together on one stage. But in 2004, we reached maybe a couple 100 million people over many, many months. The ability to reach so far, so fast, so efficiently today is, enabled through social media, is very encouraging because, if you get everybody aligned and you aggregate all the best thinking and the best science and you identify the best resources, you can make a meaningful impact in the past you never could have, and today in ways you couldn't otherwise.
Yeah, no, that's exactly right. And I mean, we've discovered it ourselves just with this particular conference where we're having 10 times the number of people participating as would be able to participate in our in-person conference that we had expected to be holding, a couple of months ago or during this
Perfect
time.
Example.
Yeah. So, and I think that makes a big difference because in getting these stories out there and having people, even with, celebrity status say, me too, this is about me too. It's about my family. It's about issues that I face. It's about issues I'm concerned about, people I'm concerned about. I remember, the time of that AIDS effort, it was a little controversial because, everybody's, basically owning this. And some people didn't get it, sort of didn't get what the point was. This one, I think, is just a little easier because I think people get the point of this because, in fact, we all do own this one and we all do own the responses to it. And I agree. I mean, I think one of the things that's happened both through the coalition and certainly in my 6 years, when I came to MHA, I inherited a legacy of advocacy organizations and guilds who really didn't get along with one another very well at all. We each had little pieces of work that we did, and people were very nervous about other people getting into their space. And I think in the last few years, certainly all the leaders with whom I've worked have figured out that collectively we're so much stronger than we were when we were 1 + 1 + 1 + 1 + 1.
Right.
The group is much bigger. So, yeah.
You guys have done this actually remarkably, and what long before we did. And there's so much that we've learned, and so much more we still have to learn from what you've done. But I think you brought together 200 affiliate organizations or something, which is remarkable and a testament to MHA and to yourself. So congratulations in that regard.
Well, no, thank you for that. And I know our time here is actually running very short. So maybe I just want to give you, one additional, shot at just, is there something you want to just communicate to the people who are watching us here today that we haven't had a chance to cover here? And let me just.
Well, yeah, I would urge you to selfishly engage with us on social media, either Instagram and Twitter, and also and open yourself up and kind of engage with the content and allow yourself to be vulnerable. I did it truthfully. You can see my story, it was something I had never done before, and it was so therapeutic, I have to tell you. So, but I encourage you to do that. But I also, these are crazy, trying times, and I think there is no normal, and we just have to be open to what's around the corner, and we have to listen a lot better, and we have to be much less judgmental, and I think that and we'll get through it together if we just kind of we want to, and we're patient, and also with HIV, there was an action people needed to take, is they had to wear a condom, but it was interesting how it was easier to get people to protect themselves, knowing the science supported it. Today we have to wear a mask, so it's a lot easier to wear a mask today than it was to wear a condom then. So there are things we can do, and we can protect ourselves physically, but we can also protect ourselves emotionally, and we're not well unless we're well physically and mentally. The two need to work in harmony with each other, or neither accomplish what we need to see done.
Well, Kenneth, thank you so much for this. The power of your platform is immense, and you're using it to bring so many forces together. That's making a huge impact, and will continue to. I do want to encourage people to visit that website for the coalition. Take a look at what's there. Share their stories on that website. And,
the website's actually the mental is howareyourreally.org is a separate website for the storytelling, but either one of them you can engage with on social media, Mental Health Coalition or howareyourreally.org, and engage with it. Be part of it. Bring your community to it, and we're so much stronger together than we are independently.
Well, thank you. Looking forward to working together in the weeks, months, and years to come.
And congratulations, Paul, on this conference, which is extraordinary, which you guys did on relatively short notice, and on all the great work that you're doing personally and collectively. Thank you.
Thank you, Kenneth. Appreciate it. We'll be right back.
We're committed to educating and empowering communities to support one another through our mental health, substance use, and suicide prevention resources. Check out our evidence-based learning solutions and become a certified mental health ally at psychhub.com.
Hi, everybody. Welcome back. I am America Paredes. I am the Associate Vice President for Partnerships and Community Outreach here at MHA. My pronouns are she, her, hers, and I am so glad to be with you today. I am very pleased to be moderating our next segment and discussing the mental health impacts of COVID on underserved populations. Our next guest is an expert in this topic, and I am so pleased to have her here with me. Dr. Luz Maria Garcini is the Assistant Professor at the Center for Research to Advance Community Health at the University of Texas Health Science Center, San Antonio, and a faculty scholar at the Baker Institute for Public Policy at Rice University. The primary goal of her research is to inform policy and best practices among providers, as well as to develop and disseminate interventions for individuals and families facing adversity. Doctora Garcini, un placer tenerlo con nosotros hoy día. Thank you so much for joining us. We're going to dive right in because this topic is something that is so important to discuss, and I want to be able to have as much time as possible to chat with you. So, Dr. Garcini, welcome.
Hola, America, ¿cómo estás? Thank you very much for giving us the space to talk about, like you just mentioned, this important topic.
Y exactamente. Hoy día estoy tan contenta de tenerle con nosotros. I'm so happy to have you here, not only because of the work that you're doing, but because of what it means to have individuals like yourself doing this important work and be representative of individuals who identify as Black, Indigenous, and people of color. So I'm going to dive right into our conversation. So tell us, Dr. Garcini, a little bit about the work that you are doing.
Yes, so particularly focused on COVID, one of the things that we've tried to reach out and figure out is how is the current environment affecting the mental health and the well-being at all different levels, physically, mentally, and spiritual, of underserved communities. Such as the Latino community across the U.S.-Mexico border. You know, we also have other underserved populations, such as our Black communities that are also struggling. We have Native American communities that have also, you know, experienced a lot of the uncertainty that has come with the unprecedented times. So in trying to find out what are some of these mental health stressors, we can develop a better understanding as to how do we prepare to fight the COVID pandemic now and beyond. And as well as to understand how these mental health concerns can affect other behaviors, such as those that involve prevention efforts, like engaging in testing for COVID-19, engaging in the use of protective measures. Even when one becomes available, how is this going to impact the use of vaccinations and things of that sort?
That's very powerful. And, you know, when you think about the impacts across all of these communities, one of the things I think that really sticks out is the unprecedented need that exists for addressing the mental health, which many communities often don't talk about these issues, right? So with the pandemic, we've had to face the impacts of it without really understanding that it was coming. We at MHA knew it was coming, but the general public may not have really understood that. And what we value in the work that you're doing is helping others understand it's not just because of the pandemic, right? The pandemic has exacerbated these issues, but tell us a little bit about what you have found around the mental health issues related to the pandemic and just broadly.
Absolutely. So one thing that is important to emphasize is that the United States has experienced a mental health crisis for a very long time. We see high rates of anxiety, depression, suicidal ideation has been on the rise for some time now. So I think the current pandemic is a compounded stressor that is magnifying problems that we were already seeing. That combined with the current socio-political context in which there is a lot of confusion, where the rhetoric that is being used, that is being targeted to attack minority populations is causing a lot of mistrust in our communities and anxiety and fear. So we're seeing a lot of civil unrest, that is affecting a lot of the Black communities and everybody. So I think it's a lot of stressors combined at a moment when it's difficult to access services in the traditional way. And of course, for our populations, it's always been traditionally difficult to access services and most importantly, to find services that are tailored to meet their specific needs. You know, we need cultural and context adaptations to treatments to better meet the needs of our peoples, and many times they're not there.
Mm-hmm. You know, one of the things that I value around the work that you've done, particularly around undocumented communities, and something that's heightened because of the pandemic and the social political context in which we're living, is the fear that is associated with getting assistance. And what have you found relevant to that in your work?
Yes, I think that is a top concern that has come out in the focus groups and research that we've been doing. There is widespread fear in the immigrant community, and it extends beyond the undocumented community. You know, we hear a lot of legal resident families who are concerned of even seeking services because they don't know how those records are going to be used in the future and compromise their immigration legal status. So the distrust that permeates in our communities with the fear, their fear that, you know, if they diagnose positive with COVID-19, they're going to be separated from their families. And then, I mean, all of us have seen the pictures of families being separated at the border and children in cage, but I think now it has escalated to a level that even if you have legal status, you don't trust, you know, people are afraid, and we're passing this to our children. So there is a lot of fear, anxiety, and distrust that is affecting our communities.
Our screening data has definitely shown that, you know, an increase in both depression and anxiety. But one of the things that I think that is very relevant to this discussion is this, it's not unfounded, right? The fear that individuals have in accessing services, because there is information out there that says if you do go access services, something may happen. And that in many ways relates to the trauma that individuals may have experienced prior to coming to the United States, during the migration process and the post-migration process, right? Where they're just trying to figure out what they can do to improve their lives, and at the same time being traumatized. And recently, you know, the death of George Floyd and the unrest that has happened from that also is another trigger to all the trauma that individuals may have experienced, both as immigrants, undocumented, and underserved populations. What about, you know, the trauma aspect of all of this? What does your work and your research tell you?
Yeah, absolutely. Well, we have seen that there's definitely a high amount of trauma that is embedded in underserved communities. You know, and we know that in order to be able to address or treat trauma, the first step is to give people a sense of safety. You cannot treat trauma unless people feel safe. And unfortunately, within the current context, you know, due to the pandemic, and again, due to the current civil unrest and socio-political environment that we're seeing, that seems far from reality. So how do we address, or how to even avoid or train people not to re-traumatize individuals when they seek services? Because it is as simple as even a tone of voice that might trigger a trauma memory, right? It's the tone, the intonation, the way in which people treat you. Discrimination is being found to be a huge trigger for people with past histories of trauma. So I think we need to start being aware of what is going to be the long-term consequences of this potential exposure to re-traumatization in a context where services are limited. And what is it that we can do to better prepare ourselves to address these issues? The other important thing to mention is that trauma in minority communities might not necessarily present in the same way as we traditionally contextualize, for example, post-traumatic stress disorder. You know, there are different ways in which symptoms might present. So it might be in the form of overactivity, you know, it might be in the form of, you know, depersonalization, obsessive compulsive thoughts. They might not report functional impairment because at this point, engaging and overworking might be the way to distract yourself from having to experience that trauma. So how are we going to account for those experiences of trauma in these marginalized communities is essential. And we need to move to make that possible, to avoid the consequences of it.
You speak to so many issues that are so important that I would love to just have a conversation with you that could last hours. But one of the things that you said is very relevant to this conversation, in that, the way in which our communities, underserved communities, and Black, Indigenous, and people of color communicate around the issues that we experience may be very different than what is recognized in the westernized medical model of illness, right? So where we have a post-traumatic stress screener or an anxiety screener, and the reality is that our communities may not actually present those symptoms. And it really requires the professionals working with individuals across sectors, not just in the behavioral health community, to ask very relevant questions around their cultural context, and the nuances may come to fruition, right? Will naturally rise if the individual is very willing to share what their experiences have been. You also touched a little bit around this fact that many individuals are not necessarily, one, they're not presenting in the same way, but also, do you think that something that has happened in communities is that we have found ways to address these issues amongst ourselves, among trusted partners? And I think that's something that speaks to the resiliency of our communities, which oftentimes is not spoken about, right? It's the vitriol is all negative, and we at MHA and really believe in the fact that we also have to highlight the positive. And could you speak a little bit about that in your experience and your work?
Absolutely. One of the most fascinating things that I have found in my research with the undocumented community and a lot of underserved communities is the strength and the resilience that comes, that even in the face of multiple and chronic trauma, they continue to be resilient, and they continue to even report that life is not as bad. So there is a lot that we need to learn. And I think that it's so important how you mentioned that we need to address that, because maybe a lot of the times our treatments need to address strength-based approaches, that maybe we stop stigmatizing people and looking at them from a psychopathology perspective, but why not explore those strength-based approaches to make them strong and come up? They're extremely resilient in the way they use their own community resources, in the way they build their own support groups, their own information networks. So what is it that we can bring to these communities to strengthen them from within, given the limited access to services that they have, so that we can start using their optimism, their creativity, their ability to connect with their ancestral or with their cultural pride, to regain a sense of strength, a sense of self-identity that can keep them moving forward.
Completely. During the month of July, we focused a lot around the issues connected to Black, Indigenous, and people of color. And one of the things that we did was have an Instagram Live with Dr. Cesar Cruz, who spoke to us about intergenerational wisdom, right? And looking at the power that exists in the people that have come before us to find strength. And I think that is something that is often overlooked in our communities. Many institutions may not realize that, yes, funding is necessary to get all these things into place and to assist people. I believe that wholeheartedly. But I also believe that when we go out into communities and tell people, well, you have to show us outcomes within 6 months, and that's not the way our communities work. And giving yourself an outcome that is quantifiable, right, is very different than me being able to say, I actually had a 1-hour conversation with this person and she walked away feeling better, right? And I'd like for you to speak a little bit about that strength-based kind of approach and what that could kind of look like.
Yes, absolutely. And I think this is where we go back and I mean, medicine is doing it, right? They're moving to individualized medicine where we need to understand that what works for one individual might not work for another one, and yes, evidence-based practice is important, but we also need to think about that a lot of evidence-based practice was not developed with these hidden or hard to reach populations in mind. So how do we start learning from them, right? Even when we talk about symptoms of distress, I think in some of these interactions, we need to ask them, what are your symptoms of distress? Because the symptoms of distress that might manifest in this community might be very different to those symptoms of distress that might manifest for another community. Same with triggers for distress crisis. What are some of those triggers for a particular community are going to be very different to those that are for other communities. So we need to start thinking about it in outside the box, and carve a way first with humbleness to learn about what this community needs. I think these communities has been marginalized and discriminated for so long that we need to go back to our basics of what Dr. Carl Rogers showed us, which is unconditional positive regard. The power of listening to people with a full heart, the power of not judging, the power of working collaborative. In the previous session that was presented today in your conference, I heard about the importance of addressing collectivistic attitudes. How do we work together to get out of this? And I think that is the approach that we can take when we start thinking about strength-based approaches. Being the best of you so that I can bring the best of me and we can work together to figure out a solution.
That's very powerful. I think sometimes people forget that we do have the ability to work in that way because we oftentimes are siloed, right? And we forget that we should be reaching out to partners and other organizations that may be already working with these communities, maybe are more representative of these communities than we are, right? Instead of just saying we're the ones that have the answers, and looking to them to help guide us through these efforts. So do you have any specific recommendations of what individuals and organizations can really do to kind of delve more into this space and be more proactive around addressing the needs of underserved communities?
Absolutely. Thank you for that beautiful question, first of all. And it is important to emphasize that everybody has a platform in which they can make a difference. So you don't need to have a leading position, at a organization or at a hospital. Or everybody can make a difference to the current environment that we're living in, whether as head of household, right? If you're the head of household, make sure that your family knows about who these populations are. Make sure that they learn to treat people with respect. That make sure to learn what good and bad rhetoric means and what are some of those core values that we want to pass on to generations. If you're in academia, make sure that you make your contribution to train future providers, scientists, and leaders that will head the way in a way that we gain back this beautiful multicultural society that the United States have known for so long, and that right now it seems like it's under threat, and there's so much divisiveness around it. If you're in a hospital and healthcare, what can you do for the provision of services that can better tailor the needs of everybody, especially of those left behind? What can we do? Who can you collaborate with? There's a lot of beautiful, fantastic nonprofit organizations that people can join. Even if you don't have the expertise, volunteer in some of these organizations. Learn about the people. Learn about people that are different to yourself, with curiosity and with a way of wanting to find out how to work together to grow together. So there's definitely a lot that people can do. And I think in that process, we can work together, grow together, and get out of the current situation that we're in.
what really brings to your conversation and what you're talking about, what I automatically kind of think about is in communities that are oftentimes seen as underserved or marginalized, we oftentimes have individuals who are natural born leaders, and they've taken on those positions without ever really recognizing that they've become those people, right? Where you have the grandmothers or las abuelitas and the tias and the aunties that are the ones that are gatekeepers to these communities, and are also the ones that are really putting information in front of folks to say, these are the things that are relevant to you. And too often those people are not, they're forgotten, right? And for us, and I speak for myself specifically, right, as a Latinx person, collectively, my community is not just my immediate family, right? It's my aunts, my uncles, my cousins, people that I don't even know, because we're just naturally connected to one another. And if there's an opportunity, I think, to engage with people like ourselves, it also brings a genuine kind of point to the conversation, right? It is not about other people coming into our communities and saying, these are the things that are going to make you better. Instead, it's about saying, I am coming here because I feel like I can help me help you, help me figure out what that means and what that looks like, right? And you speak to that with all of the things that you've mentioned, right? Individually, when you're working at institutions, I think oftentimes people forget that there is power in our ability as individuals to push for change. And on the toughest days, we sometimes forget that. But on the best days, we have to remember that, right? And embrace that. And I think your work really speaks to that, and the work of your colleagues, because I know it's a collective, contribution that is being made. I wanted to ask you one other question around the work that you are doing. You spoke a little bit about undocumented populations and underserved populations in general, but one of the things that has come to bear with all of the things happening with the pandemic is the fact that in our communities, we oftentimes have difficulties asking for help, right? And is there a way that we can help navigate or help individuals navigate how to ask for help? And have you found something like that relevant in your work?
Absolutely. Another super important thing to address in our communities, particularly, and this is particularly relevant when we talk about gender roles, right? For example, in the Latinx community, when the idea of machismo, when men are supposed to be tough and not seek for help, and particularly now they're the protectors of the families, or moms, they keep working and seem like everything is fine when they're struggling between kids and in school and worrying about their husbands. So definitely, I think the way to approach it, I would say from a collectivistic perspective, is that you need to take care of yourself, because if you're okay, the people that you love will be okay. So take care of yourself, seek help so that you can be the best version of yourself to help those that you love the most. I do believe that it's hard to power when the cup is empty. And, we need to go away that looking for help is a sign of weakness. I would say is the opposite. Like looking and seeking out help is a sign of strength. It's a step forward in wanting to be the best version of yourself, wanting to have and regain the best life that you're here to have. So if we can shift that focus as to why is it important to seek help, we can also fight the stigma that surrounds mental health treatment in the way that we all need it. I always say to clients or to people when they come, it might not be for you, but you have nothing to lose and you have a lot to gain. So just give it a try. There's always new life skills that you can learn. And it's important also that you can serve as a role model for seeking help. And you really never know whose life you might even save by being that role model that say, I sought help and I'm fine now. There is treatment. We have treatments for depression, treatments for anxiety that work. So treatments for interpartner violence that work. So in being that role model, you can invite people to also lead the way and to seek help, and you might save lives. So it's absolutely, but I think we need to rethink in the way in which we invite people to seek help.
I agree completely. We have several questions that have come through our chat. So I am going to pivot to that so we have an opportunity to hear from you. The first one is from the Black Autist, and they ask, does the fear of getting info passed to law enforcement also contribute to fear of people in marginalized communities seeking mental health resources?
Absolutely. Anytime you have to disclose any source of personal information, people are terrified. They don't know what's going to happen with their information. They don't know how their information is going to be used. And they don't know what that information can do in the future. I mean, we have this with, unfortunately, I do some work with the DACA community, the DACA recipients. If you're not familiar with them, they're young adults who were brought to the United States as children by their parents and who have a temporary protective status. And the protective status has been threatened to be taken away. But they, when they were undocumented, they came forward with all of their information. And now that's their biggest fear is like, well, they know where we are. They know our families, you know. If something were to happen, I could easily be deported. So there is definitely a fear that permeates in seeking services, even to the point of that is life-threatening, because many people won't even go to the ER. I mean, they can be having a heart attack, and just the fear of going there and disclosing their status and giving their information will prevent them from going. And we've known cases of people who have passed as a result of not seeking health services.
I know, too, that there has been data recently that has highlighted the fact that individuals may not have sought assistance for COVID-related kind of symptoms because of that fear.
Yeah, absolutely. And that involves also not engaging in contact tracing, right? Which is essential to protect our families and to protect ourselves, because you have to provide the information. Imagine even, let's say, for someone who has a temporary or even a legal permanent status, the fact that they have to give out the names of people who have been in contact with and or families who might be undocumented, you know, it must be a very, very difficult decision. So people don't want to disclose. You know, identification is required. Many undocumented immigrants don't have driver's license, you know, or any source of identification. To get a COVID test, you're required to have an identification. So it's definitely getting in the way of trying to mitigate the current health crisis that we're living.
Definitely. And it speaks to some of the systemic issues, right, that exist in our communities, where we have not really thought about easing access to all of these services, but instead have created additional barriers. But that's a whole different conversation.
Yeah, and I think that another thing that is important to emphasize is that you emphasize a lot of the seeking access to services. These communities have been labeled essential. You know, we see a lot of marginalized and underserved communities who are providing the essential workforce, right? Who are at the forefront of building services, you know, of working at stores, but at the same time, they're not essential when it's about seeking services. So how can we do to clear that gap and not to harm our communities, because our communities feel betrayed and used?
Definitely. I mean, you see that currently with the current crisis, you know, with migrant farm workers that are still in the fields, providing all of us with the food that we eat, right? And they're still working amidst fire, rain, storms. It doesn't matter, right? They're still working. And oftentimes their health needs are forgotten. I also have another question from somebody else. Marcy Timmerman asked, what are some non-traditional ways we can bring mental health education and self-help to immigrant communities, since racism, xenophobia, and public charge are very real and valid concerns?
Wonderful question. I would say the first is to look for sources in the community that are trusted. And in that regard, faith-based organizations are leading the way. I mean, our communities trust them. So, you know, training people who can work. Unfortunately, a lot of our pastors and our priests and our faith-based leaders are overwhelmed. And sometimes they say, we need the training. We don't have enough training to deal with more severe cases or to deal with the volume of concerns. So how can the mental health field work with these organizations, with nonprofit community centers to deliver this information and these services to the community that they trust? The other aspect that is important is to start working with community health workers or promotoras or promotores. So these are trusted members in the community that bring out health information. They're trained within the medical model or the mental health model to bring out services. Unfortunately, the limiting barrier that we have there is funding. A lot of times there's no funding for these programs and then they die, or community health workers are overburdened and overloaded with work because the community see them as trusted members that do a lot of work with very little. They go to them. So it is important that we start thinking in this way. Or America, as you mentioned before, right? Start equipping our communities to build their own support systems. How can we teach them? It's almost like train the trainer model and bring our skills to them so that members of the community can be trained to help each other in times of need.
Yeah, what you speak to around the funding issue, I think is very important because many of the folks that may be watching today are also working in advocacy and policy related efforts. So identifying organizations that are working in this kind of framework and then going to them and asking how the funding is implemented and then integrating requests for this type of funding into future kind of efforts, I think is also very relevant, right? Instead of just simply focusing on what is there. You really have to dig a little deeper, I think, for many folks to identify the resources in the community that are there, because they are there. They just might not be on a billboard for you to see, right? Another question that has come up from Jessica Pina, how would you advise folks to address the complexities of trauma, especially among marginalized communities, particularly in a school setting where they are in spaces that traumatize them daily?
Yeah, absolutely. Excellent question. And I think it goes back to training, for example, in school systems, right? Training the teachers. And unfortunately, right now, we have a lot of that has transitioned with doing everything through the computer. But there's ways in which we can train people to look at the behavioral symptoms of trauma. You can see in the way people use the behavioral cues, the way they engage in eye contact, the way in which they respond to a command, the way in which they interact with other children. So I would say the key is first training teachers, training providers to first identify potential signs, to second, assess if the trauma is present, which is essential to create a sense of safety, because then you immediately start moving to putting that person into a safe environment. And then how do we go about trying to figure out how to do the best that we can to provide trauma treatment in environments that are not safe, so that the person can continue to cope and find some help in the midst of the adversity that they continue to be embedded in.
One of the things that in what you're saying kind of makes me take pause for a moment is the fact that in some of the research that I've done, it has been demonstrated that individuals who have higher rates of acculturation, right, have lived here in the United States for much longer periods of time compared to their children may come to exhibit some intergenerational conflicts because the child is trying to adapt and more easily oftentimes adapts to the American culture compared to their parents. And when you kind of push that into the realm of school, that can be very difficult to kind of manage. And I think it's something that maybe is relevant to the discussion. Do you have any thoughts around that particularly?
Oh, absolutely. This is something, and the best example that I have also found that is in my research is with DACA recipients and their families, where we have kids that came to the United States and became immediately acculturated. Many of them speak English much better than they speak Spanish. And some of their parents don't even speak English, right? So they become, these children a lot of the times become the culture navigators for the entire family. So they really never have a time to be children. They start having responsibilities of being navigators and bridges to their communities and advocates to their families since very young. There's a big responsibility. Some of the feedback that they give is like they feel this double life, that, for example, when they're in school, they're already thinking about the responsibilities they have at home, but they kind of have to fake, and live in this less mature environment. And when they're home, they have to take charge. So it's very stressful and it's very tiring for them. And I think over time, we can see the negative consequences and impact that that's going to have, not only on the mental health, but if we look at the research on biology now, the long-term effects of this type of stress on the health system, the development of chronic illnesses such as cardiovascular disease, high risk of trauma, and now with epigenetics, we know that there might be a risk to pass on to future generations as well. So I think we need to be careful and pay a lot of attention as to what these dynamics are having, how they're impacting the way in which families from different generations interact, and how can we create better environments at work, at home, and within our organizations so that we can give them some rest.
Definitely. Somebody asked a very relevant question too, and that they asked, how do teachers get the support they need? Some teachers have reported trauma or abuse in the home, and yet our laws do not protect youth. Some teachers struggle with that. So what would your recommendation be for teachers that are kind of struggling through that?
Yes, I don't do child psychology or school psychology, so I feel very limited in terms of giving my recommendations as to what teachers can do specifically. But I would say the first step is going to advocate probably to their offices for that type of training, for that type of resources. Everything begins with awareness, right? I've always believed that anything that can be measured can be managed. So take notes of everything that they notice in their classrooms, of things that they need, and report back and say, we need this, organize among yourself to claim for your training needs, to say, we have this problem. Without your eyes and without your knowledge, we can't do much. So we need to have that voice that represent those students and that represent the needs of teachers to be able to develop interventions and treatments. Or, look for nonprofit agencies in the area of education and bring your concerns and highlight those areas that are dark that we might need to develop resources.
That's very good. One of the things I know that is relevant for our work, we just released our back to school toolkit that is focused around coping with COVID, but it's not only relevant for youth, but it's also relevant for parents and teachers. And, teachers are fundamental in the development of our kids in our communities. And I think oftentimes they are forgotten, right? We know they're there, but their needs are not addressed as often. So I would also recommend that, teachers really focus on reaching out to some of the leaders in the field, whether maybe it's engaging with the National School Boards Association, figuring out what that would look like, or the PTA, and the unions, right? Unions have a lot of power, and they're fundamental in the way that things can get done. I want to make sure that I'm very mindful of time, so I'm going to ask a couple of more questions. Somebody has asked, Jay Reynoso asked, how do you identify safe haven organizations in a super politicized environment? Most religious organizations now are aligned with the current government mentally of labeling people as bad folks.
Yes, absolutely. You have to do a lot of work behind that. I would say the first thing is to read some of the materials that they have published, read their mission and their vision, have a call with their officials. You will see or you will hear the rhetoric. Look up for, now we have the blessing of having technology, right? So watch out some of the YouTube videos that they have put out, and go with your gut instinct. Usually you can hear when they're speaking to your heart, and you can hear if there's something that is not appropriate. But I will say, unfortunately, a lot of the work is going to have to be done by the consumer. But there's some excellent immigrant organizations. Another key aspect to know between what is a good organization to volunteer or work with is look at the resources what create. What are the deliverables that organization has? If it's an organization that just asks for donations, I would say I will have my questions about it. But look, are there tangible deliverables, whether it's educational materials, whether it's educational videos, whether it's fairs, health fairs, or campaigns, or organized activities that they have put out? If they have deliverables that has served your community and that you feel that it is helping their needs, then I would say it's worth looking into it. But I would say look at the deliverables first.
Thank you. I am going to ask one final question and then just chat with you for a moment. Is what can I do for people of color in predominantly white communities? What kinds of safety or services can I provide? That's from Sarah Beth Lowe.
Yes, beautiful question. I think that to get out of the environment that we're in, we need to look beyond color and start, learning, having that willingness to learn from each other. There's nothing more beautiful. I mean, when we look at our school systems, right, there's a lot of the times when we see a white kid, a black kid, and a Latinx kid, Native American kid playing together. So how does that happen? Why can't we do that at adult level and learn? So I think working together and showing that desire of learning from each other, right? Creating opportunities for dialogue. We have heard so much divisiveness and attacks. We see it in the media all the time. We see it in even our own organizations and meetings. So how, instead of that, how can we create dialogue in communities where maybe minority people, could feel more welcome to come and express what they think and work together solutions. I can tell you, I work with students of all different colors, and it's so rewarding to see when there's a collaborative effort that transcends the color of skin and that works for the common good of how do we create a better society that we all move together and learn from each other.
Those, I think, are so valuable kind of thinkings that we have to then focus on, right, when we do our work on a daily basis. Dr. Garcini, we're almost out of time. Do you have a final thought that you would like to share with folks?
Yes, absolutely. So first of all, America, thank you. You and I do very similar work. So thank you to Mental Health America for giving the space to this important topic and to be open for the discussion. I invite everybody. Everybody can make a difference right now. Help people learn about each other. Try to fight stereotypes. Help find ways to create peace. And let's stop dividing ourselves. We need to be stronger than ever to fight this thing that we're living with. And let's all work together to end up mental health stigma, because I do believe that there are treatments out there that can provide better life if we're just open to learning.
Thank you, Dr. Garcini. It has been a wonderful, wonderful time for me to just chat with you. And I know everybody that's watching is also going to take this information and see how they can implement it in their communities. Gracias por todo su trabajo. Thank you for all your work and the continued efforts that you're going to do. Our time has ended, but we will be connected again in the future. Thank you all for watching. We're going to be right back in a few minutes.
We started off 2020 thinking it would be a typical year. Instead, it's turned out to be anything but normal. A lot has happened outside of our control, yet we're not powerless. This November, the mental health community has a unique opportunity to make our voices heard. Here's how you can take action. Register to vote, and if you've already done that, double check your registration status just to be sure. Request a mail-in ballot today and return it as soon as possible. Pledge to help 5 people register to vote by texting "We Vote" to 345-345. Learn where candidates stand on mental health issues at mentalhealthforus.net. Finally, fill out the census to help ensure that political representation and federal funding reflect your community's needs. Together, we can improve our mental health care system and make a difference. Thank you and happy voting.
Hi everyone, my name is Maddie Reinert and I'm the Program Manager of Population Health at Mental Health America. I manage the MHA online screening program, which is a collection of 10 free, anonymous, confidential, and clinically validated screening tools that you can access on your own online, and they're a great way to check in on how you're doing. Since we launched the program in 2014, we've had over 5.5 million people come on and take a screen, and 57% of them had never received any kind of treatment or supports for their mental health before, so they're able to access this information for the first time. And with the optional demographic questions we ask when someone comes on to take a screen, we're able to learn more about who is experiencing severe mental health challenges, what their experiences are, and what kinds of treatments and supports they're looking for. So if you're concerned about your mental health, take a screen at mhascreening.org, or if you want to know more about the program or what we've learned from the data about our screeners, you can email me at mreinert@mhanational.org. Thanks!
Hi, my name is Hannah Lucas.
And I'm Charlie Lucas.
A few years ago, I was diagnosed with a chronic illness called POTS that caused me to faint frequently, and I became extremely anxious, depressed, and even began self-harm. And in my darkest moment, I didn't have the tools to reach out and ask for help like how I wanted to. That's why my brother and I created the Not Okay app to help the user reach out during their time of crisis.
The Not Okay app is essentially a digital panic button that, when pressed, it sends a text message to your pre-selected up to 5 closest contacts with a text message that says, "Hey, I'm not okay. Come call me, text me, or come check up on me," along with the user's current GPS location and directions.
Exactly. And in 2018, my brother and I were awarded MHA's Empower Award. The Empower Award celebrates the life and work of a teenager or a young adult who has spoken out about mental health issues to educate his or her peers and fight the stigma.
This year, we are pleased to present MHA's 2020 Empower Award to Satvik Sethi.
Satvik is a 22-year-old mental health activist and social entrepreneur on a journey to make the world happier. He's the founder and chief executive officer at Runaway, a 100% student-owned and operated social venture that aims to promote mental health awareness and help those in need of emotional support. Runaway has been featured by UNICEF, the World Health Organization, and even Vice. Satvik has also been featured on the 25 Under 25 Social Entrepreneurs list by Impaction and Culture Media, and has been recognized as one of 8 Inspiring Mental Health Youth Activists by Mashable, and one of 15, Changing Collegiate Mental Health by Mental Health America, as part of their first ever cohort of our Collegiate Mental Health Innovation Council, for the impact he has created throughout his passionate advocacy. So let's give a hand to Satvik.
Congratulations, Satvik.
That's right.
Winning this award is truly one of the best feelings of my life. I started working on my mission of making the world happier because I never wanted anyone to feel the way that I did when I was 15 and felt all alone. Since then, I've gone on to speak in over 450 strangers on Instagram. I started my own social venture, Runaway, that promotes mental health awareness. I've hosted events, I've spoken at conferences, I've worked on mental health research. I've done whatever was possible for me to do to work towards my goal of making sure that people have free and accessible mental health resources. It's been a long journey to get to be here today. There were times where I felt as alone as I did when I was 15. I was met with haters and doubters and voices telling me that I'd fail. But now more than ever, I'm determined to keep going, and I will not stop till I've made the world happier. To anyone listening to this, just know that where you are today does not dictate where you will be tomorrow. Find your support, follow your passion, and don't stop till you've made all your dreams come true. Because, as Roald Dahl once said, those who don't believe in magic will never find it. I'm indebted to the support I've received, and I'd like to say a big thank you to my family, my parents, my sister, my grandparents, and my great-grandma, who've always watching me from heaven. My family always taught me to be a kind and unselfish person, and to always give to others whenever we can. I want to thank my friends who've given me the motivation and encouragement to keep going and keep chasing my passions. I want to thank Professor Kahai, who's always been one of my biggest supporters. Next, I want to thank Mental Health America, firstly for this huge honor, but for also always providing me with the opportunities to share my passion for mental health with the world. And a special shout out to Kelly Davis for being the first person in the mental health ecosystem to take a shot on me by accepting me to the Collegiate Mental Health Innovation Council. I want to thank my well-wishers at UNICEF, Marcy and Joanna, who've rooted for me and have given me a platform to share my work. I want to thank my Leading Minds family, who've quickly become some of my best friends and have been there for me ever since I first met them. The biggest thank you and so much appreciation goes out to my incredible team at Runaway. I owe so much of who I am and what we've achieved today to all of you. Without your support and hard work, none of this would have been possible. Thank you for trusting me and joining me on this mission. Finally, I want to thank everyone who's ever supported us in any capacity, whether it was a text, a conversation, a shared Instagram post, or anything else. I hope I can continue to make you all proud by reaching new heights. Let's go out there and make the world happier.
Hi, everyone. I'm Tom Starling, the past board chair of Mental Health America and the CEO and president of Mental Health America of the Mid-South here in Nashville, Tennessee. I'm honored to be here today to present the 2020 Innovation in Programming Award. MHA's Innovation in Programming Award recognizes the continuing innovation and creativity of the MHA affiliate network in program development and implementation. This year's award goes to the MHA of Greater Dallas and its Mind Your Garden program. When we think of parks and think of places for people to commune and connect with nature, this is the ideal program. It provides places for people to have fun, find mental, physical, spiritual health, and social well-being. I think these days, maybe more than ever before, this is just a great chance to gather in parks and green spaces to help restore people from the stress of day-to-day challenges, hassles, and struggles. The Mind Your Garden program was created as a community movement to promote the relationship between mental health and the environment. In partnership with the Texas A&M Forest Services and the Texas Department of Parks and Wildlife, MHA of Greater Dallas created an opportunity for the Dallas-Fort Worth Metroplex to develop healthy coping skills while utilizing nature within an urban setting. Through this program, they provide the community with needed resources to achieve overall mental health. With the current state of this world, this program is designed to help consumers by creating a relationship with nature and by making mental health a priority. This initiative ensures that people have access to parks and green spaces, which lowers their stress and depression and increases their overall resiliency with life and helps to prevent and even treat mental illnesses. Let's now hear from Bonnie Cook, the CEO of Mental Health America of Greater Dallas.
This is Bonnie Cook, and I'm the Executive Director of Mental Health America of Greater Dallas. I want to thank everyone for this wonderful award. I want to thank Mental Health America, I want to thank Texas A&M, and want to thank all the staff from Mental Health America of Greater Dallas that have worked so hard to implement this project and our plans for our tree project. When Texas A&M first approached me about doing this particular project, I was somewhat skeptical. But as we've moved forward and come up with different ways to improve the work that we're doing, through this program, we are able to give away trees to individuals. We are able to use the screening data that Mental Health America National provides us, and we are in the process of mapping that over different canopies of trees within the Texas area to turn around and see if there's a correlation between mental health and being outside in your environment. So if any other affiliate is interested in learning about our project, please feel free to contact me. And again, thank you so much for this honor.
Thank you, Bonnie, and congratulations to everybody at MHA of Greater Dallas. We're going to take a quick break, and when we return, we'll hear from San Francisco 49er player Solomon Thomas and his parents, Chris and Martha, who will sit down with Paul Gianfrido to talk about how they're using their voices to break down the stigma around depression and mental illness.
Hi, I'm Kelly Davis, Director of Peer Advocacy, Supports and Services at Mental Health America. At MHA, I lead our Young Adult Leadership Initiatives, a series of programs dedicated to finding and highlighting young adults who stepped up and created innovative policies, programs, and other mental health initiatives in their communities to support the mental health and well-being of their peers. You can learn more at mhanational.org/youngleaders or reach me directly at kdavis@mhanational.org.
Solomon Thomas is entering his fourth season in the National Football League, as a member of the San Francisco 49ers. The defensive lineman who starred at Stanford University played a key role in leading the 49ers to the NFC Championship this past year and to an appearance in Super Bowl 54. But in 2018, a year after he was drafted into the NFL, Thomas's older sister Ella died by suicide at the age of 24. This tragic loss motivated Solomon, or Sally as his many friends know him, to use his platform and voice in raising awareness for mental health and for suicide prevention. We are joined now by Solomon Sally Thomas, along with his parents, Chris and Martha Thomas. Thank you all for joining us today.
Thank you so much for having us, Paul. We appreciate it.
Thanks. Sally, many know you, of course, from your collegiate career at Stanford, and then your professional football career with the 49ers, and the Ed Block Courage Award, and also the recent Super Bowl. But you're also known and well regarded for your community service, your volunteerism, and raising awareness now for suicide prevention. No doubt your parents are very proud of you. Could you start by telling us about Ella's Sunflowers? And if you could share some of your sister Ella's story, her dreams, hopes, ambitions, and her struggles?
Yes, sir, definitely. So I'll start off talking about just Ella. So Ella was my big sister. She was my protector, my best friend, and just my life partner. We were inseparable towards the end of our relationship, end of her life. But we grew up, had an amazing life with our parents, and she was just a ball of sunshine for me. A great role model for me. We did a lot of things together. She was always there for me to confide in. She gave me my sense of confidence. She taught me how to love. She taught me how to dance. She taught me how to smile. How to talk to girls. How to do everything. But Ella's Sunflowers started. We started Ella's Sunflowers about 6 months after Ella died by suicide. My family and I were kind of stuck in our phase of grief, and we didn't know how to keep walking forward. And someone came to us with the opportunity to walk in the AFSP overnight walk, the American Foundation for Suicide Prevention. They have an annual overnight walk, and it was in Dallas. It happened to be in Dallas that year. And at first, we really didn't want to do it, but my mom encouraged us to do so, and we ended up, raising over $50,000 and walking 16 miles overnight, to raise awareness for mental health, research and studies and awareness. But it was a great process for us, and it was a great way for us to learn how to walk with our grief, as my mom says. But that's kind of how Ella's Sunflowers started. But that's just a quick brief over Ella. I could go on for days, but I guess what do y'all say about Ella's Sunflowers? What would y'all say about Ella's Sunflowers?
Well, Ella's Sunflowers, literally just walking. The physical act of walking helped us to learn how to walk again. And the sunflowers were Ella's favorite flowers, so it was easy. We used to take pictures of sunflowers and send them to her. When we sent her flowers, we'd send her sunflowers, so that it just fit.
Yeah, and there's a quote about a sunflower that it doesn't last a long life, but while it does, it illuminates brilliantly while it is alive. And that was sort of Ella's life. She was a lot of the world and a lot of conversations, and she just lit up the room wherever she went. So the sunflower was very appropriate sort of image for the walk.
The sunflower sounds like a perfect image and just seems to capture her spirit so well. Sally, there was a story you told about her in one article that I read when you all took a vacation to San Francisco at one point. You said you kind of had to pull her away from going from homeless person to homeless person because you wanted to give them all money. That resonated so well with me because my son Tim, who is in his mid-30s, has spent most of his adult life homeless in San Francisco. He might have been one of those people that she wanted to go up to give some support, to give some money. So that was just special for me to hear that. Was she always like that?
Yeah, she was. She would always be asking my dad for his wallet so she could find ways to give whatever she could to a homeless person. Even if it was just to talk to them, she would find a way to try to make them smile, try to make their day. She just wanted to love on everyone. You know, it was a passion of hers. She had a huge passion for helping others. She had a huge passion for mental health because she personally struggled from it so much, and she knew what other people were going through, and she felt their pain, and she wanted to be able to help others going through the same thing. You know, she had a huge passion for those who struggled through sexual assault, especially young women and young girls. She suffered from that at an early age and at a young age, and she knew that pain, and she wanted to help others going through those problems as well. She just wanted to let people feel loved. She wanted to make sure that they felt important, that they had a sense of value in this world, because sometimes this world can be pretty dark and pretty evil and can make you feel like you don't hold any value. So she wanted to make sure that anyone she talked to, that she made them feel valued, that she made them feel loved, and she just wanted to help people smile and help them continue their life.
I know it was just a tremendous shock to you. I imagine this affected you all so deeply, to have somebody whose light shone so brightly to appear to be dimmed that way. Can you just talk a little bit about how you all coped? Walking was one of those things, Martha, that you said, but how did you all begin to move through this and move forward to some form of recovery here?
A lot of it was wanting to live for Ella, because she would have wanted us to keep living, and she would want us to keep finding joy. It took a long time to get there. You know, you kind of bob up and see a little bit of light now and again and think, wait, there really is light out there still. And Ella's part of that light. And I was overwhelmingly struck with the waste of her not being here on this earth. Just really, really missing her presence and feeling like the world was missing her presence. And I'm sure every parent who has lost a child feels that way. And they're right. Like, the world isn't a better place without them. The world misses them, and just like we did and do every day.
Absolutely. And the other, piece, with Ella's passing is, aside from wanting to make sure that we helped others, is to help make a difference for those families who are suffering, and to provide, research, tools, support to help another family not go through what we've gone through, and to do whatever we can, whether it's talking like Solomon does on this platform, whether it's working with Mental Health America or American Foundation for Suicide Prevention, or even local groups. It's just an important piece to keep talking about the importance of mental health development, so that others don't go through this type of situation.
You're so helpful to parents, I think, who are going through grieving. This year, of course, so many tens of thousands of people have been unexpectedly added to the list of family members who grieve. I really appreciate the fact that you can look forward. People who know me, know my family, know that I lost an adult daughter to cancer just a couple of years ago. It's been very hard to find that light again. It's been very hard to find that hope again. I want to ask you, parent to parent, when was it that you started feeling hopeful about the world, about the possibilities of celebrating life within the world?
I will say that the first 4 months maybe were very, very dark. And then there were, it's like you catch yourself smiling, or, I'd laugh at something and be like, oh, wait, I'm not supposed to be laughing. But then, rather than being sad about everything with Ella, I started practicing gratitude just before I got out of bed. The simplest thing I could do, being grateful for 5 people every morning, and I still do it. And sometimes it would make me smile before I even got up. Sometimes it would make me laugh. A lot of times it's Chris and Solomon and Ella that I'm thankful for. But that's okay for the moments we had with Ella. That's been, being grateful has been a huge kind of shift. Not always feeling sorry for our loss, but also being grateful for the life and the time that we had with Ella.
Sally and Chris, what makes you smile?
You know, to add on what Martha just mentioned, every day I wake up and I thank God for the 24 years we had with Ella, her light, her brilliance, just her warm heart. And I think the shackles sort of came off my shoulders when we did the walk with AFSP in Dallas, and to just see all those people there gathered. First part was when Martha and I were part of the AFSP National Board breakfast, and we met a lot of other parents who went through the similar situation and who raised a lot of money and awareness and research to help drive and make a difference. That was sort of like a light that went off in my mind saying, here's how we turn tragedy into purpose. And then the walk and seeing other parents and siblings and friends and relatives go through the suffer, but also hold each other up, lift each other up to help make a better tomorrow. And although each day is difficult, and we have a really good friend of ours who always asks, how are you today? Because each day is totally different, and just trying to find a go out there and just make a difference. And I get joy out of trying to make a difference through these types of mediums. Being on the AFSP National Board, working with local companies and local support groups that help just bring awareness and change for people.
How about you, Sally?
What makes me smile, thinking about the amazing memories I had with Ella, those make me smile when I'm reminded of her through certain people, through people she loved, or just when I see her work being done through us, when, I get a letter from the team and it's someone telling me how they were about to take their life and now they're going to survive, or someone telling me how they weren't able to see the light after they lost a loved one and now they can see the light in the darkness. And that's what makes me smile. Seeing her dog Mickey makes me smile. When I am true to myself and I'm the person she knows to be, that makes me smile because she'll be proud of me. And just when I see other people smile, other people happy, that makes me smile because that's what she wanted. She just wanted everyone to be happy and everyone to smile. And, she just wanted a loving earth. So yeah.
Every month since the start of the pandemic, tens of thousands of people, and now hundreds of thousands of people, have come to Mental Health America to take a mental health screen. 20 to 25,000 of them each month are telling us that they have either suicidal or self-harm thinking on more than half the days of the week. What do you say to them? They're coming to us and they're reaching out. We know there's an opportunity to answer. What should we be saying to them to try to help them through these most difficult times?
Kind of my message, I always starting by saying I'm not a mental health professional. I'm not, a doctor. I don't have a degree in this, but what I can tell you from my experience is to tell people, and what I've learned throughout these last 2.5 years is that you're perfectly perfect the way you are. It's okay to not be okay. It's okay to feel weird. It's okay to feel awkward. Your emotions are valid, and you should empower all of them and understand that they all hold value and you're feeling for a reason. But just to let them know that there is light in the darkness they're going through, even though you may not see it currently, but at some point, if you keep fighting, if you keep believing, there will be light and there will be a tunnel at the end of the dark storm they're going through. But to let them know that they're loved, that someone out there loves them, that there's people out there who love them, God loves them, and that there is so much more life, and they're so important in this life, whether they see it or not. That they're loved, they're important, and that they hold so much value on this earth. That's always been my message when I started speaking publicly about it. But I'm sure my parents have different nuggets to say as well.
I would just like to encourage people to understand the value and the power and the energy they bring to someone in their life, whether it's a family member or a friend member, and to just encourage them to live for another day and to make a difference in that day, and that there's no problem that's permanent that can't be resolved, to take the next day and live it through and to help themselves out, and also reach out for help, because that's sort of it's okay to ask for help, and it's okay, like Solomon said, to be vulnerable. And we don't have to be strong, macho people, in particular, black men. Go ahead and ask for help. Whether it's your clergyman, whether it's a friend, whether it's your teammate or your classmate, it's okay to ask for help. And we're not perfect. It's okay to be perfectly imperfect. And that's just to live another day.
I guess I would say focusing on the smallest things that you can control yourself, whether it's just getting out of bed, you got your clothes on, appreciating yourself for doing that. They can be dark days. I mean, these can be long, a lot of isolation for a lot of people, and just acknowledging your feelings and that they really are, it's okay to feel that way, but you also don't have to continue to feel that way. It's okay to not feel that way, be fluid.
Yeah, I think we put a lot of pressure on ourselves, and sometimes we inadvertently put pressure on other people when we say, well, each day is going to get a little better than the last day was. The fact of the matter is that it's up and down. Some days are better, but some days are worse. And it's okay if today is a little worse than yesterday was, because on the whole, we're still making progress. We're still getting up every day. I've kind of had this new mantra where I'm now happy about Mondays. Like everybody, I never used to be happy about Mondays, but I've learned to be happy about Mondays because, well, it's Monday and we're all still here.
Amen. Amen.
We ended up changing the bar, didn't we? There's so many hopes and aspirations. We think we're going to go through life without a whole lot of challenges. But then we get dealt some things. Everybody does. We learn to set the bar in places that, like you said, Martha, that are just a bit more manageable. It's like, what can I do today? I can get out of bed today. I can make dinner today. I can go practice my craft or my trade today. There are certain things I can do every single day. And it's all part of living with a little bit of hope and eventually a lot more joy. Don't you think?
Yes.
Absolutely.
Definitely, sir.
Yeah, I'm also glad, Chris, that you brought up the whole macho thing with men and about black men in particular. There's a lot of people with strong racial and ethnic experiences in which they've been told as men that they're not supposed to feel things very deeply. They're supposed to be strong and stay strong. Sally, you know football players too. They're not supposed to have these kinds of feelings. These are big, tough guys. It's useful, isn't it? Or helpful for people to understand that you can be a big, tough guy at any size and still feel things deeply.
Definitely, yeah. I like to talk about a lot just how we are graduating and moving on from this toxic stigma against mental health, and with men in particular. We always used to tell men, you're strong, you're tough, you'll get through it. Just keep your head down and keep walking, keep moving forward. We say, that is what a strong man is. And Obama said it best, to be a man is to be a good person. But I also think to be a strong man, or to be labeled as a strong man, is to be vulnerable. Because when you're vulnerable and you express how you're feeling and are true with your emotions and open up to other people, that's way harder to do than just tell someone, oh, I'm good, or I'm fine, I'm okay, like, I'll be good. Like, that's easy to say. I can say that all day. But to tell someone how I'm truly feeling and whether I'm feeling pain, whether I'm feeling happiness, whether I'm feeling joy, that's way harder. Or whether I'm feeling weird, and to open up to someone and talk to them about that is to be strong. That is to be vulnerable, is to be a strong man. And I'm trying to make that the new normal. I want that to be the new stigma. I want that to overcome the new stigma. So that's kind of been my motto and what I'm trying to recreate, what to be a strong man is, and it's to be vulnerable. And there's so many beautiful things about being vulnerable. When you open up to someone, you have the chance of getting hurt. It's part of being vulnerable, but you also have the chance to let someone else open up. You have the chance to let someone else be vulnerable with you, and that could save someone's life. Like me opening up and telling someone, oh, I woke up today, I'm feeling pretty down for some reason. I don't know what it is, but I'm feeling down. And then just hearing that, they can be like, man, I felt sad today too. And so and then we can just talk about our sadness, talk about why we feel down, and that conversation could save their life. Or you telling those kind of conversations are what is really changing people that you might not even think about or give that much thought to.
One of the members of our board of directors at Mental Health America is Dwight Hollier. Dwight had a very long and prosperous career at the Miami Dolphins. He's with the University of North Carolina now, of course, but when he came to our board, he was the clinical services director for the NFL. He came and spoke at our annual conference a few years ago, as we were getting to know him, and he really talked about the mental health needs that existed in professional sports and in the NFL in particular. I imagine, Sawi, that when you started talking about this, while there may have been some people out there who would have said, whoa, the NFL, that's a kind of a macho place and all that. You can't talk about this stuff there. I'm just imagining that maybe it was different, that some of your teammates and others, maybe they opened up to you as well, and maybe hadn't before until you opened that door for them. Would that be fair to say?
Definitely. It wasn't a heaping amount of people who came to me opening up, just telling their life stories, but I definitely had teammates come to me. I had all teammates from Stanford, I had all teammates from high school. I had athletes from around the world open up to me and just reach out to me and talk to me. One that was really meaningful to me, growing up, I was a huge football geek growing up, of course, but Tyrann Mathieu reached out to me one time on Twitter and just said, I respect your story, keep pushing, keep fighting. And even though he didn't open up to me about his life, him reaching out and telling me, Tyrann Mathieu, one of the best players in the NFL, Hall of Fame caliber player, reaching out to me, telling me, to keep pushing through, that motivated me to keep going, to keep pushing my story. If I'm reaching his height, I can reach any height. So, and I've had other people like in different realms reach out to me of his level, but it's motivating and it keeps me wanting to do more and to keep pushing and to find ways to keep building what my family and I are building.
Well, I'm so pleased about that. I'd like to kind of close with a general question for you all. And that is, how is it that organizations like Mental Health America and our good friends at AFSP, I love working with those guys, we do a lot together, but how is it that we in the mental health community in general can support what you're doing and continue to honor Ella's memory? Could you share any advice and words of wisdom for this great big advocacy community out there, many of whom are watching us right now at this annual conference? Tell us, what can we do to help? And what can we do to honor Ella's memory?
I think one is just facilitating for people to tell the truth about their emotions and what they're going through, what they've gone through, how they've recovered, how they still struggle, but really letting people speak the truth and teaching people to listen to the truth as well.
I would say three things, aside from Martha just mentioned, which is very important. One is legislation. We need to find a way that mental health parity exists across all realms. Other thing is programming, like what we're doing today, is so paramount in helping drive and silencing the shame of mental health, people not wanting to talk about it. Another piece would be funding. How do we get support groups out in the key communities, whether it's school, whether it's corporations, to really help make a difference to keep the discussion going on with mental health and suicide prevention, in particular amongst Black youth, which is experiencing a huge increase in suicide rates, unfortunately, in the last couple of years. So this type of dialogue, different programming, and legislation can all make a difference in helping drive mental health development and preventing suicide.
Alongside of what my parents said, what I love to preach is to keep the conversation going and to start the conversation. Continue to talk about it, continue to encourage others to talk about it, to be vulnerable, to be strong in the vulnerable way. One way, you talked about carry on Ella's legacy. This is not just for Ella, but for everyone who's lost a loved one to suicide or just lost a loved one in general. I had a good buddy, college student passed a couple months ago, and we had a little Zoom call to commemorate his life. And I was telling everyone how back when Ella died by suicide, was kind of stuck and I didn't know how to keep moving forward. I was like, okay, how are football games being played but my sister's not here? How can I go on and enjoy life when my sister's not here? And you take all those amazing memories, all the amazing qualities of the loved one that you lost, and you apply them to your life, and you apply them to each day you live. You try to take those qualities, make yourself a better person, and keep them alive through you in every way possible. And that's just always my message to anyone who's lost a loved one and trying to figure out how to keep going on. Even though they're not physically here, you can keep them alive with how you live for them, how you apply their qualities to your life. I think those are ways that we can continue keeping Ella's legacy alive, keeping our loved one's legacy alive, and continuing to diminish and destigmatize mental health, the stigma against mental health.
Well, Sally and Martha and Chris, I really want to thank you so much for sharing your story with us today. Just speaking personally, it made a huge difference to me just to be able to talk to you all and to have a little of your light shine on me. It gives me more hope. And I think it's going to give more hope to a lot of people who need that hope as we move forward too. These are really tough times, but you've managed to shine a light through the darkness. And hopefully we'll be able to hold that light for Ella, for you, for others, and do it always.
Thank you very much.
Thank you so much, Paul.
I'm Emily Scahill, and I'm the Program Manager of Public Education and Awareness at Mental Health America. Our public education team releases toolkits for a number of mental health-related awareness campaigns each year, including Mental Health Month in May, BIPOC Mental Health Month in July, and Back to School in August. These toolkits include things like fact sheets, social media graphics, and newsletter inserts, so that you can promote awareness and provide resources in your communities. This year's Back to School toolkit is themed Coping During COVID and has resources for parents, teachers, and students. You can download it for free at mhanational.org/back-school. For any questions on our toolkits, email me at escahill@mhanational.org.
Hi, my name is Jennifer Chang, and I am the Director of Digital Marketing here at Mental Health America, which means I manage our online giving program. Online giving provides Mental Health America with unrestricted funds that goes towards programs that need it the most. Ones that don't have enough funds, either through grants, sponsorships, or through major donors. The coolest part about our online giving program is getting to hear about the reasons why people give in the first place. Usually they'll share their connection to mental health, why they want to make the world a better place. And just, it's really cool to hear why people choose to give to us. And if you're one of those passionate and empathetic people who wants to fight in the open with us, we highly encourage you to make a donation online at mhanational.org/donate. For more information about giving to Mental Health America, visit mhanational.org/donate. Thank you.
Hey everybody, Senator Tim Kaine of Virginia here. I want to thank Mental Health America for inviting me to be part of your annual conference. I wish we could do it together in person, but I'm happy to participate virtually. You are a great group of dedicated advocates, providers, peers, community leaders, family members, all focused on the need to strengthen mental health in this country. We know so many folks who need more services for mental health, for substance use disorders, and that's what you are devoted to. The theme of this year's conference is COVID-19, mental health, and the need for equity. And obviously, it couldn't be more timely. We're in the midst of an ongoing healthcare crisis that includes significant mental health components, and each of you are grappling with that in your own ways in your own community. My wife Ann and I in Virginia have grappled with it as well. We've both had coronavirus. 2 of our 3 children were laid off adult children were laid off their jobs for months because of coronavirus. We know 4 people who've died of coronavirus, and we can see all around us the mental health challenges that a health pandemic and an economic depression and a deep sense of unrest over racial justice. All of these things are compounding to create significant mental health needs in our community. The pandemic has made life so much more challenging for many Americans who are already suffering under significant stress. For those who are dealing with mental health treatment or treatment, say group treatment for substance use disorders, it's been harder to do that while socially distancing. So there's all kinds of needs that I see around the Commonwealth, and I know you're seeing them in your community as well. I want to tell you a story about one Virginian that had a real impact on me and that's motivating bipartisan efforts to focus on mental health needs of a critical community, our frontline healthcare responders. Dr. Lorna Breen. Dr. Lorna Breen was a physician from Charlottesville who trained and then became an emergency room physician in New York City. She was a talented and very, very dynamic leader, and she served on the front line of providing support to those suffering from coronavirus. She was deeply religious. She was an avid skier. She was a volunteer with senior citizens. She was a salsa dancer. She was a musician. But mostly what Lorna was and what she had dreamed of doing her entire life was to be a dedicated and compassionate doctor. Dr. Breen suffered from something that is very common among health professionals, the deep stress of interacting with patients day in, day out, helping them, worrying about them, celebrating with them, praying with them, and also mourning for them. In late 2019, she published an article with colleagues dealing with stress and burnout in a journal that was focused on work of emergency room physicians in the country. She became sick with coronavirus in March and had to be sent home from her hospital. She had been interacting with sick patients all day long and contracted the virus, was sent home and tried her best to recuperate for about 2 weeks and thought she had recuperated. She went back to work in early April, and when she went back, her sister Jennifer, who I've gotten to know, her sister Jennifer and her brother-in-law, Corey, her sister said she was confronted by an overwhelming, relentless number of incredibly sick patients. She and her colleagues worked 24/7 during the peak in New York with limited personal protection equipment, insufficient supplies, not enough beds, not enough help. Many of her colleagues were on medical furlough, and she told her sister that patients were dying in the waiting rooms and the halls. Quote, there was so much suffering, so much death. Dr. Breen told her Bible study group she was, quote, drowning right now. She told a friend that she couldn't help anyone. I just wanted to help people, and I couldn't do anything. She said she had thoughts of hurting herself, and she was admitted to a psychiatric hospital and later released. But on April 26th, home in Charlottesville with her family, still grappling with when she could get back to help her patients, Dr. Breen died by suicide, leaving no note. Dr. Breen was a victim of coronavirus, even though her death is not counted among the now more than 180,000 Americans who have died succumbing to the virus. She was also a victim of something that affects our healthcare professionals. We place enormous demands upon our healers. Our society, including the medical profession itself, does not do enough to recognize the real cost that this work can inflict upon the mental health of the caregiver. It's a common practice for state medical boards and hospitals to ask doctors seeking licensing and credentialing whether they've ever been treated for depression. This heightens the barriers to asking for help when we should be making it easier to do so. Lorna's sister Jennifer attested to this. Here's what she said. And when she became so overworked and despondent that she was unable to move, do you know what she was worried about? She was worried about her job. She was worried that she would lose her medical license or be ostracized by her colleagues because she was suffering burnout due to her frontline work in the COVID-19 crisis. She was afraid to get help. Lorna's worries were not unusual. A 2019 survey of physicians by the American Medical Association showed that nearly 40% of surveyed physicians are worried about seeking mental health counseling, with another 12% indicating that would only do so in secret. And we know that even before the pandemic, healthcare professionals experience high levels of stress. More than half of the physician workforce reports suffering from burnout. Physicians are at a significantly increased risk of death by suicide. Male physicians have a suicide rate 40% higher than the general population. And for female physicians, it's 130% higher. Recent studies indicate that nearly half of healthcare providers working directly with COVID-19 patients in Italy and China are experiencing post-traumatic stress symptoms. Another recent study shows that there was a median increase of 60% in physician emotional exhaustion compared to levels experienced prior to the pandemic. Now, I've gotten to know Dr. Breen's family because they're in Charlottesville, and I'm really impressed with how hard they've worked to try to bring the healthcare needs of our healthcare providers to light and make changes in our society and in our profession so that we can take better care of our healers. I'm proud to have worked with them on legislation that honors Lorna and provides the training, resources, and support needed so we can prevent suicide of other wonderful and talented healthcare professionals during this crisis and also for years to come. On July 29, I introduced the Dr. Lorna Breen Healthcare Provider Protection Act with Senators Todd Young, Jack Reed, and Bill Cassidy. Here's what the legislation would do. It would establish grants for training healthcare professionals, students, and residents with strategies to improve their mental well-being and their job satisfaction. It would support the identification and dissemination of best practices for countering, combating suicide and burnout. It would establish a national education and awareness campaign targeting healthcare professionals to encourage them to seek support and treatment for mental health and behavioral health concerns. It would create grants for hospitals, health systems, and other providers to use for employee education, peer support programming, and mental health and behavioral health treatment, with a priority for providers in current or former COVID-19 hotspots. And finally, it would initiate a comprehensive study on healthcare professional mental health needs, including the impact of COVID-19 on our healers, that can produce recommendations for all levels of government, state, local, federal, licensing bodies, as well as the medical professions themselves. It's my hope that we can include the legislation in the next coronavirus relief bill to ensure that we're well equipped to address the mental health impacts of the pandemic more generally. I've been meeting with mental health and substance use disorder providers and patients from across the Commonwealth to hear firsthand about the challenges that they're facing. I've also called on the Senate leadership to make strong investments in mental health and substance use disorder services in the next coronavirus relief package. Mental health is, of course, as important as physical health. In fact, we shouldn't really distinguish between them in terms of the way we treat them and provide services to combat them. We have to ensure access to affordable quality health care, and that's essential to promoting and strengthening our mental health. That's why I'll continue my fight ever since I've been in the Senate to protect the Affordable Care Act, which considers mental health and substance use disorder services to be what it is, an essential health benefit that must be covered to ensure access to this care for millions of Americans. Thanks to the Affordable Care Act, people no longer have to worry about being discriminated against for having a pre-existing condition. Americans should never have to fear that their president will work to pull health insurance out from under them at any time, but especially during a global health pandemic. Instead of tearing down the ACA, we need to build on it and ensure that even more Americans are covered and have an affordable, quality health plan. I've introduced legislation called Medicare Acts with Senator Michael Bennet that would establish a public plan on the ACA marketplace to offer families, individuals, and small businesses additional low-cost health insurance choices. Medicare Acts initially would be available on the individual marketplaces in areas where there is a shortage of insurers or higher healthcare costs due to reduced competition, including, and probably most especially, in rural communities. My goal is to generate access, greater access for all Americans, more quality healthcare coverage options, and also lower costs. As far as we've come, we've still got an awful long way to go, and this pandemic has exposed that. It's laid bare our inherent human vulnerability when it comes to healthcare and how closely tied together our health and economic security can be. The pandemic has also laid bare deep inequities that already existed in our healthcare system, but have made those inequities, especially for people of color or folks who live in communities, rural communities, for example, with fewer providers. Those inequities are more vivid today than they've ever been, more palpable, and they need to call that vivid sense of inequity and injustice in the healthcare system needs to call on a committed response by all of our policy providers. Of course, our communities of color especially have long understood this fact, but now it's plain for all to see. The pandemic continues to take a disproportionate toll on people of color, due in significant part to institutionalized racism dating back generations and centuries. For this and so many other reasons, your advocacy during this difficult time couldn't be more important. Thanks for what you do to support mental health to ensure people can access the services that they so need. I look forward to working with you as a member of the Senate, but particularly the Health, Education, Labor, and Pension Committee, to help provide the services and resources that families and communities need to navigate this crisis and get better, build better, so that we can thrive in our health for years to come. You're an integral part of that. Your work is very, very important, but it's never been more important than right now. And I appreciate the chance to come and just share words with you, especially share my thanks and my encouragement for the important work you do. I hope the rest of the conference goes very, very well. Thanks so much.
MHA's Associate Vice President for Partnerships and Community Outreach. In that role, I manage all of our outside relationships with organizations that we collaborate with throughout the year.
Our partners and the work that we do together helps us reach more people across the United States every year. If you're interested in learning more about our current partners and how you can partner with us, you can go to mhanational.org/partners. You can always send me an email as well. Email me at aparedes@mhanational.org. Share your ideas about how you wish to partner with us.
Are you ready to shop to support mental health awareness? Our online MHA store makes it super easy. Head to store.mhanational.org today to explore our selection of t-shirts, pins, stickers, jewelry, and more. Right now, we're offering 15% off your total purchase for all conference attendees. Just use code CONFERENCE2020 at checkout. This makes it the perfect time to grab your favorite products and share the message of hope and healing. 100% of sales support our programs here at MHA, including screening, public education, and advocacy. Have fun shopping!
Welcome back. The Clifford W. Beers Award is Mental Health America's highest honor. It is presented annually to a single individual with the lived experience of mental illness who best reflects the example set by MHA founder Clifford W. Beers in their efforts to improve conditions for and attitudes toward people living with mental health conditions. When we look at candidates for this award, we consider four things: impact, leadership, visibility, and bravery. Has the individual made or are they making major contributions to improve the lives of people who have mental illnesses, substance use, or co-occurring disorders? Has the individual demonstrated the ability to inspire and effectively educate the public about mental health, mental illnesses, substance use, or co-occurring disorders? Is the individual a visible and recognized leader at the national level in their specialized field or with a specialized population? And finally, does the individual illustrate their commitment to consumer advocacy despite potential risks to career, finances, and public acceptance? This year, our 2020 Clifford W. Beers Award winner checks all those boxes and more, and we're pleased to have him here with us today. Maurice Benard is a mental health advocate, television and film actor, and New York Times best-selling author. He started his acting career on the soap opera All My Children from 1987 to 1990, and he then went on to a career in General Hospital, where he has been for more than 25 years. Maurice was diagnosed with bipolar disorder and when he was 22 years old and hospitalized twice. He has won 2 daytime Emmys for his work on General Hospital and has worked with multiple mental health organizations, including MHA, and collaborated with the writers of General Hospital to incorporate his diagnosis into his character Sonny Corinthos' storyline, as well as the character's son Morgan, thereby elevating the conversation and showing viewers the reality of the illness. Now 57, Maurice has spent decades advocating for mental health awareness. He's been very public about his diagnosis and struggles and continues to use his public platform to educate his fans about mental illness and bipolar. This year, he published his memoir, Nothing General About It, How Love and Lithium Saved Me, on and off General Hospital. And he currently runs a YouTube series called State of Mind every Sunday to discuss mental health and his personal journey. Please join me in welcoming Maurice Benard. Maurice, it's good to see you again.
Wow, that was, I'm a little emotional. Good to see you. Good to see you. Listen, this is an honor. And I'll tell you, I've gotten awards before in the past. And I was just talking to somebody right now. And this one is so timely because remember last time we talked, I told you I had anxiety?
Yeah, in the spring, we did that Instagram Live together, yeah.
It didn't leave for 3 to 4 months. And it was one of the worst things I've been through in my life. So for me to get this award now, I really feel like I went through a 12-round fight with Mike Tyson. Because usually anxiety comes and goes, comes and goes. This one did not go away. So to get this prestigious award, it means so much to me at this point.
Can you tell me a little more about this? I mean, like you say, you know, comes and goes, comes and goes. And I know a lot of people, we've talked about this earlier today, have been really struggling with anxiety these past few months. But what was it like for you personally? I mean, how did it affect you during that time?
Well, it happened. I know exactly when it happened. As soon as coronavirus hit, I had a problem with my mom and dad. And then my wife came and told me that GH shut down for 4 weeks and that we're not going on promotion for the book. And I felt this rush of adrenaline. And I'm like, uh-oh. But the problem was 24/7. It wouldn't go. It wouldn't leave. And until finally, I talked to a psychiatrist and started taking Lexapro. And that kind of, now I'm back.
I'm glad you're back. I know back in June, we were supposed to do this in person in Washington. We were gonna have you there. Yeah.
And I don't know back in June if I could have, you know what I mean? Well, we couldn't have anyway because of the pandemic.
Yeah.
But yeah, I remember when I talked to you, I liked you a lot. And but I was still trying to hide how much anxiety I had. I was trying to, and I'm really good at faking. I'm a good actor.
Hey, I was trying to hide how much anxiety I was feeling at the time too, and so maybe I was good at faking it also. But I mean, weren't we all? I mean, don't we all fake it sometimes?
Well, look, in this, this pandemic, it's hard enough when you're not mentally ill, but when you're mentally ill, you got to double, triple that, because it's way difficult right now. But you know what? The bottom line, like my wife said something to me. I just keep saying it. I think I'm like a broken record, but it's such a beautiful thing. She said to me, she says, honey, every time, do you understand? Every time you say you can't go on, 100% you have gone on. And she's right.
Sounds like a very wise woman.
Oh, yeah. Read my book, Nothing General About It.
Yeah, I have read it, and I would highly recommend it to others. Yeah, I mean, I know. I think you're back on the set now, aren't you?
Yeah, I'm in my producer, Frank Valentini's office, and he's probably going to be upset at me because I'm in here too long, but that's all right.
Well, not long enough for us. I know we won't keep you, longer than we have to, but we're going to take
you're
every
all right.
minute
You're all right.
that we possibly can.
You're all right.
Yeah.
I play Sonny.
Yeah, I know exactly. I say he shouldn't mess with you, right? just stay in character.
Yeah.
Has it made a difference getting back on the set, just back to work, doing the job that you love?
Yeah, a lot of what was going on with me too. My wife would say, when you go back to work, you're going to be all right. I said, I don't know if I can go back to work. She goes, honey, when you go back to work, because you have never in 30 years, you've had the same routine. This is your first time you don't. So that's why it's much more difficult for you. And I didn't want to hear it. I was like, no, I'm done. I can't even think. But she's absolutely right. So once I got back in here, it really did help me. It helped my confidence. It gave me juice. And I feel strong again. I feel back. I'm back again. And I'm doing a very important storyline about Alzheimer's. And it's very sad and emotional, but it's beautiful. It's beautiful.
So giving you a little more purpose in that regard.
Yeah. I'm doing the character who's dying plays my father. I've said it before and I'll say it again. This storyline not only is great, but he looks like my father. So when I'm talking to him, I look at his lips and they're like, it's my dad. So for me, it's not acting. I'm living it. I'm truly, truly living it. And there's been some scenes this week that I call it kind of magic, when you're in a scene and you're taken to somewhere else. And that's what's been going on. It's amazing.
You've been doing this kind of thing for 27 years now in terms of getting, your storyline, if you will, your personal one, kind of built into the character storyline in other ways too. And, do you feel you've had a lot of opportunities like this just to be taken to another place in some of these storylines and in the work that you're doing?
Oh, yeah. There's a lot, life imitates art, imitates life. And a lot of things that I've done, I'm just doing it here. I told you when I was going to go to speak in front of Congress, and I couldn't go because I had a anxiety attack. Well, I was doing a storyline where the character has a nervous breakdown, all the stuff. Well, I didn't go to speak in front of Congress, and the next day on the show, Sonny, my character's speaking to a psychiatrist. So I'm like, yeah, so here I am in the scene. I'm messed up, and I'm asking her questions that kind of worked,
Well, I mean,
But
of course, you've opened the door for me to ask this question, and that is, was Sonny really speaking to a psychiatrist, or was it just somebody who was playing a psychiatrist on TV?
on TV, yes, yes. But there's a lot, my son Morgan plays, he had bipolar. So I guided him through the scenes. Mm-hmm. So there was a scene that was very important, and it was a great scene. And it wasn't clicking for me. So I took him aside. I said, this is like Eminem when you're saying it fast. You don't even know what's coming out. And then he came in and he did it, and he was fabulous.
It's interesting. This one of the things that I mean, this award is to a peer, and our organization was created by a peer, by somebody with lived experience. And certainly throughout the chat today, people have talked about the importance of peer support, and even actor to actor. In that case, you were providing peer support. This is what it is like, to live with this particular mental health condition. It may not always be pretty, but it's always real, and it's always personal, and it's still me. It's still it's not defining me. I'm going to define myself, and that's important, isn't it? I mean, I think that letting people tell these stories and hearing from people like you, it's really important for somebody else, in this case an actor, to understand what it's like.
Yeah, I do this thing on Sundays. I've gone from Instagram story, now I'm on YouTube. It's called State of Mind. It's kind of picked up an audience, and I'll never forget, and I speak about my life, my mental health, and a lot of times I speak about what I just go through, like I just did with you, Paul, that what I've been through during the pandemic. That's what I do, and I talk to the audience. And there was a while there that I didn't understand, like, what are they really getting? And then somebody just wrote something very simple to me, and she said, look, you helped me get through my son's bipolar, and just the fact that you're talking about it, I don't feel alone. And then I said, wow, so simple, but it means that much, that somebody else is talking. And so I continue to do this on YouTube now, State of Mind, and it's very important to me. I'm getting choked up a little bit now, Paul.
Go ahead. There's something else they're getting from you, and that's truth. They're getting honesty. They're getting, like you say, they're getting something that's real. Like you say, sometimes we think actors aren't real, but acting is, in many respects, real. You're channeling real emotions. You're channeling real circumstances, real things. I mean, you've just done that so well in this space. It's made a difference.
Yeah, just like, Robert De Niro said, to many actors, acting is an illusion, but not for me. And that's kind of the stuff that I wanted to do, where it was just, I was taught the method from the actor studio, and that's just using your real life in all the scenes. And to me, it's not that great for my health, but it is good for the work. Because my mom said once, what, because I was going through some stuff, and she's like, hijo, why can't you go halfway? I said, I can't act half, Mom. That's gotta be the whole thing, it's like, but she was just worried about my health.
Yeah, well, mothers are like that. They just worry about their kids' health. The rest of it can be set aside.
Right.
Yeah. Hey, would you talk a little bit about Paula too? I mean, you and she have been together a long time, and it's tough. She's got the caregiver role, and it's meant a lot to you, the kind of support that she's given to you. Would you just tell people a little bit about that and how much that helps you to have her around?
Well, we've been together, married 30 years, been together 35 years. And she has a way of talking that just calms me. So she'll just say something, and then all of a sudden I'm calm. And she knows when to be strong. She knows when not to be strong. During this last period, it was very difficult because it's the first time that I didn't want my kids to ever see me in that state. But because of coronavirus, I had no choice. I had to come out to eat. I had to come out to go to eat dinner. So, and I was in such bad shape. But my family, they're just amazing, and they're just great. And my wife, it's the first time ever in how many years that I felt that I was starting to be a burden for her, because I couldn't sleep. It was, so she wouldn't go to sleep till I went to sleep. And sometimes I didn't go to sleep till 5 a.m. So she had to stay up all night to take care of me. And that's kind of what she's done for 35 years. Just always been there for me.
My wife is sitting here, 2 feet away from me. I'm actually reaching out and touching her hand right now, and can't imagine, getting through a day, without her and without her support. And so what you're saying, I think, just rings true, and so deeply for so many of us. And I want men in particular to hear that, that it's okay to rely on other people. It's okay not to feel strong all the time. It's okay to ask for and receive help, and to recognize there are people like Paula and Pam who are just always there to give it to us unquestioningly.
Yeah. Yeah. Men got to know that, because I was brought up so macho, and I used to fight all the time, and the thing is about me is I'm incredibly sensitive. And so my feeling is with men, let go of all that macho stuff, man. And my problem is ego. A lot of my problem comes from ego. I feel this might sound some weird stuff right now, but I feel when I go through this stuff, it's whoever you believe, God, whatever you believe, is telling me, you got to keep knocking down that ego. Because when I'm going through this stuff, there is no ego. It's like I'm a scared little boy. So the more I go through it, the more I get to work on my ego. The macho side of it, I've done well with. But I know a lot of men need to know that crying brings you strength. It's not a weakness.
Yeah, I think you're right about that. I want to note for people that we've got a few minutes to go, about 10 minutes, and we are able to take a few questions from the chat, and I want to give others a chance to get in. I do have one that I just had come just a little while ago, and I just wanted to ask you about this, which is, the reactions of people. So what about the reactions over the years of other actors to you, to what you've disclosed, and to how you've gone about this very public advocacy around mental health for literally decades now? Do you say positive, negative, ignored? How has it been received?
Great question, Paul. You're a good interviewer. Actors, I love actors, and I'm friends with many actors. But as far as my mental illness, there's not a lot. I'm going to do a state of mind on this. It's not something that people really like. I think if I had obviously a tumor or cancer, there would be a different feeling. But as far as the audience, unbelievable how many people live with mental illness, suffer. It is and I get it in my, on my phone and social media. People send me stuff. It's unreal how many people go through. And I'll tell you how I came to talk about it, because the story is that somebody said to me, "Don't talk about being bipolar because you'll never get hired as an actor." So I didn't talk about it for a long time. And then I did this little interview for nothing, this little magazine, and I said that I was mentally ill, whatever. And this boy sends me a letter. And the letter said, "I want to thank you for that article that I read about you and being bipolar. It helped me get through my brother, because he committed suicide. He took a gun and he killed himself. And by reading your story, it helped me get through it." After that, I said, "I don't care. I'm talking about this." And then that's how it all started.
Yeah, I've had so many similar experiences that it was so uncomfortable telling my own story, at the beginning. And again, my story, was a story first of a caregiver, with a son with a serious mental illness. And then as I told it, I realized it just helped other people share theirs. And I just have always been, well, not anymore. I'm no longer astonished, but I used to be, about how many people have so many stories that are similar to ours, and how they felt alone. And by bringing these out in the open, they feel less lonely, and they feel more supported and more included.
Yeah, it's what you do, what I do is if anything else, if it helps people, that's it for me, man.
Well, it's definitely helping people, and has been helping people. And, with what we've been going through, back to the pandemic, and race inequalities and equities that we've been dealing with, there's just a lot people have been dealing with. What do you say to those who, are watching right now, who may be struggling a bit? We've certainly seen some comments in the chat that we've got people like that. So got an opportunity to speak directly to them for a minute. What do you tell them?
Well, try not to watch too much, CNN or news or stuff like that, because that can get you. You got to keep doing what you were doing before you started feeling this way. I know it's hard. You get up, get out of bed. Don't stay in bed. Go work out. Now I'm meditating, and I'm still meditating. I play with my goats. I go do things. Even though it was so difficult to do, I still did it, because if you don't do that and you just stay in bed, it's just going to get worse and worse and worse. Also, seriously, sometimes this, just like me right now with the anxiety, no amount of talking was going to help. So I went to a psychiatrist and had to take something for my anxiety. And even though I didn't want to, took 3 to 4 months. Go get help. Go get medical help if it's needed. But try to do it yourself, always, I think, because it's But if you can't, please get professional help. I feel like I'm preaching.
I meant to ask you earlier about your goats, and and you brought those up. So there is the professional help part that is just so important, and I'm glad that you brought that up and emphasized it. There is also the self-help part, and I know the goats are part of that. Would you just give people a little bit about the goats?
Yeah, well, Buddy the goat, he's in the beginning he was very affectionate. He'd jump on me, we'd hug, we'd talk, we'd do all kinds of stuff, But then, as the years go by, and he's been in a lot of my Instagrams, he's getting kind of a big head. So he doesn't want me to take pictures of him anymore. He doesn't want me to do this. But at least when I go in there, he's right by my side. Doesn't come up anymore because I think he's too old for that now. But he's right there, and with animals, because I have alpacas, goats, horses. There's a certain peace and calm that I get up in my house in Temecula. That's amazing. You can't buy that. You just feel it. And I just look at these animals, and they're not thinking. They're just in the moment. It's beautiful.
That is a beautiful way to be. I've got another question here I want to bring in from the chat audience, and one person has noted the amount of time that you've taken kind of developing your career and really all of this, and they want to know what you wish you would have known 30 years ago as you were kind of starting out on this journey, that you didn't know then that you know now. I think as a way of saying, they're saying, what do you wish somebody had told you? Which I think is, what do you say to somebody who's not 57, but 17 or 27, who is starting along this pathway?
I think I would have said, don't hang on so tight. Just let go. You got to let go. You got to, my dad has a saying in Spanish. It's, lo que va a pasar, va a pasar. What's going to happen is going to happen. And I wish somebody would have given me Eckhart Tolle's book, The Power of Now, because that's what it's all about. Forget the past, forget the future. It's all about this moment right here.
Sounds like you've done cognitive behavioral therapy like I have. My therapist kept saying, focus on now. Stop worrying so much about a future you can't control.
I know, but sometimes it's hard.
It is hard, isn't it? When you look forward, I like to look forward with hope, but when you look forward, sometimes it's hard to see that hopeful path.
Yeah.
Well, I think we're going to get there, and I think we're just about out of time. Where I've promised to let you go, and promise to move on so that we can get the next part of this. But again, I want to just take a minute or so, Maurice, again, to just thank you one more time. We didn't have a chance in 30 minutes to really just go into all of what you've done for Mental Health America, really for decades, for NAMI, for other mental health advocacy organizations. You have been there using your celebrity for all of us, and you've been willing to be out there and take risks on our behalf. And I'm so glad that we were able to do this year, and hope that we'll have an opportunity one of these times to do one of these conversations in person, if we can get ourselves to the same place at the same time again.
Yeah, I'd love it. And it was great today because I feel safe with you. You're just a good guy, and I love when I get interviewed by a good guy, because I can do, I can let go, and I'm not hanging out so tight.
appreciate that. No, and I'll tell you, I like talking to good guys too. So we're in the same boat. We're in the same boat on this one. Doing a lot of interviews for this one, and each time we're getting ready, and I'm like, I haven't met some of these people. Fortunately, we'd had a chance to talk one time before. So, so again, just congratulations, first of all, on being the 2020 Clifford Beers Award winner for Mental Health America. And again, thank you one more time for your time today and for all of your advocacy.
Thank you very much, Paul. I'll see you next time.
Okay, sounds great.
All right.
We'll be right back.
How do you turn it on?
Hello, I'm Karen Howard, MHA's National Advocacy Manager, and I work with our policy and advocacy teams to mobilize the Advocacy Network, which is comprised of thousands of individuals across the country who speak up and take action by either emailing, calling, or posting on social media to grab the attention of their congressional delegation on an issue or bill. We mobilize the Advocacy Network most recently on a bill to designate 988 as the suicide prevention hotline number. And we still have that action alert up on the website. You can take it now, as well as sign up for the Advocacy Network by visiting mhanational.org, clicking the Public Policy tab, and then going to Advocacy Network or Action Alerts. Thank you so much. And if you have any questions, we'd love to help you. You can email me at choward@mhanational.org.
Hi there. If you're just joining us, my name is America Paredes, and I am MHA's Associate Vice President for Partnerships and Community Outreach. My pronouns are she, her, hers, and I am so pleased to have not only a partner but a friend of mine with me today. I'm really excited to introduce Jean-Philippe Regis. There he is. And Philippe is the Associate Director of the All Children, All Families program at the Human Rights Campaign Foundation, where they provide technical assistance and LGBTQ inclusion resources to child welfare agencies. They also lead HRC's initiatives related to BIPOC Mental Health Month. And I am very happy to have them here with us. We are going to have a very fruitful conversation around all things mental health related around the QT BIPOC community and the range of different issues that have come up. So welcome, Philippe. So glad to have you here.
Hi, America. Thanks so much for having me. Thanks so much for that warm introduction. I too consider you a partner and a friend. As you mentioned, I'm Jean-Philippe Regis. I use they, them, and he, him pronouns. I am the Associate Director of the Old Children, All Families program at the Human Rights Campaign Foundation, and of course have been partnering with you for the past 4 years or so on a lot of mental health efforts, specifically around our Black, Indigenous, and people of color communities.
Definitely. And I mean, that's the focus of our conversation today. I want to hear a little bit about what HRC has been doing around these issues, given everything that's happening with COVID, and how those communities, the QT BIPOC communities, have really been impacted disproportionately by COVID.
Yeah, thanks so much. I really appreciate you mentioning that. You know, it's a really scary time during this pandemic, and HRC Foundation has really put a lot of effort into making sure we know as much as possible about what's going on and how it's impacting our communities. So as you mentioned, COVID-19 has been disproportionately impacting Black, Indigenous, and people of color communities, and of course, queer and trans Black, Indigenous, people of color communities, which we'll be talking about today, QT BIPOC folks. And some of the things that we found in the research that we've done, so for example, we recently partnered with PSB Research, and we released a report called The Impact of COVID-19 on LGBTQ Communities of Color. And a number of things were found that really highlighted the disparities that you alluded to a moment ago, America. And that includes a loss of work hours, a greater likelihood of becoming unemployed, a greater likelihood of having to take unpaid leave. And then, you know, that's translating into all sorts of, you know, everyday challenges with balancing a financial household, including challenges paying rent and challenges paying bills. And we're, of course, something that, really hits me hard and always gives me pause when I think about it is how it's disproportionately impacting our community in terms of, the death toll, unfortunately. The CDC has shown that, these disproportionate impacts are ultimately resulting in not only these disparate impacts, but also in higher numbers of death in these QT BIPOC communities. And those are some of the reasons why we really are devoted to making sure that we're understanding how it's impacting us so that we can understand exactly what to be mindful of as we move forward and try and keep ourselves and our families safe. We had another report that, dived in a little bit more specifically and looked at the economic impact of COVID-19 on Black LGBTQ people. And it found similar results as the QT BIPOC report, except some of the results were even more stark, unfortunately. We're seeing Black LGBTQ people are having to make, there's a greater likelihood of them having to make adjustments to their household budgets and experiencing financial stress and losing their jobs and some of the different factors that I cited earlier. And those are some of the things that we really are focused on lifting up into the narrative to make sure that folks are really understanding how these things are impacting these communities that really are already vulnerable and how this is showing up in their mental health. And I know, America, you and I were talking a little bit earlier about that, and you had some thoughts on how some of the research findings that I mentioned in terms of, the greater likelihood of loss of jobs and the financial stress, et cetera, can impact mental health. Did you want to go ahead and share those?
Yeah, what comes to mind when I hear you kind of speak about these issues is I think the news does a semi-okay job of kind of highlighting, right, that these communities are impacted disproportionately. But when you get down to actually communicating with folks at the community level, right, at the individual level, the rates of stress and anxiety and depression, yes, they're numbers, but behind each number, there are people that are really struggling. So when you think about somebody having to, really consider, do I have enough money to pay for my rent? And if I don't, what does that mean, right? Or I need medication and I have to figure out how to manage paying for medications in addition to trying to figure out how I'm going to pay rent because I don't have enough hours. And all those things coupled together, I think, continue to exacerbate the mental health of individuals. But we don't really talk about the mental health because we're just functioning, right? And when we just work in that kind of mindset, and many of our communities do that, right, where they may be Black, Indigenous, or people of color, we're just on survival mode.
Yes.
So since we're already part of that process, you put all this other stuff on top of the weight that we carry, and it's overwhelming, right?
Yeah.
You know, and then you think about the deaths of individuals that are really part of these communities, and the grief that is attached to that, and the inability to actually grieve in the way that we are used to as communities. All of that, I think, is so damaging to our spirit and our mental health, in that we just don't know how to kind of push past it. And we have to be able to talk about it so that people know that they're not alone with all the struggle that they're having.
I agree. And I'll just take a moment to pause and zoom out. You know, I'm coming today to this conversation, of course, you know, as a representative of the Human Rights Campaign Foundation, but also as someone with a lot of lived experiences with mental illness and mental health challenges. And a number of my peers and friends, you know, have similar lived experiences. And, you know, specifically, as you mentioned, while these statistics are things that many of us may have seen in the news, or maybe they happen to come across our research and our report, and they've learned these things, there are real life experiences attached to this. So I remember at the beginning of the pandemic, you know, sort of sitting with my friends on a video call when the realization sort of hit that this is more than likely going to impact our community in disproportionate ways, just like many other issues like this will exacerbate those conditions, right? We sort of had an understanding of that very on, and it created this really sort of deep-seated anxiety and grief, you know, sort of anticipatory grief of what we were expecting to come, whether it was in our direct families or in our communities or in, you know, the country or the world at large. And, you know, there's something about sort of that weight that exacerbates anything you're going through individually, right? It's like this sort of collective grief that can be felt when you know your community on so many different levels are facing these disparities, right? Like, so for example, I come to this conversation with a number of different identities. I'm Black, I'm Haitian American, I'm first generation Haitian American, I'm queer, I'm non-binary. You know, I bring a number of these different identities, and almost all of those identities have been shown in COVID-19 to be more vulnerable to these negative health outcomes and even death, you know, and holding that weight can be really challenging, you know, and something
I feel
that I
that,
want to...
like, when you're talking, it's like this heaviness, right, that has, you just carry, and it's not something that you can anticipate.
Yeah.
Right? It's just something that naturally is happening because of the pandemic and the fact that we've had to isolate and really find solace in ourselves, right? Yes, we can connect online and all that, and I think those are very useful tools, but at the end of the day, it's just you, and you're trying to figure out how to manage all that. How has the pandemic impacted you, and like the physical distancing and the community in itself?
Yeah, I think that's a really important issue that I really wanted to touch on, because it's something I'm experiencing on a personal level at different levels. And that's largely impacted by my privilege of, you know, being at a certain age where I live on my own and having, you know, thankful to be at an organization where I'm able to support myself, et cetera. And I'm still feeling the impact of physical distancing and how that is exacerbating certain things. And first, I want to sort of talk about what we know about LGBTQ folks, especially LGBTQ youth who are currently in physical distancing or being forced to isolate in areas where, you know, they're not under the best circumstances. So before the pandemic, we already knew that by and large, you know, LGBTQs were reporting that their families make negative comments about the LGBTQ community, right? And when we drill down on that even further, so HRC Foundation has a series of LGBTQ youth reports where folks can really get a great idea of what the picture is, right? What is the landscape for the lived experiences of LGBTQ youth now? What are they facing? And this is one of the things that we uncovered, right? They're facing these negative comments about their community. And then when you look at it on a personal level, only 1 in 4 LGBTQ youth feel they can be their true selves at home. And if everyone is at home right now and they're, very much limited and some completely taken away from, their sources of comfort or, their sources of affirmation, then that's exacerbating these things, right? And then similar, parallels to what you see with the COVID-19 pandemic, when you drill down into even, more into the communities that face even more bias and discrimination, such as LGBTQ youth of color or trans and gender expansive youth, you see these disparities become even more stark, right? So you see bi plus youth are far less likely to be out about their identities. Trans and gender expansive youth are much less likely to even be referred to by their correct name and pronouns. One of the most basic things as humans that we, seek in regular interactions. And, just taking a pause back to look at what does that mean, right? Okay, so we know now some of the statistics, or we know that we can go to reports like I just mentioned that the HRC Foundation has to learn about, some of these negative experiences. But what does all of that really mean, right? Well, it means that unfortunately, QT BIPOC folks are largely in home situations where they're really facing a lot of stress and they're facing a lot of isolation and they're not able to authentically show up in themselves, and those things have real, negative impacts on one's mental health, right? We started talking about this yesterday in America, when we talk about QT BIPOC folks being able to be their authentic selves, it's not just a matter of, one being true to themselves, and being able to sort of, have that sort of personal
like self-worth and value.
Yes.
Yeah.
This is something that can be a lot more pervasive, where, you're seeing yourself erased. You're seeing that you have to erase yourself in order to just show up in the world, and not even in the world, to just show up in your home, to just open your bedroom door sometimes, right? And what does that mean, when you're to your self-esteem and your self-worth and your sense of a future and whether you can see yourself being happy? How does that all show up, right? And, that's something that we really want to remind LGBTQ specifically who are finding themselves in these situations of some things to really keep in mind during these times. So one thing that I like to really sort of ground the conversation in is safety and security, right? As detrimental as some of the things I just cited can be to your mental health, the erasure, the invalidation, not being affirmed, safety and security are paramount in order to see yourself sustained to a point where you can have, an authentic life, right? Keeping yourself safe is one of the most basic human needs, right? So keeping yourself safe is really something that, unfortunately, we really have to keep top of mind right now. We have to be sort of hyper vigilant in a way, even in our own homes. And I think it's important that we recognize the stress that can bring and the heaviness that can bring, and find ways to tackle that, right?
To come together and to be able to kind of sustain yourself, right? Because that's what you're kind of mentioning. One of the things that comes to mind when you're kind of talking about this in the safe space is that too often you don't recognize your privilege to be able to be in a space where you may have your own bedroom, you may have a door that you can close, right? And those small, very small, but huge kind of aspects of our lives have to be considered when we propose ways in which individuals can help themselves.
Yeah.
I know one of the things that we talked about is really finding community, right? Where you may not have an opportunity to have affirming relationships in your most immediate circle, right? Whether that's your family or not, but you find your chosen family, right?
Yeah.
And I think that's important. And tell us a little bit about your experience in this period and what you have found to be most helpful for your mental health.
Yeah. You know, I think it's important to not only bring in, some of the statistics and, information that the HRC Foundation has, but also to sort of shift to this sort of personal lens and share a little bit about how all of this shows up, right? And for me personally, knowing about all of these disparities, related to the pandemic, and knowing about the hypervisibility of racial violence and anti-trans violence and how, we're seeing those numbers get higher and higher each year. For me personally, it's created a lot of challenges with my happiness, my hope, my energy level, my productivity, my ability to focus. Those have been things that have been challenged now, in a way that I haven't really experienced before. I've also found that different symptoms of, different mental illnesses that I live with have worsened, or I've even experienced new symptoms that I had never experienced before. And, having to figure out what that means, right? And seeing how all of this is literally showing up, you know, in my mental health, right? It's showing up in worsening of things in new situations. And it really, as I was sort of mentioning earlier, it's creating this hypervigilance about my safety where, I feel like I'm sort of stuck in this perpetual cycle of trying to manage my health related to the COVID-19 pandemic and knowing, the potential challenges I can face if I have to interact with systems, right? Knowing how that interacts with my sexual orientation, my gender identity expression, my race, my ethnicity, knowing about all that, it really forces me to try and find ways to really keep myself safe, and that's when I even see my privilege sometimes challenged, right? I I have my own home, for example, like you said, which is a huge privilege, where I can potentially, authentically express my gender, for example, behind locked doors and feel safe. But what I found is, even when I go down to get the mail or go down to pick up food, all of a sudden my safety becomes challenged. If I go to walk my dog, all of a sudden my safety becomes challenged. And I literally hear comments, I hear slurs, I see the looks, I can feel my safety being threatened, and that I find that, when I'm hyper vigilant about my safety, it sort of puts a cap on really any of my other higher needs or desires as a human, right? It's
Right.
almost
It sounds
becomes
very layered in what you're describing, right? Where when we're thinking a lot of times where safety is physical safety, it's not so much just physical safety, but emotional safety, right? Because you have to protect yourself from all the things that you are hearing because that does impact you. And it also what resonates with from what you said is when you're trying to manage all of these aspects of your well-being, right? When you think about it very broadly, you have to come to terms to figure out what's happening with me now that is new, like you said, or what has worked in the past to help me move through this. Can you talk a little bit about some of the things that you've done, or maybe that you would have you wish you knew before you kind of ventured into seeking mental health support?
Yeah, I'd love to chat about that because I think it's really important at a time when all of this is going on and we know, many folks in, the communities that we serve are potentially really um, seeking out therapy, maybe for the first time or restarting therapy for the first time in a while. So I think this is a good opportunity to sort of share some of my experiences. So for me, I've been on a journey really, as I've at the beginning of the pandemic, when I noticed, the worsening of some symptoms and some new ones, it became really important to me to get back in consistent therapy because at that point I was out of therapy. Um, and there are a number of different things I did. I tried using search engines, on, a number of different websites, including your own. I used my insurance. Thankfully, that's, a privilege that I have that I was able to look through my insurance and get some recommendations for them. And then I also asked friends. You know, I thankfully, am blessed to have, a number of folks in my community who trust me and feel safe enough to share with me that they're in therapy as well. And, that can be a really great place to get some recommendations and leads. So ultimately, I saw a number of different therapists. A number of them were not great fits, to say the least. Had some pretty challenging experiences that I had to push through and just sort of keep trying to find my fit because what I found is that, you really have to pay attention to what's going on in terms of the consistency and the pervasiveness of things that you're feeling, and keep in mind how that can impact how urgently you should be seeking out certain assistance, and I knew that with the pandemic and everything going on, and all of the racial violence, all of the anti-trans violence, I understood that I was experiencing these things to a degree that I had to keep going and push past that. Ultimately, the therapist that ended up being a good fit for me was referred to by a friend. So that turned out to be the way that I was able to find help. And, therapy really helps me in a number of ways. I think it can be sometimes a little mythical the way we talk about therapy, right? It's like we often focus on trying to get people to look and, get people to even consider it, but we rarely sort of talk about what happens in the room, right? And what I find has been really helpful is being able to talk about some of the challenges I'm experiencing and discuss how it's showing up at work, in my life, in my relationships, and learn coping mechanisms that promote wellness as opposed to coping mechanisms that may lead to harm down the road or lead to stagnation. And really developing tools. Something you mentioned earlier, America, is, a lot of us in, many communities, and specifically in the QT BIPOC community that I'm talking about today, we live in survival mode for so long. And part of living in survival mode really limits the amount of tools you have and also the tools you have that sort of long-term vision for your own wellness, right? Oftentimes we're forced.
They're intended really for resilience instead of just functioning.
Because survival by nature is short-term, right? Yeah. You're forced to think in the moment or at most, maybe the next day, right? So that really limits, it can sometimes really limit the amount of, sort of healthy tools that you have available to you to really navigate tough times like this. And then I want to just really
Philippe, I was gonna add a point there. What I have found though in speaking with a lot of folks in the QT BIPOC community is that they have questions about what it is to go to therapy, and oftentimes we're hesitant, right, to ask these questions because we just don't feel like we have the space for it. And I know in the conversations that you and I have had, I really appreciate you sharing your personal experience around therapy, but I also want to say, therapy can seem like a daunting thing, but I know because of the work that you've done and we've done, we pulled together a resource that was very useful to help people kind of think through what therapy should be and really allow the individual to feel empowered to go out and seek the right kind of support. Do you want to talk a little bit about that resource?
Yeah, absolutely. So I just want to really briefly share, some of the things that um, I wish I sort of knew at the beginning of the experience, and some of the things that I realized when restarting this experience is that, for folks, especially like LGBTQ youth who are in homes that may not be supporting, sometimes the hesitancy or a barrier to starting treatment can be worries around confidentiality or worries around needing parental approval or consent in order to start therapy or other types of treatment. And I think it's important to note that there are so many confidential sources of mental health treatment that LGBTQ youth can access online and other ways that can really help them, even if they feel they may not be able to get approval or consent for someone they may be living with now. And also, to really, like to the point that we're about to get to when we talk about the tool that we developed together, knowing that you can ask certain things in the beginning, right? A lot of the negative things I experienced, I think, is because I didn't ask the questions that I knew I needed to. And they ended up showing up later in ways that caused harm. So keeping in mind that asking about things, you have discretion, you have power. It's almost like you can interview the therapist or provider that you're seeking treatment from. You can talk about demographics or other things, aspects of a provider that are important to you in
Right.
order to really get the most out of treatment. And that's why I was so excited when we worked together on this tool, questions to help QT BIPOC folks find an affirming therapist. We know that there are all of these issues that we're facing that, I touched on already. We know there are barriers to care. And then, we know that even after all of that happens, there's still too many instances of QT BIPOC folks, once they get in the room, still experiencing harm by folks who are who are not culturally responsive or LGBTQ inclusive, right? So we developed these tips and sort of questions of things that you can talk through in the beginning to really make sure that you're addressing the things that are important to you, right? So they can find it on both of our websites, on HRC and MHA's website, and, sort of look through it and figure out which things are important to you that you think will improve your treatment, right? That will help make that fit, and figure out how you can ask. For me, sometimes my anxiety limits my, ability to confront folks in the moment and ask certain pointed questions. So sometimes I've used these questions via email. And then other times you can ask in person, or I guess via camera these days, in an initial appointment. So I thought it'd be great, America, for us to just spend a really quick moment maybe modeling one of the questions and what we think clients and professionals can sort of take away from that.
Sure. I know that one of the things that we focused on with this particular resource was being able to really give folks a template that they could really use to guide their conversation. So I know one of the questions that was on there is, how would you describe your experience treating clients who share, you would insert your LGBTQ, non-binary identity, whatever it is you think is relevant to your experience that you want to learn about. So, Philippe, what would be a great response to receive from a provider?
Yeah, I think there are some things that I'll highlight that providers should keep in mind when responding to a question like this. So let's say I asked a provider, how would you describe your experience treating clients who share my queer and non-binary identity? So some things to consider would be, have I collected information and tracked information on clients that I've previously engaged with in terms of their sexual orientation, gender identity, and gender expression, so that you can accurately answer that question, right? So, because if you don't have that information, you really want to avoid conflating numbers or different members of the community. You want to make sure that you have access to that information so you can answer confidently and be able to say, not necessarily, violating any privacy information or things like that, but just so you can speak confidently to, well, I have, a lot of experience, or I have little experience, etc. You also want to make sure, as I sort of mentioned, that you're not conflating experiences, right? Oftentimes, we know sometimes the initial trainings folks receive on LGBTQ competency can sort of keep things very nebulous and conflated, and folks kind of can lose sight of the fact that LGBTQ, the acronym, contains, identities related to sexual orientation, so romantic attraction, and related to gender identity and expression, so how one's internal sense of identifying their gender rather. So that means, you can't talk about talking about the acronym at large can be challenging, and can create sort of some confusion, potentially even harm, if you're assuming the experiences, for example, of a bi person are the same as that of, for, let's say, a trans man. Those are different experiences. Those are different risks, different things they encounter. And those are things providers want to keep in mind. And if they haven't already tracked this information, that's okay. We find, in the work that we do, many orgs are sort of working to kind of really show up in this area of data collection and meet sort of the best practices around how to really collect this information in a meaningful way so that they can answer questions like this and track their services in a way that can be helpful. And, if you don't have that in line yet, it's okay to say that and mention that, while that's not in place, you're looking to implement measures like that and, perhaps pivot to what you do know. If you don't have that personal experience, perhaps talk about the trainings you've received. Talk about—
That's an interesting point, though, Philippe, because I think often people, in terms of mental health providers, may be afraid of saying, I'm sorry, no, I don't have experience in this. And that's a disservice, right, to the individual that you may be working with. And on the part of the individual seeking support, it is really about finding your voice to be able to empower yourself to find the best fit. It is not going to work every single time. You have to build rapport with the individual you're working with. And that means different things for different people, right? Maybe it is finding somebody that may be gender affirming, or somebody that understands what it is to be queer and Black, or Latina and gay. And all of these are nuanced experiences that we have that really have to help us figure out what we need to really help us get better. And, Philippe, from everything that you've shared, what you really bring to the table and HRC brings to the table is a wealth of resources that are available. I know on your website, the HRC website. We also have some on our website. And I really think that we can continue to talk about these issues forever. You and I love talking about these issues because they're so relevant. But we also know that we need to make sure that we don't only talk about it, but also act on these matters in our communities and push for policy and advocacy that really help the individuals on the ground. And I know we're running out of time. So Philippe, I wanted to thank you so much for spending time with us today. And I don't know if you have a 2 seconds that you want to say something.
Yeah, well, thanks so much for having me. It was a pleasure having this conversation. As you know, we can talk about these things forever, but I just want to encourage folks to, check out the resources that we talked about today. And, for QT BIPOC folks who may be listening, just remember that, no matter the circumstances that we're facing right now and the barriers that you may face, there's a large community out there that loves and affirms you and supports you. And there are a number of folks, on the ground like America and I, who are really fighting to make sure your voices are heard and to develop resources that speak to you and can really help you in your lived experiences as you try and improve your mental health.
Thank you, Philippe. And with that, we're going to be taking a brief break, and we're going to be back in a moment to talk about workplace wellness with Matt Collins. Thank you so much, Philippe.
Thanks, America and Mental Health America. I appreciate your time.
I hope you've been enjoying the conference so far and balancing all the great content we've been getting with some breaks to take care of yourself. Given all that's unfolded in the last several months, we want to talk now about how the pandemic has impacted the workplace and worker mental health. I know it sure has for us at MHA, even trying to pull together a conference like this on relatively short notice for all of you puts us all under a lot of stress. So many of us, like me, are still working from home, and employers around the country and globe are adjusting to a new normal: remote work, hybrid models, and some, of course, with essential employees who have to be on site. And we're probably never going to go back exactly to the way things used to be before COVID-19. Workplace wellness, including workplace mental wellness, is nothing new to MHA. In fact, we've been working in this space for 40 years now. And at the start of 2020, we launched the Bell Seal for Workplace Mental Health, a certification program to recognize employers who are committed to creating mentally healthy workplaces, no matter what their employees are expected to do in their jobs. The Bell Seal program is open to any employer in the nation, no matter how big or small. And I'll encourage you to look at this at the end of this conversation that we have. But we thought it would be a timely and appropriate conversation to have today, as we all navigate what it means to have a mentally healthier workplace in a COVID-19 world, to sit down with one employer that's received our highest level certification this year, Platinum. We want to talk about workplace wellness and how recent events are putting an even finer focus on the need for having policies and practices in place that support employee mental health and well-being. So I'm pleased to be joined now by Dr. Matt Collins, their Executive Vice President, Chief Medical Officer of the Platinum Blue Seal recipient, Blue Cross Blue Shield of Rhode Island. Before joining Blue Cross in 2015 as Vice President of Clinical Integration, Dr. Collins served as Senior Director of Medical Affairs at Fallon Community Health Plan in Massachusetts, and was the Medical Director of Neighborhood Health Plan, also in Massachusetts. Matt brings to his role a unique background as both a family physician and medical director with deep understanding of how to manage the quality, experience, and performance of behavioral health networks for health plans. He's also passionate about designing and implementing care models across diverse populations. And as Chief Medical Officer, Matt has comprehensive oversight for medical management, including care management, utilization management, and behavioral health management all with the goal of ensuring that Blue Cross Blue Shield members get the right care at the right time in the right setting. Matt also leads efforts to control the increase of total medical expenses. Matt, welcome. Thank you for joining us today.
Thanks a lot, Paul. It's great to be with you and invited to your organization's annual meeting.
Yeah, we're so glad to have you here, especially to talk about this subject that really has been on everybody's minds for the past 6 months. How do we do this? And so maybe we just start by, generally talking about why workplace mental health matters. It matters to Blue Cross Blue Shield Rhode Island, but why should it matter to everybody?
Well, from a very basic standpoint, and concretely, it matters because, emotional well-being for the whole family of folks who support an employee, it contributes to greater productivity. But that almost sounds like, just too concrete. It doesn't just start to do, workplace wellness overnight. This goes way back to our commitment that Blue Cross and Blue Shield made, a long time ago to make sure that, we were providing everything that we could to our own employees and to their families in terms of benefits and other offerings that would help to contribute to their well-being. We're a health care company. A lot of folks don't think of health insurers as a healthcare company, but we are. And in a lot of ways that we actually are delivering care through our care managers and indirectly through the things that we support, initiatives that we support. So we think a lot about how do we keep our own employees and those of people that we're insuring well. And so it really goes into kind of a deeper, dive into, how do we really make sure that we're doing everything from an employer standpoint to create a healthy workplace.
So how big is Blue Cross Blue Shield of Rhode Island? We've got employers of all sizes and people working for employers of all sizes here looking and watching us, but just tell us a little about that organization.
Blue Cross and Blue Shield of Rhode Island is one of the 39 member Blue Cross plans. We are, our business is Rhode Island, and as people know, one of the smallest states in the nation with a citizenry of about 1 million people. And we insure about 440,000 of those folks. And our lines of business include commercial and Medicare. And we have a Medicaid market in Rhode Island. But we have a presence here, and we want to keep growing. We've diversified a bit in some ways, and we've created a mission to actually develop some primary care centers in Rhode Island, for which there are 3 and soon to be 4. We also have a presence in the community in retail sites we call Your Blue Stores, where we offer programming, things like yoga classes, cooking classes, mental health related classes such as meditation and mindfulness training. And it's also a place where people can come just for general service center kind of needs, like paying a bill or finding out more about their benefits and stuff. So we're pretty big in a little state.
Yeah, and it sounds like you've got a diverse workforce in the sense that you've got some frontline people who are basically interacting with the public on a regular basis, all the way to back office people who are handling things in environments that may be more flexible or get more flexibility. So is that fair? You've got to think about really all kinds of employee circumstances when you're developing your employee wellness and mental wellness programs.
Yeah, that's right, because there are a lot of stressful positions for various reasons. There's the frontline folks who are interacting with the public either through telephone or in person, and that's been particularly stressful now as there's been a lot of work from home, and but some have returned, and such as to the retail sites. And there's certainly other pressures. I mean, it is a competitive business. So there are ways in which, there's lots of pressure put on different people in the organization, whether they're in finance or they're in my area, which is medical management, or they're in contracting and whatnot. So, that combined with living and now working in the home is definitely added a new layer of stress.
So what do you do basically to help folks manage that stress? I mean, again, you've had programs in place since before the pandemic. I don't know, have you doubled down on some of these? Have some become more important than others? I mean, what are some of the ones that you think have been most important in helping your own employees within Blue Cross Blue Shield Rhode Island, or you yourself?
Right. Well, as you mentioned, going back, this is nothing new for us. So we, for instance, introduced mental health first aid training, which a lot of our associates or employees avail themselves of, just to start from a basic level of understanding of when do you recognize stress in yourself or in others. We also became a partner organization in the Change Direction movement, which is another way in which people that, set a basic level of understanding of when do you recognize stress and strain in the workplace and individuals and whatnot. There were other programming that we've offered live and virtual even before the pandemic, such as mindfulness training. We have an on-site gym in which we once a week would have a mindfulness experience for folks to drop in during their lunch break. We have also now shifted some of that to online. We're using Facebook Live for some mindfulness and also some yoga training. There have been a lot of other things as well that we've been doing over the time period that really kind of get to our vision statement. Is we're trying to create a state of health and well-being for all of Rhode Island. We have to start at home in a way, and meaning with our own associates.
So why do you think then that it would have been important for Blue Cross Blue Shield of Rhode Island to apply for, Mental Health America Bell Seal? I mean, you were doing all of this anyway, and why do you think it is that the organization said, yeah, we should hold ourselves up this way, and go to this national organization and say, can you evaluate us and certify us this way?
Mm-hmm. There's a lot of reasons. And but some of them are that we set a course, led our CEO, to really transform the culture of the organization. And one of the things that in measuring our culture objectively, the associates were reporting was there's a sense of fear within the organization, either fear of challenge or fear of failure. And we really had to start to address and eliminate that and become a much less fearful organization. Other reasons were that we live in a state that is beleaguered by a lot of behavioral health problems, not just mental health, but substance use as well. And we have taken great strides to really try to address better as a health insurer, supporting people achieving better mental health and reduce impact of substance use. And we want to be able to measure ourselves against how we're doing. We have a lot of folks point to health plans as the root of evil when it comes to many things in healthcare related, but particularly related to behavioral health in general. And we really have done a lot to try to, be a better partner with the community. We see things in the way behavioral healthcare in particular is delivered that could be much better, and we want to be able to help. So applying for this award really helps to measure ourselves and benchmark against obviously other employers, but in a way, and then there's other ways that we measure ourselves, but we wanted to be able to see how we're faring up, both in terms of, transforming our culture and being a good citizen employer within our state to help with mental health, achieving better mental health.
So do you think that the pandemic has accelerated the need for employers to take a look at culture and possibly change culture within the workplace? And what do you think about that?
Well, I definitely think it does. You mentioned in the intro the returning to normal. I heard mention by one of the physician leaders in the state, maybe the normal wasn't really a good normal. Maybe we need a different normal. I think we need a different normal in the future, and it certainly has to recognize that humans are biopsychosocial beings, and that one can't just take care of one of those three elements. You have to take care of the whole person. And even just from a very practical standpoint, looking at cost utilization, healthcare cost utilization, as I do and have been doing for the past 11 years, there is a huge, sometimes 2 to 4-fold impact on the cost for folks with a behavioral health condition, any and all, And so if you're not addressing adequately behavioral health in your employed population, and think about them as caregivers of other folks whom you may also be insuring indirectly, you're really not doing yourself a good service in terms of your medical expenses. So from that dollars and cents standpoint, it's really necessary, but also, certainly from a productivity standpoint, which isn't really measured at all in cost utilization of healthcare services, you're really going to get better performance out of your individuals if you're contributing to their own wellness. And you have to think as well about the competitive workplace. Now, unemployment is up right now, but it had been in a historic lows. And it's, very easy for folks to jump positions. And so I think creating a workplace environment and conditions and benefits and things that help to address, emotional wellness is even more important now.
When I talk about higher productivity and lower cost, or when we at MHA do that, people say, well, of course, that's what you guys are going to say because you're mental health advocates. But hearing that message come from someone in your position, with your background, your training, and your current position, I hope it resonates with people and rings as true as it is that tending to employee well-being, including emotional well-being, is the ticket to lower cost, higher productivity, and as you say, a competitive edge.
One thing I just wanted to add, Paul, is since the pandemic and since we had this baseline awareness of the importance of emotional wellness, a lot of our divisions in terms of their meetings, either one-on-one or in groups, have taken to make sure that part of the programming of that meeting or that one-on-one includes just a check-in. How are things going? We've actually had a lot of fun with that, and people sharing pictures about their activities that they're doing at home, pictures of their pets. And there's been, a comfort, obviously, with, a dog barking in the background or a kid yelling in the background or even running up to the camera. We've gotten to know each other much better. And when I've done one-on-ones with folks in my division, which is 100 plus people, I've regularly heard the comment made that they feel so much more connected now than they did before. We've had to be much more thoughtful about keeping connected, but the digital world and the technology combined with the commitment has really helped us to connect better. So I would say that in some ways, the pandemic has allowed us to connect in ways that we didn't consciously do before or do well.
Yeah, that's really important because I know when we built out our office space in Alexandria, Virginia, we made the greatest investment in our kitchen so that we become a gathering place where people informally could check in and just talk about work, but certainly talk about things that were other than work. And I know we and others have struggled sometimes to figure out within the context of the virtual meetings we have how to tend to building the relationships. One of the suggestions that Taylor Adams, who actually manages our Bell Seal program, made early on was that we take time at staff meetings to just take a break and offer some good news about anything that was going on in our lives. And for me, that made such a difference back in March and April, especially, even into May, when we were all just stunned by what was going on, just to take a deep breath and to have people sharing. And we're small staff, but have people sharing 3, 4, 5, 10 people at a time, just something that was going on in their lives that might be totally unrelated to work, that was just, from their perspective, good news. We forget that we actually have to do some of those things that when we had everybody captive in the audience, we could naturally do by creating those common spaces. Sounds like you guys have figured that out better than we have and earlier on.
Well, I think you guys, it sounds like a great place to work. I'd love to hang out in your kitchen if I could safely at this point in time. I love Alexandria, Virginia. I went to medical school at Howard University in Washington, D.C., so I have fond memories of that place in many ways. I think that there definitely is a way that we can connect better, and we just have to be more conscious of it and aware of it. And it's certainly better opportunities that presented to us with technology. Now we've gotten much more adept at using it and communicating there are other things that we've been able to adapt. There's a Microsoft program called Yammer. We've had these Yammer sessions, which are just kind of like a focus session on a topic where people from all over the organization can chime in. So it's really kind of de-stratified our organization because there's these opportunities now to kind of communicate from home. We've obviously had to take a look at some of our benefits in our workplace rules around working from home generally, and we've realized that, geez, there's an awful lot that we can do from home. And by affording that, we can give better time and space for people who are taking care of people at home, whether it's elders or juniors. I think that people have had a better opportunity to remain physically fit, to eat better, because they're not so much eating out and eating on the run and whatnot. And we've thought about that and thought about changing jobs so that they can be teleworker jobs. We've given allowances for home office support, I mean, in dollars that people can spend on office equipment for better setup in the home. We've thought more about our responsibility as an employer to help with connectivity issues. We had some of our frontline workers who didn't have home Wi-Fi. And we normally, and before the pandemic, would have sort of said, well, you have to come into work. And now we've said, well, no, they need to be home to be safe. And we need to afford them MiFis, personal hotspots so that they can connect and do their work. So we really have to be thoughtful about how do we, think globally about the whole person and the wellness, as well as, of course, the productivity of the company.
Yeah, so what do we do? I mean, you like us have been able to employ a lot of the, technology and the tools of technology in order to work productively with people scattered about. But what about those sides of your business, which are similar to some others that are like retail, and where people really are still in sort of front-facing positions? Have you had to change the level of support or the type of support you're giving to those employees? And are there some lessons there for others who may be frontline workers or attending this conference, or, family members of essential workers about, what we're learning about best practice in supporting people who have to be on the front lines?
Yeah, so right out of the gate, there were some functions that just had to be done in person. So we still receive payments by check, so for people's premiums and from corporations who are buying insurance from us. So there still had to be some level of people on site. Some things you have to be, even in this day and age, faxed in order to remain compliant with certain rules. And so we had to make sure that we were setting up a workplace where it was safe. So I think it certainly helped that there were doctors, of course, to tap into, myself being one of the primary ones that was tapped into, to make sure that we were following all the right safety guidances. And I even did a virtual tour one day with some of the employees. I Skyped in and had them walk me around their workplace to make sure everything was safe and secure and they were handling things correctly. And then when it came time to reopen our retail centers, and I should also mention that we have a recreational vehicle that's ready to go to help with any vaccination campaign or any kind of community need. We had to make sure that everything was done to the right specifications. Fortunately, our state issued guidance around retail locations and what needed to be set up, and they're actually conducting inspections, which we passed in flying colors. So we had to make sure that there was the right physical distancing, screening at the door, that their employees were pre-screening before coming to work, et cetera, that there were proper masks present, and so on. So there was definitely a level of that. And I think for the company that doesn't have an MD that they can tap into or another clinical resource, certainly look to the state public health agencies for guidance. A lot of them have set up hotlines where you can get help. And then, not to throw my colleague insurers under the bus perhaps, but, pick up your phone and call your insurer. There are doctors there, and there are health experts, and they might be able to help you translate the guidelines into the right plans for your workplace.
Yeah, this is one of the things that, and I don't think you've thrown anybody under the bus there, because this is one of the things that insurers that with whom I've spoken, are all thinking about this and are all working on this because, as you say, I mean, everybody in the health and mental health space really have been thinking in similar ways about the importance of supporting and engaging their employees and also the people they take care of in supporting to support their mental health and behavioral health well-being. So I like it that you said that, because I do think that there are resources for everybody out there, even those who say, well, my state, my governor, my public health department, they're not, talking about this, or they're not doing that, or they're forcing us to do that. There are resources out there. I think that people who want to help make these workplaces healthier and mentally healthier can access. And I appreciate your mentioning that the insurer that people don't often think about that way. They're trying to think about how to avoid, getting contact, having too much contact with my insurer, because that means my costs may be going up. Actually, may find in that a lot of clues and a lot of advice about how to, as you said before, bring down cost and raise productivity as a sidebar.
Yeah, let me just add, and it may be a surprise to your audience, but in my world, in the health insurance world, there is a whole lot more discussion about the importance of full integration of behavioral health and physical health. And a lot of folks are integrating, for instance, their care management. They're really looking more completely at wellness offerings that include attention to mental health and substance use. So it should be fertile ground for most health plans. If they're not ahead of the game, they're trying to catch up in terms of employing new tactics and new partnerships to really get at the total emotional and physical wellness.
Yeah, and you talked earlier, you used the word holistically, and I agree with you. I think that even 5 years ago or 10 years ago, there was not as much holistic thinking across the board. And we've certainly seen it in non-traditional partners. I mean, at MHA, we've certainly had people in the health and mental health space and behavioral health space generally as traditional corporate partners, but we've had so many non-traditional partners come forward and, have mental health programs or engage with us, whether it's sports leagues or fashion industry or, the fast food industry or gaming, online gaming industry. We're seeing a lot more attention to this holistic kind of thinking. So with that in mind, and, with what you said, what's the best way to engage all these differing employers and workplace mental health? If there was one pitch we had to give them as we begin to wrap up this particular interview, what's the best pitch? Is it productivity? Is it cost? Is it competition? Or is it something else?
Well, I think it's all of those things, but it definitely, if your organization is like mine, the CFO controls the budget a lot. And so, making the case from an economic standpoint is important. For the HR area, making the case that it's a highly competitive workplace and you get, the right employees and keep them, you need to offer more comprehensive benefits. There's obviously it goes into as well, maintaining a remote workforce, which we will for the near future. And to be honest with you, like a lot of folks are starting to talk about, like, do I ever need to go back into the office? And do I need to spend money on the rent and upkeep of an office? So remote, even after the pandemic, might be a more common thing. And then be able to maintain connection and a uniform culture in an organization, as well as productivity, is really going to take addressing, the whole person, the biopsychosocial being. So I think it's going to be principally those areas, cost, and definitely, recruitment and retention, and then productivity as well.
Well, thank you, Matt. I just want to say thank you for this important conversation and for Blue Cross Blue Shield of Rhode Island and all our BELSIL recipients for leading the way in employee mental health. Appreciated having you with us today. Again, thanks very much for joining us.
It's my pleasure, and best of luck to you and your organization. And we'll be looking to you guys for more award recipients so we can learn from the best.
Well, thank you. If your company is interested in learning more about MHA's Bell Seal for Workplace Mental Health Program, you can visit mhanational.org/best employers. That's mhanational.org/best employers. We'll be right back, so don't go far. Hey, welcome back. And if there have been two threads going through the chat around workplace mental health at this point, one has been that a number of you seem to be enjoying the opportunity to work remotely. And the other one seems to be that we're working you a little too hard because we didn't schedule enough breaks in this. We're going to have a busy day again tomorrow as well, just to get you prepared. But the fact of the matter is we've tried to give you as much content as we can and hope that if you aren't able to be in every single minute of every single session, you'll take advantage of the recordings afterwards. So we just had a great conversation with Matt about worker mental health in general. But now's the time we want to take a deeper dive into the lives of one group of workers, our frontline heroes. The last 3 months have been excruciating, as we've talked about today. So many of us have suffered from varying levels of anxiety, fear, and depression. But no groups had to take on more than our healthcare workers, who are enduring the unprecedented experience of providing modern care during the COVID-19 pandemic. Many have been working increased hours, days, and nights with increased exposure and risk for themselves and their families. And every day they are witnesses to tremendous human suffering, to grief, and to unprecedented loss of life. As we know, this can have a substantial impact on the mental health and well-being of our healthcare providers. But healthcare workers don't always get the help they need. You know, time's short for them, and just like the rest of us, they often struggle to find a therapist who can see them and who takes their insurance. In addition, although employer resources are often available for many, there are also concerns that the stigma for reaching out for help could have career consequences. With that as a backdrop, the Emotional PPE Project was born. This innovative program gives help and hope to many and has received lots of press. It was recently highlighted on the Today Show. Let's take a quick look.
We are back with a new normal this morning and a serious issue that's affecting the frontline healthcare workers who have been the face of the coronavirus pandemic.
That's right. The emotional toll it's taken on them is being called a public health emergency. But there's an innovative program working to change all that. NBC medical correspondent Dr. John Torres explains.
I just don't sleep well anymore. You just don't know what you're going to walk into, but you know it's not going to be good. And you know people are going to be really sick and you feel helpless.
Kristen Darrow is an ER nurse outside Austin, Texas. The state is experiencing one of the worst outbreaks in the country.
It's overwhelming and it's scary.
For Darrow, her excessive worrying about catching the virus has led to sleep issues and burnout.
This is something that can take away my livelihood and something that I can take home and give to my family.
Her case is not unique. Even before the coronavirus pandemic, healthcare workers were experiencing burnout at higher rates than many other professions. 2 recent surveys reveal 62% of nurses and 42% of doctors feel burned out.
Prior to COVID, healthcare workers had disproportionately high rates of suicide, of substance and alcohol abuse, and of mental health issues.
Dr. Dan Sadawi-Konefka is a critical care doctor in Boston, where the pandemic overwhelmed hospitals, taking a major toll on his medical residents.
One of my trainees called me in tears because she had made the really tough decision to send her son to live with her parents in Chicago, but not knowing when she would see him again.
In April, Dr. Sadawi-Konefka and neuroscientist Ariel Brown found an innovative way to help. They created the Emotional PPE Project, connecting therapists directly with healthcare workers in need.
Emotional PPE we see as protection from the psychological effects of the pandemic.
Now, with over 400 volunteer therapists, the project is free and requires no insurance. Most importantly, it works around healthcare workers' schedules and is confidential, so they can avoid any stigmas or repercussions for seeking help.
We need to do whatever we can to break down barriers for healthcare workers to feel comfortable accessing care.
Nurse Doro, only a few sessions in, is already seeing the benefits of asking for help.
You find once you get starting to talk to someone about this and really work through things that it's helpful.
Supporting healthcare heroes in their fight against coronavirus.
MHA is excited to have Dr. Ariel Brown and Dr. Daniel Sadawi-Konefka, the founders of the Emotional PPE Project, with us today. I recognize those faces now. Yeah. Dr. Brown, in addition to being co-founder on this project, is also an associate director of medical science at Sage Therapeutics. Ariel is a neuroscientist who has done research on the brain around ADHD and bipolar disorder and helped develop the first drug approved for postpartum depression. In addition to the Emotional PPE Project, Dr. Sadawi-Konefka wears many hats. He's the program director of the anesthesia residency at Mass General Hospital, Harvard Medical School. Daniel is a practicing critical care physician and anesthesiologist at Mass General and the program director of the anesthesiology residency at MGH and oversees 80-plus resident physicians. Welcome, both of you.
Thank you. Pleasure to be here.
It's great to have you. Let me start off by saying thank you. What an incredible project. Maybe, Ariel, you could take the first question. For those tuning into the event and hearing about the project for the first time, tell us how it came to be.
Yeah, absolutely. First, before I get into that, I will say thank you to Paul and to MHA for having our tiny grassroots nonprofit in this incredible lineup of the conference. So we really, really are honored. But for the question of how that organization got started, so it really was just a conversation between Dan and me. And as you mentioned, Dan is the program director of anesthesiology residents at Boston Hospital. And he is really dedicated to supporting the well-being and the emotional lives of residents who are at a very, a very raw time in their career. And when COVID hit, that became a giant priority because, it was, it's a hard transition. It always was a hard transition, but, going into the battlefield of COVID ICU is like nothing else. So I asked Dr. Dan, my neighbor and friend, how I can help. And he said, what do you think about maybe getting these folks some additional emotional support? And I said, sure, I've got a big network of therapists, both professional and personal networks. So I reached out and I had a giant outpouring of support. So, throughout this journey of starting this organization and of building, it has become, the sort of hope that I get from it and the lessons that I'm learning are, everybody has something to give. And there is a lot of goodwill out there right now. So, it started with me reaching out to therapists sort of running and saying, yes, I want to help these folks who I know are heroes on the front line, and I've got this skill set to provide emotional support. So I will volunteer my time. And then from there, it really snowballed. I realized that if I was going to, connect these interested volunteers with the folks in need, that we really needed an infrastructure, an organization. And, here we are today in the beginning of September, and after only 4 or 5 months, we have a giant volunteer network across the nation of about, right now, it changes every day, but we have about 450 volunteer therapists that are willing to, they're actually saving time in their practice to give pro bono support and pro bono therapy sessions to healthcare workers in need. So anyone who calls up, there's going to be someone there that can, that will see them.
That's just incredible. That's really so great. And Dan, I mean, you're a frontline worker yourself, and I'm not sure everybody appreciated because of the attention that New York got, just how hard this hit Boston in the springtime as well, and the frontline healthcare workers there. So talk a little bit about what the last several months has been like. What's it been like on the ground and at Mass General and elsewhere?
Sure. So we are about 1,000-bed hospital. I think we have capacity for around 110 plus or minus ICU beds. And at our peak, we were close to 180 patients who had COVID and were in ICUs. That means that we had multiple surge units, makeshift units that we were putting together to try to meet the need. In terms of what it was like, I think it's important to consider what we have as a baseline. So the baseline in healthcare is that healthcare workers really don't take care of themselves at all. We have higher rates of depression, higher rates of suicide, extremely high rates of burnout. And as you mentioned, there are a lot of barriers to people seeking help. So when COVID hit, it was we were just primed for a lot of suffering, and it came in a lot of different ways. And I think everyone experienced a lot of different emotions in different quantities. Some of the things that people experienced were uncertainty. It can be quite nerve-wracking, especially when you were staring down the start of a tidal wave, not knowing how big it was going to get and what it would look like. A lot of people had fear for themselves, fear for bringing things home to their families. I myself lived in my basement for a couple months, and I was very fortunate because I had a basement where I could live. I think you saw in the Today Show clip, a lot of my residents, a lot of my fellows had to make the extremely hard decision to send their children away to live with relatives out of state. And couple that with the uncertainty of what was coming, they were doing that, not knowing when they would see them again. Other issues that people faced and are continuing to face are isolation from being separated not only from their family sometimes, but from social networks. I think there's a lot of fatigue that comes into this as well through increased work hours, and also just cognitive fatigue from learning different roles and different ways of caring for patients. There are also things that come from, I'll just call it frustration. We see there are some parts of frustration that I think are for all healthcare workers in terms of maybe it's displacement around institutional decisions and so forth, but frustration also with a lot of what we see in the national scene around maybe people assuming that this is a hoax, or really not understanding because they don't see firsthand the consequences of this, and it's hard to fault them, I suppose, if they don't see it firsthand. But as a healthcare worker who's really giving so much of themselves to fight this, it's hard to turn on the news and see that sort of response. I think another thing that, and this was particularly hard for me, was the grief. We are used to seeing people on some of their worst days, and we can't save everyone. That was certainly the case for COVID. And the really, really tough part, I think, for a lot of people during COVID is that visitation policies make it really difficult to have the typical conversations we would have with families, to give them the updates that we would normally have. We are doing them on Zoom or over the phone. And it really lacks that human touch, which I think is important not only for patients and families, but for us as well. And when it comes to end of life, there's a way that we typically have things, and it's never a happy time, but there's sort of a way you can bring families together. They can spend time with their loved ones. At the peak of COVID for us, and I assume this is where a lot of places around the country are now, there are pretty restrictive policies around how many people can visit. I remember, without going into too much detail, having one patient who it was clear that they were not going to make it, and I was talking with her husband. And at the time, our policy was that one person could come in for end of life. And he asked me, how do I pick which one of my children gets to say goodbye to their mother? And there's really no good way to answer that. So, and forgive me, it's hard to tell that story without feeling it. But you take all of those stressors, the uncertainty, the grief, the isolation, the fear, the fatigue, the frustration, and then couple with that the fact that all of the normal outlets that healthcare workers have, just like the rest of the US right now and around the world, those are gone. We don't have the ability to go to the gym. We don't hang out with friends. It's quite the recipe for a mental health crisis.
I'd like to hear you both on this. It's just, Dan, the picture you've painted just now is just so, emotionally gut-wrenching for me to hear, and for so many. And yet many people think that, they have to keep it together for their patients, many of the frontline workers. So they don't want to take care of themselves first. Do you, in all of this, self-care becomes really important. So is it hard, both of you, Ariel and Desmond, hard to convince people to take advantage of self-care? And this emotional PPE project, how's it making it easier? If it is.
Yeah, so I'll talk a little bit about that. We are, and by we, I mean physicians, nurses, healthcare workers in general, we are notoriously horrible at taking care of ourselves. And I don't just mean mental health, I mean anything. There's the old dogma in medicine where if you cough up a lung, you shove it back in and get back to work. And like I was saying, that sort of, I think, ties into the fact that at baseline, we have extremely high rates of burnout and depression. And, it's a little ironic that though we are so attuned to the symptoms of COVID, most hospitals now have daily symptom screens that healthcare workers have to fill out. Like, are you having a fever? Are you having muscle aches? Because the normal culture is just to ignore those things and go care for your patients. And that's for physical symptoms. The idea that we would then tend to mental health symptoms or emotional symptoms really becomes something that's quite foreign to people. It's quite a culture change. And I think it's something that we're seeing traction with, but it's a huge barrier. I think all too often one of the biggest barriers that faces healthcare workers is that they think they don't need help, that they have these low-level symptoms, they're a little more irritable, or maybe they can't sleep as well, or maybe they're having more wine with dinner, and they tend to just ignore these things. But I think there's symptoms of something that could use help, and I think we've seen some pretty serious cases, in terms of suicide cases that have made national news. But even just way short of that, I think by ignoring the small symptoms, we're not operating at our peak potential. We're not serving ourselves well. So maybe I'll pause there and ask Ariel to talk a little bit about how to answer the second part of your question, how the project is aiming to help break down some of those barriers.
Yeah, absolutely. Thank you for that, Dan. I mean, I think just to add also, I know myself, you know, I have several jobs. I have 2 small children. I try to do a lot, but I know that I cannot do any of it well unless I do my self-care routines. And for me, that's about exercise, and it's about connecting with other people by phone, by Zoom, any way I can that, you know, it's physical distance, but not social distance. That's what I actually heard earlier during the conference, and I really like that. So, you know, and similarly, I think, how can a physician or a nurse or, you know, a home health aide do a better job if they are not taking care of themselves and being the best version of themselves? So, I agree that, you know, whatever we can do to break down that culture in healthcare workers of, you know, realizing that it's not actually weak to ask for help. It's actually an act of strength. So what emotional PPE does is it really makes things as simple and streamlined as possible. So I think that, you know, some people may want to ask for help, but they are concerned about the very real personal, professional consequences that can come from it. They don't have time, energy. I mean, I know I was actually just speaking with someone today who lost their sister, and she's looking for a therapist. And she says, I just have spent so much time on the phone trying to find a therapist. I've given up on trying to find someone that takes my insurance. Now I'm just looking to pay out of pocket. I just need to talk to someone. So, you know, what Emotional PPE Project does is it takes away the barrier of time, of search, of needing to find a match that takes insurance, of needing to find a match that fits the time, the flexible schedule of very busy healthcare workers. There's also the piece that there are a lot, as I mentioned, of sort of personal and professional barriers. So on the personal side, I believe as Dan, you know, mentioned, there's a lot of fear. And from when we started this program, we've been hearing this word weak, weak, weak over and over. I'll be perceived as weak. They'll think I can't do my job well. I'm not going to be able to take care of my patients well if I you know, let this piece of myself, this sort of, you know, emotionally raw piece of myself out. So, you know, one thing that I think has been a great success or made the service a great success is that we are entirely 100% separate from any institution that employs healthcare workers. So, you know, we get the question a lot, well, why don't healthcare workers just use their, you know, hospital EAP services? So these services that are associated with their employment institution, you know, you can just call them up and they'll help, right? Why don't they use that? But the fact of the matter is, healthcare workers don't want to mix their emotional support in their workplace because of this culture that we've talked about, and because of the fear of seeming weak or not being able to do their job. You know, the other piece of it too, and this is actually some ongoing research that Dan and I and others are involved in, are the question of professional consequences. So when a doctor or a nurse or any other healthcare worker that's licensed wants to practice, they actually need to apply for a license. So, you know, there are, for instance, for physicians, there's physician licensing boards in each state. And a majority of the states ask questions about mental health history. And it's very explicit in the applications, in many of the applications, that if there is a mental health history, that could impact the ability to get a license, to practice, and to not have that license be limited. I think, you know, what ultimately that does and what the research shows is that it discourages people from asking for help, because the idea is if you go to see a therapist and you, for instance, get a diagnosis of seasonal affective disorder, if you want to be licensed to be a physician in Alaska, you have to disclose that, and it becomes public record. And so why would someone go see a therapist if it could actually end up limiting their ability to practice and ability to really, you know, to continue the career they've dedicated their lives to? So, you know, this is what Emotional PPE does, is it sort of takes all the like paperwork of this sort of paper trail of that I think contributes to the fear out of the picture. So it's really a service that is just, you pick up the phone, you call a physician, they serve you, you call a mental health practitioner, they see you for free, and there's the help.
You've both done a very good job of anticipating, a number of the questions I was going to ask you by really giving some very complete answers about this. And I think clearing up a lot. I'm wanting to thread in a few questions from the audience as we have limited time here as we go. So I thought maybe at this point I would just turn to one that has come up, and that is somebody who's asked us in terms of thinking of the families and how healthcare workers' families are also affected. Are the families able to receive services through this program as well?
So right now we are in the very beginning stages of the organization, and we are focused on healthcare workers. We have had a lot of people reach out wanting to that are really in need. I mean, I think as we've heard over and over throughout this conference, this is an unprecedented time of an epidemic of mental health. It's the pandemic within the pandemic. So what our vision is that we hope to expand as much as we can. Right now we have a mission to serve people in healthcare related positions and to advocate and educate about their mental health. I absolutely, if I could serve everyone, if we could serve everyone, we would, and maybe we will. But right now I think that we've got a system that doesn't serve everyone. And we are sort of a Band-Aid for the healthcare workers, and hopefully other Band-Aids will come up to help serve others. I mean, a new thing is teachers, right? We have teachers saying, I mean, I can't imagine the stress of being a teacher or a school administrator right now. So, if you're interested in starting a similar project, I'd love to partner with you. I think right now emotional PPE is, we're concentrating on building and then hopefully broadening.
Well, just one question along those lines, Ariel, and then I've got a different one for Dan. But so if you are a mental health practitioner happening to hear this, how would they get involved if they want to be part of that group of supporters and helpers?
Absolutely. So the website, so pretty much everything about our organization is online on our website, emotionalppe.org. And if you are a licensed mental health practitioner interested and available to give pro bono therapy to healthcare workers in distress, you can sign up there. So again, emotionalppe.org. On that website is also with a directory. So if you are a healthcare worker in need, you can go right on the website, emotionalppe.org, and you just find a therapist and reach out right away. And anyone else who's interested in supporting the cause, please go to the website and you can find out different ways.
Great. Hey, Dan, you mentioned burnout before. Somebody's asked if you've got some tips on dealing with burnout. I suspect that a lot of people in our audience today have been feeling some of those measures, maybe as intensely, maybe not as intensely, but feeling them anyway. So, tips for dealing with burnout when people are getting overwhelmed?
I'll give you my best advice, and I'll caveat by saying that I'm not a mental health expert. So this is just a friend to a friend type advice. I think if you're feeling down, talk to people. That's probably the most important thing. Don't think that you are alone, because you're not, and make sure that you discuss the issues with people. And if you need help, try your best to find ways to get help. There are plenty of barriers, but try your best to persevere. In addition to that, get sleep, make sure you're still eating, get outside, get exercise, all of the normal things that you can still do.
Are you guys having to manage state regulations around telehealth and telemental health services? If so, both of you or either of you, could you just help answer some of those questions that have been coming up in the chat?
Yeah, absolutely. So if you go to the website, emotionalppe.org, you'll see that anybody who wants to use it they will you search the directory by state. So if you live in Louisiana, you click Louisiana and you will find everybody in there that has license to provide telehealth for people that are in Louisiana. So the directory is set up by state with those regulations in mind in a sort of conservative way, so that, you know, it's just state, if you're having telehealth, if you're sitting in Louisiana, the person that you're seeing is licensed to practice in Louisiana.
Great. And Dan, what can employers at health systems do to better support their frontline employees from your perspective?
So I think a lot of them are trying their best. I think recognizing that there are a lot of barriers and that sometimes solutions may not be within their own institution, and finding ways to support creative third-party things like the Emotional PPE project are important. I think a lot of programs are setting up peer support projects, which involve training of healthcare workers, and I think that's quite valuable. I think it's a little bit different than getting therapy from someone who's licensed, but I think that is still helpful. And I think what those sorts of efforts do is help combat the stigma that is associated with seeking help that is of the emotional variety. So I think setting those things up, even if they're not heavily used, are strong messages that it's okay to not feel okay with things, and it's okay to ask for help.
What about policymakers? Either of you, Ariel, want to start? Any thoughts about what policymakers could do to make life a little easier?
Yeah, I mean, I think, again, like you guys have touched on it today, a number of these pieces. One is extending this flexibility around telehealth, because, you know, I mean, seeing somebody having to leave work and drive to see someone in your community that fits your schedule is a huge barrier, not just for healthcare workers. I mean, I know that personally, I've seen a therapist by telehealth in a phone booth at work, and I wouldn't have been able to see her otherwise. So there's the telehealth piece of it. I think there's also the parity piece of it, which I think, you know, we've been fighting for decades, and, you know, behavioral health coverage, and, you know, making that a priority and making it an equitable coverage with physical health.
I'll add to that if I can, just a little bit.
Yes, please.
One of the things that I think is highlighted by something that Ariel said before is that you know, a lot of people who have trouble in finding therapy because they don't have insurance that covers it, they end up trying to pay out of pocket. But what you end up establishing with that is the differences, the socioeconomic disparities in that the folks who are of means can now get help, and those who are not of means cannot. And so I think policymakers who could focus on that would really go a long way. Another thing that could be helpful from a policy standpoint also reflects something that Ariel was saying before, and that is that we actually still have a lot of licensing requirements that aren't really consistent with ADA regulations. You know, they're still asking about mental illness, for example, that doesn't relate to impairment of duties. So if there is a way to lobby for change at the state or federal level for that, those would certainly be helpful.
Helpful. Our time is beginning to run a little short, so I want to make sure I get to this question for both of you, which I know is of interest to some of the people in the chat, and that is, what are you two doing for yourselves? You both touched on this a little bit, but in these challenging times, what are you doing to help you?
So
Ariel, yeah.
Oh, sure. I mean, Dan, I'll just use Dan's and my friendship as a example. We are very silly people. And we try to have as much fun as possible. And I actually had to sternly warn him not to put up any funny Zoom backgrounds, or I would, you know, today. So I think, you know, I think Dan and I, and then other friendships and relationships, try to keep things as light as possible, and remember that we still have our full selves in the picture, despite the heaviness of the world around us. So, you know, the strengths that that I had before, I still have, even though they're a little bit harder to access. So, you know, I mentioned before too, I'm, you know, like exercise and meditation, self-care, and you know, friendships. And again, physical but not social distancing is that's a big piece I'm taking away from this whole conference.
For me, it's all of the above, and then also I use EPPE. So I've met with a therapist a few times, and I found that to be extremely helpful to sort of talk through all the emotions that I was feeling and try to categorize them and help process things as they come in. Another thing that I find extremely helpful is to recognize what I can be grateful for, and there's so much I can be grateful for. I think there's a lot of good around us, and it just doesn't take but a moment to stop and look and recognize it, and I think that helps lift me up when I'm feeling down.
Man, thanks for coming back to gratitude, Dan. That came up earlier today too. And I guess I'm at final question, and final question is, Dan, so what is your favorite Zoom background to use when you're on calls like this? It can't be the one that we're seeing.
Ariel, do I have your permission?
Fine. I mean, you know, we're already.
There you go.
Let's
it's
see
me
it.
as Captain Marvel. Yep.
Yeah. Oh, thank you, Paul, for allowing that.
Anybody who was looking carefully at it got to see it.
Yeah.
Subliminal
And, you know,
superhero.
Captain Marvel sounds very apt and very for both of you, really. Just thank you for what you're doing. These are tough times, and you know, we're always looking to give hope here at MHA. So ending on that bit of a positive note and giving people a chance substantively over the course of this past half hour or so to learn more about this program means a lot. And so thank you very much for doing this for us.
Thank you so much for having us.
Thank you.
Thank you. So, to learn more about the Emotional PPE Project and to read more about ways you can help, please go, as they've said, to emotionalppe.org. Next up on our agenda, we will hear from the 20th Surgeon General of the United States, Vice Admiral Jerome M. Adams. Dr. Adams's mission is to be the nation's doctor, to advance the health of the American people, and his motto is better health through better partnerships. In this capacity, he oversees the operations of more than 6,000 uniformed health officers in the United States Public Health Service, who serve in nearly 800 locations around the world, promoting, protecting, and advancing the health and safety of our nation. During his tenure, Dr. Adams has created several initiatives to tackle our nation's most pressing health issues, including the opioid epidemic. Dr. Adams issued the first Surgeon General of the United States advisory in 13 years, urging more Americans to carry naloxone, an FDA-approved medication that can reverse the effects of an opioid overdose. He also released Facing Addiction in America, the Surgeon General Spotlight on Opioids, and a digital postcard calling for a cultural shift in the way Americans think about, talk about, and respond to the opioid crisis. Please join me in welcoming Vice Admiral Jerome Adams.
Thank you, Paul, and to the Board of Directors and Network Affiliates of Mental Health America for the opportunity to join you, and even more for the work that you all are doing every day to protect and improve the mental health of all Americans. These are truly unprecedented times. The COVID-19 pandemic has hit us hard, especially people of color and those who are older. And as you well know, the reasons are many and are rooted in both social and medical conditions that conspire to reduce resilience, opportunity, and health, including mental health. When we think of the pandemic, most of us immediately think of healthcare. And as critical as healthcare is, we know that health actually begins at home, in communities designed to provide income and financial security, education, access to transportation, safe places to be active and healthy, affordable food and housing, and all of these things must be provided free of structural and institutional barriers related to race and bias. What we've observed in COVID-19 are the significant gaps in both equality and equity in communities when it comes to these social determinants of health. These social determinants contribute to medical determinants, chronic diseases such as diabetes, lung disease, and high blood pressure. It should be no surprise that these diseases are especially common in people of color. Social determinants make individuals more susceptible to infection with COVID-19, while the medical determinants are associated with more severe COVID-19 complications and more deaths. For example, we know that social distancing and teleworking are critical to preventing the spread of coronavirus. Yet only 1 in 5 African Americans and 1 in 6 Hispanic Americans have a job that allows them to work from home. People of color are more likely to live in densely packed urban areas and in multi-generational homes. They are also more likely to use public transportation. And these factors create a greater risk for spread of a highly contagious disease like COVID-19 and make it harder for people to isolate or quarantine if they have been exposed to or diagnosed with the virus. So it's no surprise that we've seen American Indians and Alaska Natives and African Americans hospitalized at rates 5 times higher than whites. Hospitalization rates are 4.5 times higher for Hispanics compared to whites. This virus is exploiting and exacerbating pre-existing health disparities, and these disparate outcomes and unequal opportunities to be healthy are part of the anger and frustration and the fear manifested in protests around the country. Put simply, health equity is social justice. That's why I've made it my mission as Surgeon General, long before COVID-19, to emphasize the importance of both mental and physical health for all. In the midst of this pandemic, it is clear that each merits attention and action. Unfortunately, we are only beginning to learn about the true impact of this pandemic on the mental well-being of Americans. As of June, more than 88,000 Americans have developed symptoms of anxiety or depression related to the stressors induced by COVID-19. With that in mind, the time is now to invest in prevention and early identification to get people the help they need and deserve. We must address the fragmentation of systems and apply what we already know works to save lives. The ripples of this pandemic have altered healthcare delivery and access to mental health services. And because of that, I'm deeply concerned about the consequences on the well-being of our citizens, no matter the color of their skin. We know that stress can also worsen substance misuse. Turning to substances such as marijuana and alcohol is a way people try to cope. These stressors pose additional risks to mental health, but we know that our emotional well-being and resiliency can act as protective barriers against them. By focusing daily on caring for our own emotional well-being and supporting the well-being of those we love, I know we can successfully mitigate the mental health effects of COVID-19. That's why I remain steadfast in encouraging Americans to use healthy mechanisms to cope and to band together to practice the tried and true habits that will keep us safe and healthy in mind, body, and spirit. Now is the time to reach out to friends and family, especially those who may live alone. Whether it's through a phone call, a video chat, or a socially distant and responsible get-together, remind them that you were there for them. And please, know that it's okay to ask for help. SAMHSA's National Helpline has trained counselors standing by to take your call at 1-800-662-HELP. The helpline is free, confidential, and available every day of the year, no matter the time. I want to applaud Mental Health America for the incredible work you've done during the pandemic. You're leading the way in prevention and in early identification of mental illness. For example, the Mental Health America online screening program is an outstanding example of how we can leverage technology for improving preventive health. The Before Stage 4 philosophy represents how we as activists, healthcare professionals, and policymakers must address mental health using a prevention framework. I want to close by coming back to the COVID-19 pandemic. While it's been a challenge and we're still discovering what this novel virus is and does, it's important to note that we've learned so much about this virus in the last 6 to 7 months. We know who is most at risk and why, as well as how to protect them. When it comes to mental health, we know that social isolation while great for reducing the spread of COVID-19, can be devastating for many individuals who lose touch with loved ones and the routines and interactions that help support their mental well-being. It's critical that we support one another. We know much more about how to treat those most severely affected. We know that we must address the underlying drivers of disparate outcomes, those social conditions that can either limit or unleash a healthy future. We know what works to keep people and their communities safe and have launched an aggressive messaging campaign called #COVIDStopsWithMe. I ask that you visit my Twitter account @Surgeon_General to watch the video and share it within your organizations, networks, and with your loved ones, because I need your help in spreading the word that our health, our nation's future, is literally in our hands. And I want to leave you with my mantra, the 3 W's. Number 1, watch your distance, meaning stay at least 6 feet from others and avoid crowded indoor spaces. Number 2, wash your hands, what your mother always told you. And number 3, wear a mask. Practicing the 3 W's will help us reopen, rebuild, and restore our mental and physical health, our relationships, and our communities. Again, thank you for having me today. I believe we have the opportunity now to reinvent a nation that is more resilient, more equitable, and healthier in body, mind, and spirit. This will require our best work, and I look forward to realizing this future with you together.
Thank you, Dr. Adams, and thanks to everyone who's joined us today for day 1 of Mental Health America's 2020 annual conference. Pam keeps telling me to pull my collar up, so I'm pulling it up here. Make sure I still look good at 5 o'clock in the afternoon. You know, the sun's shining brightly in Middletown, Connecticut right now, and I hope that we've been able to shine a little light on some of the issues we've all been facing in the face of this incredible pandemic and all of the social change that's been occurring. And I hope you found these conversations as engaging as I have. And this is just the beginning. We've got plenty more on the way tomorrow, unfortunately, without a lot of long breaks. So prepare your lunch in advance and prepare for another great ride with another great set of sessions, because we need to be talking about all this week especially, when so much in our nation seems so surreal, to talk about how COVID-19 is impacting not just the physical health, but the mental health of young and old, how the presence of racism and its connection to health disparities have traumatized generations upon generations, and to try to figure out how to move forward again, together again. How we can come together to change the status quo, to fight in the open, as our founder Clifford Beers once said, and to help those who need and are asking for our help. Our children, our families, our workers, our friends. I hope to see you again tomorrow for day 2 of the conference. We have another packed day for you, and we will start promptly at 10 Eastern. You'll be able to log in as you did today to hear from even more amazing speakers, including some amazing young advocates, Grammy Award winner Michelle Williams, NBA star basketball player and mental health advocate Kevin Love, and Professor Ibram X. Kendi, author of several books, including How to Be an Anti-Racist. You won't want to miss a minute. And in the meantime, if you are looking to get an early start on your holiday season shopping this year, or just want to get and give some cool merchandise to someone you care about, you can visit our MHA store, which you can access online directly from our website at mhanational.org, or our I Don't Mind store, which you can access directly at idon'tmind, all one word, idon'tmind.com. Stay safe and have a great evening.